Good morning. Really nice to see you all. There are lots of seats over this side if anyone's still looking for a seat. And it's really nice to see some people in the front row. Plenty of seats over here. Good morning. The clock has ticked round to 9:30, and this is the 10th GambleAware conference. Apparently, some notes were found from that decade ago, and it had my name on his chair. And I can tell you that at 9:31, this is the first one that's ever started on time. So, welcome. Thank you very much for being here on time. Thank you for being back in this room, which is absolutely brilliant. I do remember from years gone by that this room has a bit of a temperature differentiation problem, i.e. there are cold spots and hot spots. So if you get really cold, please let me know. And if you get really warm, we'll probably be able to tell because you'll faint in the front row. But please let us know whether or not you need some temperature adjustments as we go. Okay, I'm your host for the day, Liz Barclay, and I'm a former trustee of the Responsible Gambling Trust, which was the forerunner of GambleAware, which is why I'm here. The theme of the 10th annual conference is taking action to tackle gambling harms as a public health issue. So we will be concentrating very much on the public health side of this agenda. And we're hosting a hybrid event today. There are 400 people registered, which is utterly amazing. But we must remember that many of our delegates are joining us online. So just to share a little bit more information about me, I started off my career as a debt advisor, and a lot of my debt clients had gambling issues. And that's when I first became aware of the problem and interested in the issues. I became a journalist, a personal finance journalist, and again, following some of those issues during those years, and I'm now the Small Business Commissioner for the UK. I'm not here with that hat on today, but small businesses have always been another one of my passions. A bit of housekeeping before we start. There is no fire alarm scheduled, so if there is one, then please, we have to follow the instructions, which are to make your way to the nearest fire exit, and there are 3 in this room, if you just notice the green notice above the doors. Delegates with limited mobility should wait at the safe refuge areas located in every lift lobby, which is therefore out there, and await assistance, and we can assemble on the pavement of Chandos Street, and that's directly off Cavendish Square. There will be people leading the way. If an incident occurs, there are first aiders at reception. The ladies and gents are located on the ground and lower ground floors, so if you go that way, you will find the loos. The Wi-Fi login is 11 Cavendish SQ. 11 Cavendish SQ. The password is brick red, should you need it. And the conference hashtag for the day is #GAConference22. So for those online, if you experience any technical issue, please put a question into your Slido box, and one of the technicians, one of the technical team will try to answer that as quickly as possible, and you can pose your questions for the day on the same on that same box. You will find it if you scroll down. You will find the question box on your screen. The 10th annual conference is a varied agenda. It's also a packed one. So I have got my head girl approach on today. My job is to try to keep this on time. I was trying to remember this morning, was I actually head girl, or have I just made that one up as the years have gone by? But I warn you, we will be moving at pace, and I won't be giving you a lot of biographical details. You have those in your on the online portal. So I will be giving a very sketchy introduction to each of the guests. We've split the day into a mixture of presentations, panel sessions and conversations. There will be panel sessions on children and young people, breaking down barriers, taking a targeted approach to prevention and treatment, and delivering a holistic approach to address gambling harm. We will be welcoming the Gambling Minister, Paul Scully, the Shadow Minister, Alex Davis-Jones MP, the Chief Medical Officer for England, Professor Chris Whitty, who some of you eagle-eyed members of the audience may already have spotted, and we will also be welcoming the Chief Medical Officer for Wales, Sir Frank Atherton. And during the breaks, there are poster presentations outside for you to have a look at. Without further ado, I am going to introduce the Chair of GambleAware, Baroness Kate Lampard, CBE. The last time we were here, she only had the CBE. This time, you may have noticed that the Baroness has been added. Kate, as well as Chair of GambleAware, is a lead non-executive director for the board of the Department of Health and Social Care and has been awarded her peerage for both of those activities. And congratulations, Kate, and please join us.
Well, good morning, everybody, and a very warm welcome to GambleAware's 10th annual conference. We're pleased to have reached this important milestone, and it's wonderful to have so many of you here, whether in person or many of you who are online. This year, the conference is focused on the theme of tackling gambling harms using a public health approach, working through 3 tiers of prevention. Gambling harms are constantly evolving. The rise in online gambling, coupled with the growing cost of living crisis, is putting more people at risk of experiencing gambling harms, as well as impacting their partners, their families, their friends. And we believe that to address this, it's vital that we implement a public health approach, and that's why we've chosen this theme for our conference this year. It's important to note what we mean by public health approach. Ultimately, it's dependent upon effective partnership between organisations in the statutory and third sectors. Only with this collaboration can a whole system approach be adopted, which focuses on early intervention, prevention, and addressing and reducing inequalities. And that's why I'm very pleased that we're all here today, so that we can explore how we can all work together to deliver this public health approach. Since our last conference, a huge amount has happened at GambleAware. Over the past 12 months, we've embedded a public health approach in all our work. And we've done that through the delivery of our major public health campaigns, such as our Women's Prevention campaign and our Safer Gambling campaign around the World Cup. In addition to this, we undertook the recommissioning of our National Gambling Treatment Service, which is aimed to drive up a regional first approach. This is a huge step forward to ensure there's an infrastructure in place to deliver an integrated and place-based service that will help us address inequalities and ensure that there are strong partnerships in place at a local level. Other highlights from the past 12 months include the launch of the Aftercare funding programme. That system is vital to deliver a successful public health model to support providers to offer longer-term services and ensure that people who've experienced gambling harms have a sustained recovery. Throughout all our commissioned activity, we ensure that those with lived experience of gambling harm are able to inform and engage with our work. And as part of this, we've recently created a new Lived Experience Council, and I'm very pleased to see some members of it here in the audience today. We continue to work with the Gambling Lived Experience Network, that's called otherwise GLEN, and also the Affected Lived Experience Research, Treatment and Support Group, that's ALERTS. This engagement helps ensure that communities of people with lived experience of harms associated with gambling can provide direction and expert advice to GambleAware's activities, programmes and strategic development. And this has all been whilst meeting the unprecedented needs arising from the cost of living crisis. We're committed to doing our bit to address this crisis, and central to this work was the launch of the Community Resilience Fund earlier this year. This programme of work provided short-term funding to communities across Great Britain, exacerbated by the cost of living crisis. And these are just a few examples of our work. We look forward to continuing this important work alongside those of you in the room and online over the course of next year and beyond. Since its refresh in 2021, we've been continuing to progress delivery of our organisational strategy, which is focused on 4 key commissioning objectives. They are to increase awareness and understanding of gambling harms, to increase access to service and reduce harm inequalities, to build capacity among health and community services so that they're better equipped to respond to gambling harms, and to improve the accessibility and effectiveness of the National Gambling Treatment Service. Underpinning all our work to achieve these objectives is our public health approach. This approach aims to reduce disparities and ensure people get the support that is specific to them and their needs before they experience serious harm. Our approach combines the promotion of a safer environment, selective interventions for those at risk of harms, and targeted support for those directly affected. Using this public health approach and collaborating with the organisations attending this conference, we're pleased to have made great strides this year towards meeting our vision of a society which is safe from gambling harms. And this vision, I'm sure, is one that we all share. As the convener and commissioner of third sector education, support and treatment services, we know we have a vital role to play in prevention and early intervention. This year, we've continued to expand targeted support services for those directly affected by gambling through the National Gambling Treatment Service. Its recommissioning designed a new regional first approach across England, Scotland and Wales. And this has accelerated progress in local level action. Integrated place-based services delivered by local providers, healthcare professionals and communities are central to an effective public health approach. And we look forward to assessing the impact of this very significant redesign over the coming years. Looking back over the past 12 months, our recently published annual statistics for 21 to 22 show that great work has been done in the last year. We saw that of those who completed their scheduled treatment, 92% showed an improvement in their harmful gambling behaviour, and 86% showed an improvement in their psychological well-being. Encouragingly, there was a fall in those accessing more advanced treatment, but an increase in people accessing the helpline and other early support services. And we're glad to be seeing people seeking treatment and support early on. We believe this is prevention in action. These positive signs are a reflection of the collaborative work of many people attending the conference, and the work is all the more important given the ongoing cost of living crisis, which we are concerned will create a greater storm of gambling harms. Our recent research has shown stark indications of this link. Our women's campaign research showed that 1 in 4 women aged 18 to 49 who gamble expect to gamble more in the coming months due to the cost of living crisis. Our research ahead of the World Cup showed that among those likely to bet on the World Cup, 39% said that financial pressures may drive them to gamble more than they intended. This is all the more worrying, as these people are most likely the people who are most likely to be impacted by the cost of living crisis are those most at risk or already experiencing gambling harms. People who live in the most deprived areas are 3 times more likely to experience gambling harms than those in the least deprived. Alongside commissioning the third sector, we've had a public health lens on our campaigns, shining a much-needed light on risk areas and supporting behaviour change in key vulnerable groups. Today, you're going to hear about important research which is currently underway, looking at the disproportionate impact that gambling harms can have on minority ethnic communities. We can look forward to sharing the detailed findings of that with you in the new year. We also know that one of the key barriers to people accessing treatment and support is stigma. Next year, we're excited for the launch of our ambitious major new public health behaviour change campaign, which will break down and reduce stigma associated with gambling harm. We look forward to taking on this challenge and beginning to reverse the stigmatising beliefs held by individuals, policymakers and the public on the issue of gambling and gambling harms. Clearly, action on all fronts is needed now to address the impact that gambling harms are having on communities across Great Britain. Addressing the stigmatising of gambling and gambling harms in research, interventions and in the public perception is, in our view, vital. We believe that a public health approach is the best way to achieve this, and we look forward to hearing your insights on this throughout the day. Ultimately, however, this cannot be achieved without the right national leadership, policy, and regulation. This would provide a strong prevention framework and appropriate funding for education, prevention, and treatment services. This is the first step to ensuring that gambling harms are seen by everyone as a critical public health issue that can affect anyone. The Gambling White Paper provides the opportunity for national change. However, its continued delay is creating uncertainty, not only for service providers, but we're also concerned about the effect this delay is having on those directly impacted by gambling harm. The longer the status quo is maintained, the more people are going to be at risk. So we look forward to the publication of that white paper in the coming weeks. But waiting for the publication of the white paper and subsequent consultation and legislation should not and will not hold us back. At GambleAware, we'll continue to do everything we can to support the provision of high-quality services, run impactful public health campaigns, and engage with decision makers to drive the policy change we need. We understand the important role we have to play as a strategic commissioner and system leader in supporting better outcomes, and we are committed to doing that. But GambleAware is just one piece of this puzzle. Partnership with the statutory and third sectors is vital to the public health approach, and collaboration between those of us who share a vision of a society which is safe from gambling harms is critical. And so today I invite you to share and discuss what we can all do to take and secure a public health approach to tackling gambling harms. So once again, I thank you all very much indeed for attending, and I thank those who've joined us online, and I hope you find it a very valuable day. And now I am left with the delightful task of handing over to Professor Sir Chris Whitty, the Chief Medical Officer for England. He is someone to whom I think we have all had cause to be grateful for his invaluable work over the last couple of years. And I'm just very grateful to you, Chris, for taking the time to come and talk to us. Thank you.
Thank you very much. And thanks to everyone who's here. I'm really just going to build on a few of Kate's points, and it's really almost as a sort of lead-in then to the next session, which Dr. Ellie Cannon's leading with people with lived experience, because I think it's really when you get down to the individual experience that you begin to realise the severity of the harms that are caused. But I think I would just like to kind of set out some idea of the scale of the issue. Gambling clearly is a serious public health issue. To give some idea of the numbers, let's start off with the Health Survey for England. That estimated that around 246,000 people, so almost 250,000, had problem gambling. That is something which is actually affecting their family or their lives. And if you extend that out to those who are affected by those people, running into debt and other problems, we're talking about numbers around about 3.6 million people in the country. That is far greater than I think is widely recognised. And that is because gambling, as opposed to many other issues, is a hidden problem. And a lot of that comes from the stigma that is associated with it and the fact that there aren't sort of external markers of it. But this is a big problem in terms of numbers. But what actually multiplies this is the fact it is very heavily concentrated in those who can least afford to be in this situation. If you look at the map of who died of COVID, look at the map of who dies of lung cancer, look at the map of people who die of alcohol-related harms, look at the map of people who do not have enough money to actually pay for heating and therefore will run into trouble this winter with heating crises. The map of gambling harms is very, very closely mapped onto that. So these people and these societies and their families are getting hit after hit after hit in the same places, the same families and the same communities, with a whole series of things that then multiply on top of this. So this is not just a problem in isolation. It would be bad enough if this was spread evenly across the country. This is a problem highly concentrated in the communities which are least able to actually withstand it. So that is the reason this is a very serious public health problem, because it's a multiplier effect of very many of the other harms we have. Now, it's also important to recognise that the harm of gambling is not just to the person involved, but to a lot of people around them, their families, obviously, but many other bits of their communities, and often people don't realise it's an issue until it's far too late, until intervention is really extremely difficult to achieve. And this is my sort of third sort of main point, which is therefore relying only on treatment, which firstly only picks up a fraction of those who need help, but secondly, we're too late down the path, is clearly not going to be sufficient. And we therefore do clearly need to prevent at a much earlier stage and across a very wide area. Now, I'd make two very strong points in addition to that. The first of which, and I suspect this will be picked up by Frank Aston when he talks, he's done a lot of work on this later, is the evidence base in this area is much weaker than in many other areas of public health. Therefore, we should do the things we are reasonably confident work now, but we should accept that we may well have to change those over time. And we should invest heavily, in my view, in trying to work out what are the ways we can address this. The second is that we should start off in those areas and those communities where we know the problem is greatest and we know the effect is greatest. So don't spread this evenly across the country. Start off in the places most affected, because that really is where we will have the biggest impact we can have. The final point I wanted to make, because really all I'm doing is simply setting out the scale of the problem, which the rest of this conference will be trying to address, is to make a very clear statement about children. There was a recent Ipsos Murray survey that showed that if you looked at people 11 to 16, so these are children, by anyone's definition, these are children, just under 1% of them already had problem gambling, and 2.4% of them were at an elevated risk. This is unacceptable under any understanding of gambling of any sort. So the final group I would really like to concentrate on is doing everything we can to move away from not just the most vulnerable people getting into this situation, and these often involve people who've also got coexisting problems with alcohol, with mental health problems, and in other areas, but to make sure that people experiencing gambling harms are never, ever children, and that basically means pushing this away from children as far as we possibly can. Now, obviously, the reason that all of you are here is because you're bought into this agenda, I hope. And that, it is important we also need to acknowledge that there are people who are within the industry who are not bought into this agenda, and we need to convince them that this is an absolutely essential societal need. I very much hope that the moves in the white paper and elsewhere will help to improve this and move it in the right direction. We'll be hearing from the Minister later. But really I think I've now said all the things I wanted to say, which is the extreme harm, the concentration of harm, the coexistence with other medical and mental health problems, and the need to push away from children. Thank you very much.
Thank you very, very much indeed, Professor Whitty, for giving us your time, and I think that is very, very clear. And the multiplier effect is something that I must admit that I have seen in the past and recognise what you say. Thank you for that, and that does lead into the next session. And can I please invite Professor Henrietta Bowden-Jones, OBE, Sam Starsamore and Leanne Downey to take the stage. And this session will be chaired by Dr. Ellie Cannon. Now, Ellie is the GP for the Mail on Sunday with weekly health pages that also appear on Mail Online, and a regular on-screen GP for various media outlets, asked to commentate on health issues across a wide range of media. Ellie, I will leave you to have your conversation with Henrietta and your guests.
Thank you, and thank you very much to everybody who's here and joining us online. We are talking with those affected, lived experience survivors from GambleAware, alongside Professor Henrietta Bowden-Jones. I think we will forego biographies because you have biographies of everybody within your programmes. I'm going to ask each member of our fabulous panel to introduce themselves and perhaps to give us, as an opening, really what a public health approach means to them. So, Leanne, please introduce yourself and give us an idea of what you think a public health approach means.
Hi, yes, I'm Leanne. I work for Bet No More UK as the Head of Support Services. I'm also part of the GambleAware Lived Experience Council because I have been affected by gambling harms as an affected other. So for me, having the awareness at a public health level in terms of gambling harms is so important, because for me, at the time of trying to navigate my partner's addiction, it was really hard for me to be able to access support, guidance, resources, to be able to get the best help for them, but also for me and the situation we were in. So I think raising awareness at a public level is really needed.
Okay, thank you, Leanne. Sam?
Yes, good morning, everyone. Lovely to be here alongside Leanne as part of the newly formed GambleAware Lived Experience Council. So similar to Leanne, I have direct lived experience of gambling harms. And this started at the ripe age of 16 quite frequently. And then everything came to a head at the age of 24 with some quite hideous suicidal ideations. And talking about that, at quite a high level, what a public health approach means to me, the first thing I did when I went out to seek support was walk into my local GP. I had no awareness of what support was out there, what treatment services were out there, and bless my GP, he didn't know what to do with me. He offered me a quite vanilla and blanket counselling programme, which had an 8-week waiting list. He offered me some medication, and I needed a bit more than that. I needed some signposts, I needed a plan. And I know there's a lot of work that's happened since 2017 on that. And we've got the GP awareness and training programme launching next year, which would be fantastic. But then there's a second part to that, which is the selected segment around, the aftercare part. And I know we've got a fabulous session with Richie and Lisa later on around treatment and prevention at that targeted level. But when someone does enter into recovery, it's really important that we ensure that we don't just let them go off into the sunset. People need to embed back into society. They've gone through years and years of turmoil and hardship, and I think we need a bit more focus and awareness around that that the aftercare part of things, which I'm sure we'll dig into a lot more today.
Yeah, okay, thank you, Sam. And Prof. Bowden-Jones, you're at the forefront of gambling clinics and obviously a consultant psychiatrist. Please tell us about your work and what this means to you.
Thank you so much. I wanted to also acknowledge the incredible speeches earlier on by Baroness Lampard and Professor Chris Whitty. I could not agree more with everything they both said. Forgive me, some of the things they said maybe also in my speech today. I've been coming here every single year for the last 10 years, since, in 2008 when I set up the first NHS clinic. So it's my first time here in my role as national expert, clinical advisor. So I will take this seriously, and I've been given 3 minutes. I'm going to use all 3 minutes, and I hope you don't mind. So thank you for having me here today, and it's a credit to the ongoing work of so many of you here today that we are present in such large numbers, and I'm including all of you online. In this role, I'll be aiming to bring together into an evidence-based system both the NHS treatment providers. There will be 15 clinics in all by 2024. We are almost there. And the non-statutory services into a seamless integrated pathways model that ranges from NHS to non-stat agencies under what I'm hoping will be a common and independent funding stream. This will in turn benefit not just people accessing treatment, but their families and all those suffering harm. Today has been made even more special by having our CMO here and our Minister for Gambling, Paul Scully. I'm particularly happy to be focusing on the public health approach, as I feel there are a number of things that are key when we speak about reducing future harm. And my thanks go to Dr. Greg Fell and Professor Maggie Ray. If you haven't heard of them, you must look them up. Their contributions to the gambling field of public health will be, I'll mention some of the things, but they have done some great work. So let me add, in a separate but significant role, I sit as an elected member of the British Medical Association's Board of Science. And the views of these experts and mine that I'm about to list to you are very much the views of the medical profession. So let me just say, all members of society have the right to live without unnecessary and preventable risk to health and safety from gambling products and gambling industry practices, whether land-based or not. Any person who gambles should be safe from preventable harm, regardless of their ability to protect themselves. And this goes back to Chris's point about children. And this includes marketing strategies when these are misleading about returns, odds, and when these are inescapable on people's emails, text messages, and social media. The ways in which the design, marketing, and accessibility of gambling products had advanced in recent decades cannot be overstated. When I started, only 20% of my patients in 2008 were online. Everyone else was queuing up in a bookmaker's. These developments have transformed gambling into a commercialized industry based on rapid and intense consumption. And exposing children to gambling marketing is no longer unusual. So the gambling industry has a primary objective to maximize its profits. Customer loss feeds their profits. And we've been tracking the enormous fines companies have been asked to pay. So I would like to just spend one moment reflecting what other non-monetary fines could we think about that may impact more on industry behavior. I will move on now because I've got about a minute left. And I'll say that the WHO has been looking at well-tried and tested perspectives. With the higher the consumption of gambling as an activity, the higher the industry earnings, the higher the harms experienced, both at individual and at population level, are expected to be. It's vital that we move towards better, larger scale ways of evaluating the magnitude of gambling-related harm across the country in order to address and target what is wrong. In order to do this, a statutory levy or some way of all receiving funds for all the things that Baroness Lampard listed
which includes treatment, but by no means is that the only thing. The preventative side is vital in this case for future generations. It is in this way, by uniting together and being at the receiving end of independent from industry funds, that I think we will achieve all of the things we have been discussing today. I look forward to contributing to this work in my new national role and would urge our gambling field to work closely with our public health colleagues to fully understand the scope and breadth of what a gambling harm that is currently embedded in our society looks like and how we can stop it. Thank you very much.
Thank you, Prof. Thank you. Sam, I know when we spoke before today when we were preparing, as a young person affected, so young, by gambling, and as Professor Sir Chris Whitty mentioned, and also Professor Bowden-Jones has said, you know, young people is really where we need to be sort of taking our approach. You had a very sort of well set out idea of the sort of 3 stages of how you see a public health approach. Could you explain that, please?
Yes, so I think everyone will be familiar with the public health framework around the universal, the selected and the targeted approach. And when we talk about the universal segment, this is all around bringing that awareness of tackling gambling harms at a population level. And that means campaigns like GambleAware are going to be launching a brand new campaign next year. It means education with consistent messaging around the potential risks that come with this activity. And at the age of 16, I didn't have that education. That wasn't around then. And I've always questioned, would I have gone down a different path? I can't say for certain, but potentially. But my friends either side of me who had that education, who will have had that education, will have they seen something in Sam that wasn't right, and would I be able to get to treatment a bit quicker, potentially? So it's really important, and I've seen a lot over the last 2.5 years working for a fantastic charity called YGAM, who specialise in the education sector around the potential impacts that can have longer term, not just on individuals, but wider family. You then move down to that selected approach, and I mentioned earlier the GP, the general practitioners. It's so important that we equip healthcare professionals. That's what a public health approach is. We give them the insight, the expertise, the lived experience, so that they can signpost accordingly. And then the final one I mentioned is the targeted approach, and I'll mention aftercare again. I came into my recovery in 2017. I had 26 months of abstinence behind me until I relapsed in 2019. And I was working on abstaining from gambling, not recovering from what had happened previously. And that is where we need a lot more focus in terms of harnessing what that individual needs. I've always said that it wasn't gambling that caused my mental health issues. It was mental health issues that caused my gambling. How do we get to the cause and treat that rather than just throwing everything at the gambling? So that's something I'd be great to see a lot more of. And I know, as I said earlier, there's some programs starting up to look to achieve that.
Excellent, thank you. Now, Leanne, you were an affected other in terms of gambling. So what was your experience like seeking help for yourself and for your other?
Yeah, so it was similar to Sam's experience. I didn't know where to turn to, how to navigate the situation that I'd been put into. And in my mind, I was like, we need to go to the GP. The GP will have the answers. I think we look at healthcare professionals to be able to give us that guidance and give us that support. And I was able to get my affected partner to the GP, and it was really like, there isn't anything we can do. Here's some mental health courses you can look at, and we got sent on our way. And there was no conversations in terms of the impact on me, but also kind of where I'd really thought the GP would be able to help provide some answers and provide the kind of urgency around getting support. It kind of pushed us further into isolation because those doors just got closed, and we weren't able to identify or access the support that we probably needed to at that time.
Right, right. And I was interested to hear when we spoke earlier that you said that actually for you, again on the theme of young people, gambling was something that was a very normal part of your young life. Is that right?
Yeah, that's absolutely correct. And for me, and for those that do know me, I talk a lot about my experience as an affected other. I don't necessarily talk about my experience with gambling myself. And since kind of going through this journey with my partner in recent years, I really reflect on my own understanding of gambling and my own experiences as a young person to where I am today. When I was 16, it was normalised to buy lottery tickets for your birthday. And so for my 16th birthday, I had 16 lottery tickets bought for me, and I won £10, because that was, you know, and I was encouraged to buy more lottery tickets with my winnings. I've worked a lot in hospitality, and have had a great number of years working in hospitality environments. And during those years, tips were kind of all clubbed together, and then we would buy scratch cards at the end of the shift, and if we won, we would divide that money out between those who put their tips together. And only now that I look back on those experiences can I see how different my own experiences could have been if I had taken a different path, but also for those that I was experiencing those things with. So for me, that education piece is so important to raise the awareness from quite normalised activities within friendship groups, within families, and it's so important that that education piece happens and happens more to be able to prevent some of those gambling harms.
Great, thank you. Professor, we've obviously heard about the difficulties of accessing help. So how would you see a public health approach? You've already sort of mentioned about the expansion of the clinics. How would you see the public health approach improving those experiences that we've heard?
Well, first of all, thank you for sharing your personal stories. It is so vital in the process that we hear from you. I think that the early identification is key, and it is terribly sad, but a constant really when you look back at how many colleagues, medical colleagues, either were really not aware of gambling potentially being an issue for some people, or were aware but really were at a loss in trying what to do. The number of letters through the years we've had from GPs saying, what do we do? Well, we are in a better position in relation to that because the system is now national. We've got enough clinics all over the place to say, you know, in just about under 2 weeks, most people will be able to be seen by one or other of the national services. And I think that's very important. But the early identification and the education of primary care providers is vital, because there are still people who come and see me and say, my GP told me to, you know, take up a hobby, or my GP said there are no services that I can go to. So I don't think it's in any way intentional on that part, but they are at times destroying people's lives, because in the earlier days we would see people sometimes who had been gambling problematically for 20 or 30 years. Now that has narrowed as a timeline, because I do think eventually people will hear, by going online, will find out. So very important to be aware that that is a seamless journey, early identification, at times brief interventions from a GP, primary care provider, whilst we're waiting for the higher order interventions through GambCare, NHS, whoever it may be, when it's needed. And that way we get rid of the backlog. We don't have a backlog in theory. Now, we will need to meet demands, and at the moment, as most of you in this room know, just under 5% of people who need treatment are accessing treatment if we are to, you know, to work by the stats we have. So with the future levy, if a levy it will be, or however else it will be funded, we need to provide for expansion of treatment, services, education, as well as prevention.
Thank you. Sam, if I can ask you something that Professor Chris Whitty mentioned was the number of other people who are affected by gambling. So I think the figure is 6 to 10 people. How can we look at public health to help those people?
Awareness on that whole population scale, as I mentioned earlier. When I came out and told my parents and my now wife, in terms of the life I've been living, they were distraught. This wasn't the person that I'd grown up to be, with the values and the morals that my mum and dad had done. I became a liar, deceitful, manipulating, a thief, disloyal. And that then filtered out to my parents, my family, my employer, my friends, who all felt the impact of my actions and my addiction. And again, my parents didn't know what to do. My wife didn't know what to do. It's just that lack of awareness around how you support someone in that situation, but also what support they can get. You know, I live my own recovery, and so should my wife, so should my parents. That is so important, because the impact I've had on their lives and the actions, that has had a major effect on trust, the worry, the financial elements of it. All these elements come together, and it does not just impact the individual, it can have that wider impact on loved ones. And we've spoken about society a couple of times. You know, gambling is normalised within our society. So let's try to flip that on its head and normalise talking about it within vulnerable groups, within diverse communities, with people who are suffering from comorbidities. Talk.
Okay. And Leanne, I mean, we talk about an iceberg of harms in terms of gambling, and there is this misconception, isn't there, that the harms of gambling are purely financial, but that's not right, is it?
It's not the case at all, and yeah, the analogy of the iceberg is kind of just the tip of what you see, and I think there's so much that is not seen when it comes to gambling harms. As Sam said, the talking is so important, and I know when I tried to reach out to friends during my time of navigating being an affected other, I was faced with the response of, why don't you just leave? And it just really compounded the kind of isolation and kind of the stigma for me to be able to reach out for support and be able to get the support that I needed. And like you say, yes, finances come into a big part of the gambling harms, but there's the anxiety, there's the worry, there's the impact on health, mentally and physically. There's an impact of what you can contribute to the society from a work perspective. All of those things are also impacted when it comes to gambling harms.
Absolutely. I'm aware that we're already running out of our allotted time. So I'm going to ask each member of the panel if they could sort of say what your one thing, one aspect would be for public health if you had a wish list. What would be the one thing that you would want to see in the next year or two in terms of public health? Professor, if I can ask you first, please.
It will come as no surprise that I'm going to mention again the unified funding. I think that it will avoid any division amongst educators, treatment providers, prevention, colleagues and primary care. It will allow us to work together as we're doing today, but on a much larger basis, and it will benefit everybody. I have been very touched by some of the things you've said, and the awful thing is they are identical to the things I used to hear 20 years ago. Things have not improved enough for people like you with your histories, and we need to prevent future stories like yours from being spoken here in 10 years' time.
Thank you. Sam?
This is more around the one thing that I'd like people here today to take away. And a lot of the time we're hustle, we're bustle, we're doing things, and I think we need to just take a step back sometimes and reflect. I hope this doesn't come across as patronising, but reflect on the success and how far we've come in this space over the last 10 years. And sometimes I think we just forget what fantastic work goes on. So one thing I'd like people to go away and think about when it talks about public health is around all the fantastic work. There's so much insight, knowledge, expertise in this room today. Let's harness that into next year and collaborate where possible, share best practice. So my wish list is to give yourself a pat on the back.
Oh, that's very nice. Thank you. And Leanne, what would you like? You get the final word.
I think for me, work around collaboration is absolutely essential. I think we all know from conversations that we've started to have today in our own experiences, the journey for everyone experiencing gambling harms is so different, and there's so many different layers and different ways people might be experiencing gambling harms. So we really need to look at coming together to collaborate, to be able to identify those journeys so individuals that need that support and need that help can get the services that they need quicker and be able to get them in a much more efficient way. And I think that's where everyone in the room today can take that away and think about how we can move forward with that.
Okay, thank you. Thank you very much for your attention to our fabulous panel, and enjoy the rest of your day. Thank you.
Thank you very much. What a really, really interesting and moving conversation. And I think that for me, that underlines Chris Whitty's point about hearing from people with lived experience. It is utterly vital, and Henrietta underlined that. I take away, we need to normalise talking about it. We need to celebrate the good work that's been done, and we need to collaborate. But thank you so much to Sam and Leanne for being so honest. And listening to that is the Minister for Gambling. He is also the MP for Sutton and Cheam, has been since May 2015. He's the Minister for London, and he is my former boss at BEIS, the Department for Business, Energy and Industrial Strategy. And one thing I can tell you about Paul Scully MP is that he listens. And I know that Paul will have taken away an awful lot from what he's already heard. Paul.
Thank you. Thank you, Liz. It's a pleasure to see you again, to catch up. And look, I live by the mantra of having two ears and one mouth. I know it's rare as a politician. I try and use them in that proportion. So it's been fascinating hearing the tail end of that panel discussion and getting some of the feedback outside of the room of what sounded like a fascinating, punchy speech by Chris Whitty, who really encapsulated so much of what you're trying to achieve today about talking about a public health approach to gambling harms. And I'd like to start by thanking GambleAware for the invitation to speak today and to bring everybody together to really discuss this incredibly difficult issue. It's great to be part of the 10th conference and to talk about these collective efforts to protect people from gambling harms. I also want to touch on our Gambling Act review, which, as you know, is a priority for the department just as much as it is for each of you. I know it's long anticipated, and it will be out the door as soon as possible for you to look at and to engage in the next step, as I'll talk about in a second. Because making sure that we have the right protections in place is an absolutely essential part of that review. Now, I'm aware that you've seen a number of different faces in this place in the role of Gambling Minister in the last 6 months. I'll make no more commentary on that, but I am pleased to have been made an appointed Minister for Tech and the Digital Economy, which includes becoming the lead for government on gambling. It's a really challenging, broad brief, but it's one that I've enjoyed getting stuck into, and I really look forward to the important work that we're going to be doing together. It's absolutely vital to get out and meet people. If we're going to listen, it's actually hugely important to be getting out and listening to the experts in each of the various parts of the sector and the advocacy groups, and indeed the lived experience, people with lived experience. So in my first weeks, I've made it a priority to meet a broad range of people, including clinicians. Henrietta, we met yesterday, didn't we? Parliamentary groups, charities, the gambling industry itself, and people, as I say, with personal experience of gambling harms, including the affected families that you've so passionately spoken about. They've given me hugely valuable insights, including on how serious and lasting the effects of gambling harm can be. Thank you for those of you that I met that are here today. Now, as I say, you'll know that our Gambling Act review is a wide-ranging look at the evidence on gambling and our regulatory framework. The commitment that we made was to make sure it's fit for the digital age. Now, the department, DCMS, leads on all aspects of gambling policy and regulation, and therefore we look at it in through a variety of lenses. Harms and addiction or on problem gambling as a health issue are essential considerations. Now, given the theme of the conference, they're what I'm going to speak about mostly today. But we also have to make sure that regulation is fair, it's proportionate, and works for the large number of people who gamble without experiencing harm. They're not incompatible aims. If gambling is to be a pastime that people can enjoy, it must not be dangerous or exploitative. Now, we're in a good position in the country in so much that gambling is done in the licensed sector where operators have to comply with Gambling Commission rules to keep their license. And we want that to remain the position. And within that licensed sector, we have to be continually alert to make sure that we've got the right protections and the safety nets and that they're working exactly as they should. And the gambling landscape today is very, very different from how it was in 2005 in the last Gambling Act. People can access the full range of products from bingo to casino whenever and wherever they are. So it's vital that these protections are able to respond quickly. People who start experiencing difficulties must be spotted early, and you heard from Professor Chris Whitty how difficult that is and what more work we have to do, because we've got to spot it early before that lasting damage that we've heard about is done, and they've got to be helped, and we've got to get that right. So DCMS works closely with the Department of Health and Social Care, which of course is the leader in government for health and public health. Now, be assured, I'm really aware that there are a number of people who are in the grip of an addiction or serious gambling problem. The last health survey for England found that 246,000 people were considered problem gamblers, with a further 1.6 million at risk of suffering harm. For people in the worst situations, their lives can be absolutely ruined with bankruptcy, losing a home, relationship and family breakdown, and even suicide. Our review of the Gambling Act will take action to prevent these harms with targeted, proportionate and effective reform. As I'm sure you'll agree, though, gambling harms can't be tackled by working in isolation. That's the very reason of bringing everybody together in a fantastic conference like this. So the theme of today's conference, taking action to tackle gambling harms as a public health issue, requires that collaboration, communication and consistency at different levels to ensure that the right protections are in place. It's an opportunity to share perspectives and experiences with others and to collaborate in the prevention of gambling harms. Now, the causes of gambling harms are complex to unpick and address. Individual circumstances, environmental and other health factors play a role, but our approach also needs to look at the products and the practices. We also need to make sure that anyone who is experiencing gambling-related harm can access the right support whenever and wherever they need it. As you all know, we've been carrying out that thorough review of gambling law since the 2005 Act, and we do want to publish it as soon as we can, but we've got to make sure that we get it right. It's absolutely right that gambling policy and regulation to make gambling safer and to prevent harm hasn't actually waited for the review. There's been a lot of action already to tighten protections in the last few years. The Gambling Commission has banned gambling on credit cards to help stop a person gambling with money that they don't have, which could clearly cause serious harm to them and their loved ones. It's made online slot games safer by design, bringing in further protections on a product which is associated with higher level of harmful gambling. And it's strengthened rules on how operators must identify harm and interact with customers. And it's tightened restrictions as well on the provision of VIP schemes after seeing too many instances of irresponsible practices from operators. And that's led already to a significant reduction in the number of VIPs, but we and the Commission will continue to monitor this nonetheless. And we've also seen a step change in the Commissioner's enforcement activity. In the past year alone, we've seen a number of operators pay out over £45 million because of regulatory failures. Two of the largest operators alone have paid £26 million. By comparison, in the whole of the 2016-17 financial year, the Commission took action against 3 operators who paid £1.7 million to regulatory failures. So you can see the scale of change there. So the review is the opportunity to build on those changes and to do more to make sure that we've got the right protections for the digital age. To tackle gambling harms effectively, we've got to understand the problem and tailor our solutions accordingly. So we've got to take both wide-ranging action and targeted and proportionate action where each is appropriate. And so that's why the gambling legislation and the Gambling Commission rules operate at many different levels, like a classic public health approach. They put in place a wide range of protections for the population as a whole, like specific controls on addictive products and how businesses can operate. There are also specific rules, though, for particular groups like children. We recognise that, like alcohol, gambling carries an inherent risk, and it's right that most forms are restricted to adults. And for people suffering harm who have greater needs, the rules require targeted interventions and particular support. That includes not just operators stepping in to prevent harm, but providing self-exclusion schemes and funding which goes towards the treatment centres that we've just been hearing about. Communicating the risks of gambling harm has been identified as an essential public health intervention, and I commend GambleAware for their work that they continue to do on raising awareness of the risks and the support available. We're also looking at this in the review, analysing what's most effective when it comes to communicating the potential harms of gambling. I'm aware of the changes, for example, introduced in Australia, which mandate specific taglines in advertising. We're considering those developments and others very closely, and we want a solution that works very much for our own country and our own gambling landscape. But having a greater public awareness of the potential harms and equally the sources of support is incredibly important. Now, closer to home, the Advertising Standards Authority rules to prevent gambling adverts having an inappropriate appeal to children have now come into force. And I know that these were in response to landmark research commissioned by GambleAware. It's a textbook example of what collaboration tackling gambling harms can deliver. And secondly, I'm really aware that individual circumstances can vary widely and change in time. And so it's right that there is a wide range of requirements on operators to detect where individuals are vulnerable and take active steps to protect them. Now, of course, we all know about cases where checks and interventions have been happening too late or at the wrong levels. Making sure we've got the right rules is a key consideration of the review and part of that vision for the sector in the digital age. And finally, though our intention is always to prevent harm, it's also essential to provide the right treatment and for those who do need it. I'm really aware of the invaluable role that GambleAware plays in treatment provision, commissioning the majority of specialist support for people experiencing problems with gambling. Now, the commitment to establish up to 15 specialist NHS clinics by 2023-24 is also progressing well. And I understand that 7 are now open in London, Leeds, Sunderland, Manchester, Southampton, Stoke-on-Trent and Telford, with a further gambling and gaming addiction clinic for young people in London. And I had a great meeting with Henrietta and indeed Matt of the London and Leeds clinics just yesterday. I fully support the work of GambleAware and GamCare to help integrate the services, your services, with those of the NHS, including in primary care settings. A coherent and robust treatment pathway will ensure that there is no wrong door when it comes to accessing support or treatment for gambling harms. Henrietta, you talked about unified. It's so important that we are unified in every aspect of our access to treatment. We want anybody in the country experiencing gambling-related harm to have access to support and treatment wherever and whenever you need it. And as we publish our white paper, we want to continue to work with all of you in the room to draw on your expertise. So the Gambling Review is an opportunity to put the right framework in place to meet the challenges and seize the opportunities which have come with the changes since the 2005 Gambling Act was passed. And I want to thank, again, GambleAware and so many of you in the audience for your responses to our call for evidence and for being so active in your engagement with the department. I want to thank all of you working in the sector for your ongoing efforts. And we're determined to make sure that review gets the right protections in place. We're committed to the review, and I know I'm really aware coming into this department only a few weeks ago that the delays to the white paper have been difficult, have been frustrating for all of you in equal measure. But I'm pleased to confirm that we are keen to publish it in the coming weeks, but I want to make sure and make it clear to you that whatever the language is that's in there, there will be plenty of time to engage with further consultations and developments of the measures that you see within that white paper. So there will be plenty of time for House to have many, many more further conversations about how we will bring its measures into effect. And I'm looking forward to engaging and listening to each of you as we go on that path together. Thank you very much.
Thank you very much, Paul, for that. I think we can say that the review is coming. You heard it here. It's just very important to get that engagement and those conversations and to get it right. I have to say, for a minister who was given his brief on the 27th of October 2022, we're quite impressed with your grasp of the issues, but also of the importance to collaborate on the people in this room who can help you to get your framework right, as you put. So thank you very much for your time. Now, we heard Professor Sir Chris Whitty say that children and young people have to be a top priority. So our first panel discussion session is concentrating on children and young people. Can I invite Kev Cleland and Kieran McGinley to take their seats on the stage? Come and join us. And please welcome, now I think also Guy is joining us. Great, thank you very much. And please welcome the chair for this session, who is Haroon Chowdhury, who is Director of Research, Information and Knowledge at GambleAware. Thank you.
Thank you very much, Liz. So I'm delighted to chair this session, the first panel session of today on children and young people. As Liz says, I don't need to say very much about why this is such an important issue. I think Professor Whitty set out the moral imperative very powerfully, and he mentioned the statistics on the numbers of children who are gambling either problematically or at risk. The issue is much wider than that, though. We also know from the same data that about 600,000 11 to 16-year-olds follow gambling companies on social media. And GambleAware's research a couple of years ago suggested that 96% of 11 to 24-year-olds have seen gambling marketing messages in the last month. And then there's the issue that we don't talk about enough, which is of affected others. Our data, the Treatment and Support Survey, suggests that there may be around 2 million children under 18 in Britain who live with a parent who has gambling issues. Given all of this, it's important to discuss, what we can do to enable children and young people to open up about these issues, to ensure that they have the resilience and the protective factors to avoid harm, and that we put them front and centre of all of our efforts to reduce gambling harm. So, with me to discuss this, as Liz said, Kev Cleland, the Director of Insight and Engagement at GamCare, Kieran McGinley from GamCare, and Guy Bray, who is a youth advisor on GamCare's Youth Advisory Board. Kev, I'm going to hand over to you first for the first, and then we'll go through. Thank you.
I go up and just speak up at the lectern, if that's all right. Thank you. Thanks, Haroon, and hello, everyone, both here in London and those of you joining us online. As Haroon mentioned, I'm here to talk about how universal interventions can help reduce stigma amongst children and young people by encouraging more open discussions and debate to ensure that they are healthy and safe in an ever-changing world. Now, YGAM is an award-winning charity. We've got a social purpose to inform, educate and safeguard young people against gaming and gambling harms. We're founded on lived experience. You've already heard from one of my colleagues, Sam, this morning, but we're also founded on the lived experience of our founder patron, Anne Evans, a former primary school teacher whose son died through suicide after a prolonged battle with gambling harm, which dated back to his teenage years. Now, we passionately believe that harm prevention education has a crucial role to play, and that education should be targeted at not just young people. It should also be targeted at teachers, at youth workers, staff at universities and colleges, health professionals, and of course parents.
And on the left, up on your screen, yep, you can see it, you should be able to see our portfolio of education programmes that are all independently evaluated and that are all offered free of charge to people living and working in the UK. Now, when we talk about stigma, we need to recognise the fact that it comes in many forms. And we've already heard stigma mentioned this morning, but it can be internalised, perceived, anticipated, and of course intersectional. And as we heard from our lived experience panel, talking is crucially important, but education also has a crucial role to play if we are to start talking more. But we can't do this alone. Again, as we've already heard this morning, collaboration is key in order to ensure that children and young people are resilient to and safeguarded against gambling harms. We need collaboration and cooperation, as Sam and Leanne so eloquently mentioned earlier this morning. But this requires lots of things. It requires that consistency of message, listening to both the research and the lived experience communities to ensure that we're using the right language and that we are consistent. We need mutual support. We need to actively promote each other's programmes, realising that we all have that shared goal to reduce harm and referring people to the most appropriate services as well. It needs non-duplication, that clear commitment to identify joint working opportunities to avoid that unnecessary repetition at times. And we must continue to evaluate everything that we do, following the evidence to maximise our impact, and through developing pioneering research collaborations, we can build a robust evidence base so that we can better understand current and future harms related to gambling. And then finally, we need to develop communities of practice, to test, to develop and to share the evidence of what has worked well and where we need to improve, how we can make this better. Now, we've already heard about the need to take a public health approach, and I'm sure we'll continue to hear about this throughout today. And this sector already does a great job of selected and targeted interventions, but to have a truly effective public health approach, we can't neglect universal education. Now, I'm sure some of you will have seen this before, although the labels might be at different vertices, but the model's from Korn and Schaffer, and it's over 20 years old now, advocating the need to look at the interaction between the host, the agent, and the environment. The host is the individual who may be at risk or have vulnerabilities. The agent represents those specific gambling activities in which they might engage, and the environment is the venue or the cultural or political contact. Now, at YGAM, our focus is on that top vertex, the host, young people. In line with guidance for effective PSHE education, building resilience amongst children and young people is an essential part of development, preparing them for experiences they may encounter now or in later life. And in England, gambling's just recently made it onto the curriculum through the RSE guidance, but this is only in the context of internet safety and harms, with the focus on the risks related to online gambling, including the accumulation of debt. This means that many children could go through their primary school and secondary school and only have 1 half-hour session that touches on gambling. That's not universal education. According to the latest Gambling Commission report, the Young People and Gambling Report, 11 to 16-year-olds are still more likely to have spent their own money on gambling than cigarettes, e-cigarettes or drugs. Now, we need to do more. We have a number of former teachers in our staff, including myself, and that, along with our regular contacts that we have with teachers, has enabled us to develop schemes of work for primary and secondary pupils. We look at how advertising and information is targeted at them and how to be discerning consumers of information online. And we also focus on the different types of gambling that young people may be exposed to, including the unregulated or legal forms of gambling. Now, those of you in the room or watching online who are teachers will recognise the image on the left, and it's not just a muddled chart. It's one of our long-term plans. It's thematic in its approach. It covers key topics for gambling and gaming across the 3 core themes of health and well-being, relationships, and living in the wider world. This makes it easy for teachers to see how they can fit this important topic in. It's a spiral curriculum with key topics and themes revisited, increasing the challenge, broadening the scope, and deepening those students' thinking through the year groups. It's important to point out, though, that not for a minute are we suggesting it's solely the child or young person's responsibility to be resilient to the potentially harmful product characteristics which are part of the makeup of gambling. And that's why we look to support the significant people who live and work with children and young people. And there's also, of course, a role, as we've heard already, for robust regulation and safe product design. However, individual skills and knowledge are a crucial part of the jigsaw of a safer environment, and this is where we hold our expertise. Thank you.
Great, thank you. Thanks very much. Thanks very much, Kev. Next up, we have
I'll speak
Kieran and Guy.
I'm just really here to do most of the introduction for Guy. So my name's Kieran. I work for GambleAware, been with GambleAware for nearly 3 years. I'm the lived experience and youth participation manager. I also have my own lived experience, hence the title of my role as well. But this year we launched our Youth Advisory Board, and essentially this Youth Advisory Board was to embed a youth voice in the organisation, to address what we're talking about today, inequalities and barriers to access support, especially for young people. We have our education programme, we have our young people's support service, so the Youth Advisory Board's also there to help those be more effective, improve them, and be more engaging for young people. So with that, we launched the Youth Advisory Board, our youth participation strategy, and today we have one of our founding members, Guy, here today, and I'm so willing to sacrifice all of my time from me speaking to give it to Guy, because Guy can speak far better than me from the perception of young people. And so I'll hand it across to yourself, Guy.
Oh, well, thank you, Kieran. Hi, my name is Guy. I'm 16 years old, and as said, I'm one of the founding members of the Youth Advisory Board. Over the next 5 or 6 minutes, I'll be talking about the importance of youth participation at GambleAware, in particular, what we do, and why we need more consideration of youth voices in gambling support charities, and the benefits that support me and my fellow board members. Roughly 11 million people in the UK gamble weekly, with 350,000 of them being aged 16 or under. Beneath the statistics, these are young people's lives. Young people with constant thoughts about gambling, young people skipping lessons and time with family to gamble, and young people experiencing poorer mental and physical health, not to mention the money they can lose doing it. On the theme of this conference, GambleAware believes gambling harms are a public health issue. Our work is collaborative, working across the NHS with policymakers and people with lived experience. There are particular inequalities for young people accessing support, including a perception gambling harm is only an adult issue. Many gambling behaviors affect young people in similar ways to adults, and due to the digital nature now of gambling, young people are at risk of developing issues continuing into their adult life. They may fear getting into trouble, and stigma around engaging in supports, and they may be affected by the gambling behaviors of those around them, parents, siblings, and friends. This is where GambleAware's youth participation work comes in. GambleAware believes in the importance of empowering young people who feel marginalized to have greater control over their lives. By participating in our work, young people can also improve GambleAware, making it more relevant and focusing it on the right areas. And through participating in professionally led activities, we're offering young people vital skills and experiences in decision-making, professional experience, and personal development. Between 2021 and 2022, GambleAware has engaged over 300 young people in youth participative work, launched the Youth Advisory Board, become an approved activity provider for the Duke of Edinburgh Awards, and attained the Youth-Friendly Employer Standard. Through our Big Deal project, we're integrating the voice, views, opinions, preferences, and insight of young people into GambleAware's work in a way that's facilitating the development of co-created resources, workshops, support, and digital solutions. We have developed a young people's participation strategy and youth advisory panel now, which I'm in, including service user and lived experience involvement. Our Youth Advisory Board is governed by the young people involved. We're a diverse group of young people from around the UK aiming to increase representation of young people struggling with gambling and helping them get the resources that they need. The Youth Advisory Board, otherwise referred to as the YAB, has supported the design and the delivery of youth-facing Big Deal website, ensuring it's suitable for our age group and that it conveyed the right information. We also have published 6 engaging blogs, ranging from the influence gambling has had on children to how it affects the others around you. We have developed engaging social media content, helping to reach even more young people. Our 3 social media campaigns raised engagement on our Big Deal channels by 200%. But perhaps our biggest impact has been the feedback on the Committee for Advertising Practice Rules, which from October prohibit gambling advertisements that strongly appeal to younger people. We'll continue pressing for stronger advertising regulations to protect younger people. The Youth Advisory Board has an ambitious future. We're going to get involved in community events such as engaging our own schools and colleges in gambling harm awareness workshops for both staff and students. We welcome the recent keynote speech at the Children Youth Mental Health Conference hosted by the CAMHS and today at this conference. And we're keen to have greater engagement in these forums. We also want to get involved in GamCare's recruitment processes. But most of all, we want to have a bigger impact on the gambling industry in general, offering critical challenge, advice, and guidance. So how do we plan and deliver our activities? Well, every week we meet for an hour with Kieran, our youth participation manager, to the side of me now, who suggests different topics to work on. We meet online to ensure everyone can be involved, and the meetings are incredibly open, allowing us to speak whenever we have an insight about the issue. It is a feature as well to have any of these ideas or suggestions put into action most of the time as soon as the next week after being mentioned. This is a particularly amazing part of being part of the YAB, as we know our voices are being heard, acted upon, and taken seriously within the organization. Not only this, but our meetings are becoming more and more self-sufficient. Just recently, we've started suggesting and choosing our own topics. I've been part of the YAB since its first meeting, and it's been truly amazing to see it grow. We started with just 5 regular attendees, and now we have 17. And we don't want to stop there. While I'm proud of all that we've achieved together, there is still so much more we can do before we can say that young people are protected from gambling harms. For 2023, we've set some ambitious priorities, including recruiting a total of 35 youth advisors and developing 7 youth insight reports like the one given on the CAP advertising rules. The YAB has enriched my own life personally, substantially. It has made me notice and appreciate just how much gambling affects everyone's lives. Whether it be a student placing bets on who will win something, someone gaming and paying money to have a chance at winning a particular item, or going to a pub and playing on machines. Gambling comes in all different areas, with some more subtle and more obvious than others. Knowing that there's help out there and ways to change how people view and get access to it has been valuable. Many young people don't see the risks or view gambling as less important than other issues. Knowing what I do now, it's good to identify the signs of gambling harms before they evolve. Hopefully, with experience in the YAB, I can reach more people and bring to light the social harm in which gambling can bring. So, with that, I'll conclude my part and say thank you all for listening. I'm looking forward to the panel where I can certainly try to answer your questions. But before I do, I really want to say a huge thank you to Kieran, who's ahead of it all, for his amazing support during my time with GamCare and in helping me prepare for this today.
Right. Can I just add, the Youth Advisory Board, like, Guy, thank you so much for that. You nearly made me cry, but thank you at the end. But the Youth Advisory Board is, as Guy mentioned, a very diverse board. It reaches across all the nations within the UK, so Scotland, Northern Ireland, England and Wales. We meet on Zoom every week, hence the different locations. There's 13 different nationalities that are part of the board, different faiths, LGBTQ plus representation. There's neurodiversity representation on the board. Pretty much you name it, we're there every week talking. And that's very key because this group of young people, whether or not they're affected by gambling-related harm, are very passionate about helping their peers on this issue, and they are very, very open to collaboration. So with that, I'll hand back to yourself, Haroon.
Thanks very much, Guy. Thanks very much, Kieran. Brilliant insights from all of you on the work that you do. So we've got a little bit of time now. We'll have some follow-up questions on some of the issues you raised, and then after that we'll have audience Q&A, and there will be roving mics going around, and those viewing online can submit questions. First question I'd like to ask, and this is for the whole panel, is given that on the basis of the regular work that you're doing with children and young people, obviously we know this is a very fast-moving space, especially with technology and new products, things like that. What would you say are the up-and-coming issues coming down the track that we're seeing affecting children and young people. Kev, if I could ask you to start with that, and then I'll come on to Kieran and Guy.
Brilliant. Thank you. Thanks, Rin. Now, obviously, as you've gathered from my presentation, we often don't work directly with young people. We work with the adults who support them. But they're telling us that they're struggling to keep up with this ever-changing digital world and the blurred lines in particular for children and young people when it comes to gaming and to gambling. In terms of what this means for a public health approach to gambling harms, we'll look to continue to use our expertise and understanding of that digital world to really help bridge that gap between the experiences of children and young people and the knowledge and skills of those who can work to influence their behaviour. Now, that involves setting up advisory boards, advisory panels to support engagement and co-production, similar to the brilliant work that we've heard about from Kieran and Guy, and to inform and develop that content, looking to really improve that impact of our training. And then that really will help our beneficiaries and make sure that the best use of digital technologies is there to support that engagement as well and enhance those learning outcomes.
Great, thanks. Kieran?
Yep. I would say having, as you said, we work directly with young people a lot. What we're seeing is around different forms of engaging young people in even viewing gambling. So not just engaging in the activity itself, but observing others engage in the activity, such as streaming on sites such as YouTube, even Twitch. You'll see you can watch people actually actively online gamble there, and young people have access to that. In terms of engagement, you also have social casinos. So these are your mobile apps that it's not real money, but essentially you can pay to use them. But it's also training the mind on how to gamble using slots. So we do see that as some of the up-and-coming issues that arise. Obviously, cryptocurrencies, the interest in trading, taking risks. And when we do engage with young people on this, it is from the point of view of taking risks. What way are you taking these risks? It's not just necessarily directly about gambling, depending on what age we're working with, because you want to be able to have content that stretches beyond just one size fits all. So when we're having these conversations with young people, they are telling us that they see this, and it is something that they want to bring to our attention, that our content needs to be talking about as well. So with the Youth Advisory Board, they make the suggestion, and we bring in and we review our content, and we implement the changes that are needed based on the voices of young people who are essentially the audience we're trying to talk to.
Thanks very much. And over to you, Guy.
Yeah, I mean, I would quite honestly reflect those views. It's, especially being young, there's a lot of time which, I mean, I can spend on things like gaming and certainly on the digital part online. And I think that's where we most experience it now, and certainly in the future. It's become so easy to just put yourself in that situation and not even realize it. So you can, it's almost like you're entirely detaching yourself. Everyone thinks of this sort of stereotypical view of like, oh, well, if you're gambling, then you're going to a casino, or you're going to the pub and putting some money in one of the machines. But it's not that anymore. You can see your money. You can see it disappear online and on games and whatever. And it's not just the money that has an effect. It's then what happens after. And there's a lot of sorry for my poor phrasing here, but it's focused now, I would say, mainly toward the digital sector. You mentioned cryptocurrencies as well. Those are certainly a big thing because people think it's not like real money, so then they put money in it and then suddenly they say it will disappear and they're wondering why. But yeah, I think it's an incredibly strong part of the gambling sector now. Thanks.
That leads me on very nicely to the next thing I wanted to ask about. I think all of you mentioned this in your contributions. The wider aspects of prevention. So education is obviously hugely important, but there may also be a role for kind of regulation, particularly in the tech space, the digital space, or the products. And do you think there's a case for any stronger protections? Guy, I know you mentioned the work that YAB has done, for the industry-facing work, and the work on the ASA guidelines. Do you think there's a role there for other kind of regulations that are needed to protect young people in this space?
Yeah, absolutely. I mean, there needs to be harsher restrictions than what we currently have now, certainly in the upcoming digital space. But in terms of like helping people to sort of understand these issues originally and get down to that core concept, I personally think a lot of it is in the school sector. I know it was mentioned by Kev that there's like half an hour of education in both primary and secondary school, which I mean I can really agree with, and then that's just it. And then they focus on some other things. But I think that needs to be addressed a lot more because it really affects us a lot more and affects a lot more of us than we think. So,
thanks, great. Kieran, anything you'd like to?
I think I hit the nail on the head there. But it's essentially better regulation, better protection. I think I'm coming from a personal point of view. I think the use of the word stronger can be off-putting for quite a lot of people. Potentially, those people we're trying to convince to change. But better, I think, is needed, especially if we're talking in the aspect of working with young people. They are more vulnerable on the digital frontier in the up-and-coming years because essentially they are our future adults, and this is the age that they're born into. So we do need to be focusing on that quite a lot.
Thanks very much. Kev, based on your work with schools, your work with the professionals around children, are there any kind of imperatives where you think that there must be something here we can fix using in order to make the environment safer?
I think obviously the advertising is one of those key areas, and it's something that we focus on. You'll see in a quick screen grab of some of our resources that look at advertising, and we talk about it in our training as well. And we're aware of the research findings from Bristol University, which found that gambling advertising on social media was more appealing to children and young people than to adults. And that backs up, the evidence that we submitted as part of the Gambling Act review. However, but we've heard this morning really eloquently from Guy as well, talking about that digital space that young people move in. And the Advertising Standards Agency talks about those shifting media consumption habits of young people. They're increasingly, turning to that digital space, and we've got the influence of social media to contend with now. We've got those video sharing platforms like TikTok and Twitch as well, which have brought that influencer to the forefront, and that influencer marketing can be, the research again, talk about too much research, but talks about it being 11 times more effective than traditional forms of marketing, particularly with young people. So that's a really important piece.
Great. Thanks very much. I'm aware I want to leave time for the audience Q&A that open it up more widely to questions. So this is the last thing from me. All of you work, are really close to the views and experiences of children and young people. We've got an audience here of people working in policy, practice, key decision makers. What is the key message that you would like to feed back from young people to this audience? What do we want this audience to go home with? Kev, if I could start with you on that.
I thought you would go first, Guy, but I'm glad to
be
still viewed as young. We obviously speak regularly with the people that we work with, and I think what we hear frequently back from young people, even young people in my home up in Yorkshire as well, the kids that I live with, is that need to talk to us and to talk to us regularly. Don't assume that we're naive, that they're seeing this every day, and they want help to identify the risks, to understand how to spot those signs and know where to access support. We need to take that really holistic approach, and I think that Internet Matters have done their Insight and Trends report, which finds that teachers and parents are still those key influencers on young people's behaviour. They're the people who they're turning to, particularly for advice in that online world as well.
That's great. Guy, I'm going to let you have the last word. What is the one message that you would love to just relay back, make sure everyone takes home with them?
Yeah, well, being obviously a young person myself, I think the fact that I'd like to get out there the most is that we do actually exist in this sector. It's not, you've seen the statistics, you've seen 350,000 people and so on, but we are actually part of it now, and it's going digital, and because of that, we're even more of a part of it. So we aren't just back, 30 years ago where you would have to go into a casino and show your age before. Now it's affecting everyone. It's affecting everyone everywhere, and you need some better regulations in order to solve that than what we have now.
Great, thank you very much. Right, we've got a few minutes for questions from the audience, and we've got some roving mics here. Henrietta, I think you were first to get your hand up, so we'll get a roving mic to you first.
Yes. Yeah.
Thank you. Is this on?
Yeah.
Great. Just to say how absolutely, well, first of all, thank you to the panel and great contributions. But can I just take a second to say thank you to Guy for, at his age, with these oratorial skills. I don't know where they've come from, but you have a great future. I long to meet with you and sit down and hear more about your thoughts. And thank you for coming here today. It is absolutely incredible. Thank you.
I think the lady over there and then the gentleman over there. Yeah. Could you, for the benefit of the audience, give us your name and where you're from as well, please? Thank you.
Yeah, sure. Agnes Nairn, I'm from the University of Bristol. I was really interested, Guy, when you were talking about working with the ASA on advertising that's of particular appeal to children. So as Kev said, we were the team that did the research that found that social media advertising was of stronger appeal to young people than adults. One of the things we took up with the ASA was when you decide something is more appealing to children than young people, do you actually ask the young people, or is it an adult's view of what's appealing to children? I just wondered if you're working with the ASA as part of their team to identify what's particularly appealing to you.
So, do you want me to take that question because it's more of a logical approach, or not logical, but more of a what's the systemic approach from where we work as GambleAware?
Yeah, go ahead.
So the way it works with the YAB is that we would bring those discussions to the Youth Advisory Board in a protected setting. So if that organisation wanted to work with our Youth Advisory Board, they could reach out to us. But on this occasion, we received the details on this in April, and we had a group discussion as a group to come to give our views and put those views out there. But we haven't been approached at all to do it directly with them. However, very, very open to it. But I think for a guy in the protected environment, was able to speak his views very, very clearly for it, as well as the rest of the group.
Thank you.
No worries.
Thank you. I believe there's a question over there.
Hi there, Stephen Irondew, Bet No More UK. Thank you for the panel for delivering that information, and special thank you to Guy. As somebody of lived experience myself, and with my gambling beginning in school, I wish I had a friend like you in school. So thank you for sharing that. So I just wanted to know, well, two parts of the question really. When did you become active in the youth panel? That's one thing. And second, are you still in school? And given all the responsibility you're now taking, and given your leadership in this sphere, what happens, to the future generation? How do you pass the baton? Because I guess, many young people around the country, around the world, would need leadership and inspiration like yours. So how do you pass the baton and kind of, help, with the, next generations of 11 to 16-year-olds who might be facing this problem?
Yeah. So, wow. I'm still in school currently. So I'm 16. I've just started my A-levels, and really, I started this back in I think it was April. So when it first started, and I found it through the we were talking about the DAV. I found it through the DAV activity provider. When I first entered it, I think I had different sort of views on it. But then once I got in and actually started taking participation inside of it, there was just a huge change in mindset from that point. Like suddenly, because I was part of that own like precognition that gambling didn't really affect younger people, and like it wasn't an issue. And then going in, it's completely changed that. And seeing some of the changes that have been brought upon because of us, that's really has been a truly amazing thing. And then you mentioned passing the baton on, and how to help 11 to 16 people get involved in this. I would say it's more of the same thing. So more of like these youth advisory boards, more going out to schools, more getting people's ideas, more just trying to get the views and opinions of the youth. You can't just go to the adults and say, what do you feel your kids are like? Or how do you think that they're going around and engaging? Because that's not the view you're looking for. You're looking for the kids. You're looking for the young people. You're looking for people aged 16 and under 18. So really, you need to go to them. You need to find out what they think, whether that is through youth advisory boards, going to schools, going out on the streets and talking young people in particular, whatnot. That's the way that we would go about it, because of course they're the ones that are going to be in our future, and they're going to be the ones in our society.
That's great. Right, we are very nearly out of time, but I think I can squeeze in one more question. That gentleman just over there, I think in the third, fourth row. Great, thank you.
I'm John Gillam from Gambling Education Network, obviously with YGAM. But actually, I was just looking at a point, talked about children who are affected others. And I just wondered what work you thought about around that aspect as a youth council. I think it's a great piece of work you're doing, absolutely superb. And to me, we heard earlier, Professor Whitty, that maybe 2 million children living in households and they may be looking for some advice and some support. So I just wondered if that was a topic area you had at least considered, what your initial thoughts might be around that. Thank you.
So, sorry, was that about how it affects other people, or?
Well, young people, obviously, as we know from when we do the education, when we talk to the young children, some of them will tell us obviously they themselves are not necessarily gambling, but one of the issues that they're living with is the fact that they are living with someone who or in a household. So I think just the question is how we help young people, one, potentially hopefully be aware of the risk around gambling itself and all the aspects around that, but also women's education is how we look to those young people that may be currently being affected or harmed as a result of someone else's gambling, and how we can advise them of the support they need. So it's just another aspect. I just wondered whether that had been looked at.
Yeah. I mean, it's certainly being looked at, and people with in these households where gambling is a thing already, that's quite a harsh reality that we have to come to. It's that it's not their fault. It's that they're exposed to it. Of course, it's the parents around them. In terms of that, you've just got to, I would say, make them realize it's not the thing to do. Don't, just because your parents are doing it, they're authoritative figures. Unfortunately, we can't rely on everyone to be sensible, but you've got to teach that that's not, it's not right to gamble the same as their parents would or that anyone else in their house would. But yeah,
can I just jump in as well? I think it's a really important question. It's something that at YGAM we're aware that it's an area we really need to focus on as well. I think that's why our education programme starts in that primary setting, because it's not necessarily saying that kids in a primary setting are gambling. There's that real, likelihood that they could be an affected other. So I think that's where it really makes it important to be having those conversations and to be doing it in an age-appropriate way as well, and taking that holistic approach, so relying on the professionals in the field. So I'm a former primary teacher myself, and you understand how to speak differently to a Year 2 child compared to a Year 6 child, or to a child in Year 9, Year 10 at high school. So it's ensuring that we have that holistic approach to break down that stigma that still surrounds this topic as well.
Yeah. Comes right back to the stigma. Right, we are very sadly out of time. We're going to move on to the next session, so please give me a warm round of applause for all of our speakers.
Thank you very much to Haroon for managing a brilliant session. Can I just nick that from you? Thank you very much. What a brilliant session, and what a compelling voice for young people. So thank you so much for joining us, all three of you, Kev, Kieran and Guy. I think you should get Guy's autograph now, because it's going to be worth a lot one day. And when he is the gambling minister, you met him here first. So thank you very much indeed. Now, I'm moving on swiftly because we have a hard stop on the next session at 11:40. Can I please have Lord Don Foster and Matt Zarb-Cousin to join me on the stage, please? And we have a hard stop because I know that Lord Foster has to get away 11:45 at the absolute latest. So, oh, you're all right now? Oh, shouldn't have said that. We'll keep you here for hours. Matt, thank you very much. Dawn, thank you. Now, what I am going to say is to the people listening online, please don't forget that you can put your questions via the Slido question and answer box on your program that you joined through. I don't know if it's Zoom or Teams. But I will find them here on this tablet. So please do. I'd like to include some questions from our online participants. Thank you both for joining us. It's so nice to see you again.
Thanks for the invite.
Now, the question for you in this session is, how can we reform gambling policy to have a public health approach? So what I'd really like you to do is to set out your stall to begin with. But can I just say that Lord Dawn Foster is a member of the group Peers for Gambling Reform, and you have been involved in the topic of gambling for many years. And Matt is the founder of Gamban, the gambling blocking software. So can you set out your stall on this? What's an effective public health approach and how can we achieve it?
I mean, if I can begin, I mean, the first thing, I just want to say a huge thank you to everybody in this room. So many people have helped me and Peers for Gambling Reform and the cause that many of us espouse, and I'm enormously grateful to that. But the one victory that I think you can all be incredibly proud of is that we are at a conference today with the heading, Taking a Public Health Approach to Tackle Gambling Harms. And that public health approach has now been accepted, even in government. And one of the big battles that I have had, and Peers for Gambling Reform, the All-Party Parliamentary Group, many parliamentarians have had, is trying to persuade relevant government ministers to address this as a public health issue. And I was delighted that, notwithstanding hearing very little today from Paul Scully about what's going to be in the white paper, he used the phrase talking about a whole population approach. We need public awareness of harms. So I think that's the one really important milestone we can all be incredibly pleased about. What does that then lead us to need? Well, I served, for example, on the House of Lords Select Committee that looked into the whole issue of gambling reform nearly 3 years ago. We made a stack of recommendations based on adopting a public health approach. And those led us, and we can go into the details of each and every one. There are people from both sides of the argument here, and we can have that debate, I hope. But, I mean, the things that are very clear for me are that we need to start bringing the online world of gambling into the same sort of regulatory regime as the land-based regime that we have. We need to introduce a sensible, proportionate affordability checking system, which is not intrusive and all of those sorts of things. We need to address not just what everybody talks about as advertising, but we need to look at the wider issue of marketing, bearing in mind something like 80% of marketing spend by the gambling companies is online. And in particular, we need to look at direct marketing to individual customers. I believe, very importantly, we need to make major reforms to the customer redress mechanism, moving towards having a gambling ombudsman. We need to address, in a way the government have failed to do with their recent response, the whole question around loot boxes. And then perhaps significantly for all of us, I think we need to have a statutory levy for a whole variety of reasons, not least because it would provide long-term certainty of funding for issues like research, education, treatment. It would ensure that it's impacting fairly on all operators, because only some are making the contributions. And it would ensure that there is an independence of the funding from the gambling industry itself. So those are the key things I would like to see. I'm happy to discuss each of those in any level of detail people want. but it seems to me each of those stem from a public health approach, which, as I say, is the one thing we can be pleased about. And I genuinely know from private conversations as well as public conversations that Paul Scully gets it, because he used the phrase which I think sums it all up for everybody, that anyone can be harmed by gambling. And I think the minute you've got that, then you begin to understand the way in which you've got to start approaching the whole issue.
Matt, is your list that long? Are they the same? Is there anything missing from that list?
I think Don's covered most of the bases there. I just reflecting on what you said earlier, Liz, when you mentioned the first conference was 10 years ago, and I remember that very well. And I think the prevailing wisdom at the time was that problem gambling, as it was called, and it still is by some, was about the person, not the product. And it was about really an individual's predisposition to getting addicted. And it was about really locating the blame or the cause in the individual solely. So this was a very useful lever that was pulled by those wanting to protect the status quo when it came to things like fixed odds betting terminals. So the people defending fixed odds betting terminals would say that there's no point regulating these products or reducing the maximum stake because problem gamblers will be problem gamblers whatever. And obviously when you looked at the data and you looked at the evidence around fixed odds betting terminals and the fact that 50% of people that used them were either addicted or at risk, and you compared this to whole population prevalence rates, and you compared this also to the rates of harm associated with other products, you recognise very quickly that there was a problem with this particular product. And obviously that campaign to reduce the maximum stake to £2 a spin spanned very many years. But I think in about 2015, the Responsible Gambling Strategy Board, when it published its strategy that year, acknowledged that there was a role in products and practices and environments in inducing or exacerbating gambling-related harm. I think that as well as the review of fixed odds betting terminals and the resulting cut in the maximum stake, was the first public health measure that the government has introduced. So when you talk about how we reform gambling policy to have a public health approach, I think that it's worth looking at that as a case study. It is the regulation of products, because this is a whole population policy, a measure that applies across the population to prevent harm that is associated with a particular product where it is, clearly a problem. And I think that there's parallels with online slots. I think since the cut in the maximum stake on fixed odds betting terminals, clearly online slots is where the majority of the revenue and the majority of the harm is. So I think it makes a lot of sense for the government to look at limiting the stakes. Hopefully that comes in the white paper on this particular product. But I think it's measures like that where we acknowledge that gambling harm is not just a result of an individual's predisposition or their underlying mental health issues. That may contribute, that may exacerbate, but it's also the products and practices of the sector.
I think that rings in my head. I remember the change in TAC, and I think I was going to ask you when, 2015, but it also rings with me in other sectors and where there has been a shift in thinking like that in other sectors. And I come from the financial services sector, and for me, that a lot of that really rings true. So thank you for raising that as an issue. I do think ministers don't tell you very much when they're trying to keep a white paper under wraps and actually get it out in a few weeks' time. But to what extent do we think this white paper, it's long anticipated, we've been hearing all sorts of things that might be in it, such as the affordability checks that you mentioned, the know your customer, the single customer view that we've adopted in the financial services sector quite effectively in some cases. To what extent do you think that white paper will really be able to ensure enough suitable steps?
No, I mean, the critical thing that was said by Paul Scully today is not that the white paper is going to be out in weeks. He's been saying that we've had in months, in years, in a lifetime, in whatever. I mean, forget all of that. The important thing he said is that the white paper is not the end of the issue. And so really important for us all to remember two key things. One is that a large number of changes, the sorts of changes I would like to see, can be introduced without the need for any new legislation. Changes can be made in terms of the regulations around online slots and casinos and so on by the Gambling Commission. They've already made some changes. Changes can be made to advertising regulations because there is a bit within the 2005 Act that enables that to be done. A statutory levy can be introduced under the existing legislation. Fascinating, if you look at the 2005 Gambling Act, it actually says the Secretary of State may introduce a statutory levy by this means, this means, this means, and if he doesn't like any of those, by any other means he wants to do it. So it is perfectly possible to make change. The introduction, for instance, of a gambling ombudsman is a bit more difficult to do it in a way that would have a real clout without statutory new legislation. So changes can be made now. We don't need a white paper to do that. When the white paper comes out, there will be an opportunity for further discussion and debate. So the white paper, in a sense, is important in that it will show the way the thinking goes. What's going to be in that? I have frankly no idea, because there have been two white papers that have already been approved by previous cabinets. It's been delayed many times. There's yet another one now being drafted. I've had some discussions with people in number 10 about this who are clearly brand new to it and are thinking their way through it. So I frankly have no idea what's going to be in the white paper. I'm optimistic that we're beginning to get them to go back towards thinking about some of these key things. I genuinely don't know. What matters is putting the pressure on for all of us from conferences like this, the work that you do, putting pressure on the government now and on the Minister and the Secretary of State, the Prime Minister, so that when a white paper comes out, it gives us at least the headlines in the areas we want.
The window of opportunity could be short. I will say no more, but Matt, do you think, therefore, given that there could be other quick wins and other ways to achieve some of the results we'd like to achieve, that there is a role for the wider gambling industry to take a public health approach without waiting for the white paper, the legislation that follows it, and possibly a change of government that delays it?
Yeah, I think that the problem with this review has been the framing of it, where it's been billed as a once-in-a-generation opportunity to update our gambling laws, when really I think it's actually just slowed progress down. And I think a lot of things that will be in it, obviously there'll be a consultation period after, but that shouldn't be the end of the conversation. There might be things that work, there might be things that don't work, and I think actually having this full and final process has meant that there has been more pressure to get it right, get it absolutely right. And I think that's what's caused the delay and that's what's slowed things down. Now, on the subject of whether the industry can take a public health approach, I think that it's very difficult for gambling operators to do things, particularly publicly listed ones, that are going to reduce their profits, particularly in the short term. And therefore, I think there is a need for regulation in order to level the playing field. And that's why I think it's very important that this review introduces measures that are going to obviously reduce harm and then that apply to the sector as a whole. That said, there are certainly some, I think, elements of what the gambling industry or some operators have done that have gestured in that direction, in the direction of at least acknowledging that there probably is a need for a public health approach. I'm thinking of, well, Paddy Power, when we were campaigning on fixed odds betting terminals, they supported a stake reduction to £10 or less. That's a public health measure. Flutter, which is obviously their parent company now, has said that under 25s can't deposit more than £500 a month. Now, you might think £500 a month is a bit much, a bit on the high side, but that is still a public health measure. So it's these types of things, and I think that Obviously, if operators can do them unilaterally, that's great, but I think I'd take a more pragmatic view that if they were to do that and it was to be effective, that would obviously have an impact on their profits, which is very difficult for them to kind of justify.
Understood. So one of the big questions for me then is, what are other sectors doing? What have other sectors done? What can we learn from other sector reforms that we could apply to gambling? Either, both.
Well, let me. Your interest is in the financial services, and in financial services area, there's the whole important issue of giving people financial advice. And financial advice is provided by a number of organisations. And how do they get their money? They get it through a statutory levy on financial institutions. So the argument that the government uses, particularly the Treasury, who don't like hypothecated tax, is that they're opposed to there being a statutory levy because it would be seen as a hypothecated tax. So I just draw attention to the fact that in your former areas of interest, there is already a statutory levy. It's worth remembering too that there is a statutory levy for horse racing. The horse racing statutory levy brings in something now slightly less than it used to be, round about £80 million a year for four-legged animals, whereas at the moment the voluntary levy for human beings brings in about £25–30 million a year. So it's clearly a case of 4 legs good, 2 legs bad. And a statutory levy which would bring in that certainty of funding for research, education, and treatment, and give an opportunity for long-term planning, I think is really important. So I've given you one example. There are many others. But I just want to say one other thing about the importance of the statutory levy, because I think it was great. Professor Whitty was here at the beginning, giving us some of his understanding of what the situation is. But he himself admitted that our research base is still somewhat limited. And the importance of getting research that enables us to make the right decisions that really are evidence-based relies on having that research done. And as we know, at the moment, because there is this sense of being tainted money, much of the research we'd want to do isn't being carried out. So I very much think that learning the lessons that you can have a statutory levy, it's a perfectly sensible thing to do, is really important for purposes of research as well as for education and treatment.
Matt, any other sectors that you might draw on?
I think in pretty much every other sector, the quality of data is so much better. And I think there's a real problem with gambling in terms of, I mean, every organisation and entity that tries to do an economic analysis of the impact of online gambling on certain areas of the country or on gambling-related harm or the cost of gambling-related harm is confronted with this ridiculous hurdle of not being able to access data or not having quality data. And if we're really going to understand where the harms are and where the problems are and which products are causing the problems or which geographical areas have the higher rate of harms, or, you know, we have to have a proper line of sight on that. And I think it's so crucial in the review that the Gambling Commission is able to request operator data far more frequently than it does. I think there's a case for, you know, as good as real-time operator data. I think that we need to have better data on gambling as a whole in terms of health, in terms of I think incorporating that into all other different areas, because when you speak to research organisations, they all say the same thing. And the shame of it is, when access to data is granted, the quality of the work is brilliant. Like the David Forrest patterns of play research that was commissioned by GambleAware, the insights were phenomenal, and we need more research like that. And I think in order for that to happen, I think access to data has to be written into licensing.
Yeah, interesting thought, and something that's been echoed in lots of other sectors for lots of those reasons. We've talked a bit about affected others this morning, and that seems to me and I suppose my own personal experience of gambling is from that angle. But we need to ensure that affected others are supported, and what steps do we need to take to ensure that they're also accounted for within a public health approach? Any thoughts on that?
So I think I'm glad that Professor Whitty highlighted this when he spoke, but the gambling harms affect not just an individual, but obviously up to a dozen others, I think, is the figure. But how can affected others be taken into account? Well, I think it's so important that people are aware of what the signs are, not just so they can act on it on that themselves, but they can spot them in others. And it is difficult to spot someone with gambling problems, but I think now it's less difficult because people are, able to gamble on their phones, and that's where most of the gambling takes place. And if people are on their phones a lot, that could be a sign. If someone's out on their phone a lot and checking their bets or putting more bets on, that could be a sign. So I think people who are affected aren't just family, they're friends, and those friends can be the support network that can act as early intervention. But people absolutely have to be aware of the signs. And I think education can't stop with schools. I think there's a generation of people, like obviously I'm involved with GambAN, and we're obviously in the second year now of Talk Ban Stop, and we're finding that it's actually people in their 40s that are most likely to take up the service, and this is people that left school a long time ago, and online gambling came into their lives 10 years ago. So, there's a whole generation of people that need to be educated about the harms and about the signs that aren't in school. So how do we do that? And I think that's an important question to ask.
Very.
The one thing I'd add to, I agree absolutely everything Matt just said. The one thing that I think was picked up briefly in some of the conversations earlier, touched on by Professor Whitty, but also in our introductory thing about future activities by GambleAware, and that is the whole issue of stigma. I'm delighted that more work's going to be done on that. I'm delighted that there's now a new organisation been set up tackling gambling stigma and so on. But the issue of stigma is really important that we understand it better, because that is one of the reasons why people themselves have difficulty coming forward, and equally why the affected others, the 3.5 million, as Professor Whitty suggested the number was, also have difficulty, because you don't like saying my son, my brother, my aunt, whatever, has got this problem. Because, go back to our beginning conversation, it always has been assumed that it was the fault of the individual and the blame is put on the individual. Now, as we begin to move towards a public health approach and start to do, as Paul Scully says he wants to do, having a public awareness of the dangers, then perhaps we can begin to reduce that stigma and people feel more willing to come forward and seek help. But it's equally worth remembering that even when we have these 15 additional, all the 15 clinics are done, the amount of help and support will still not be enough to meet all of the needs. So as more people come forward, we certainly need to get more money in to help fund the treatment and support that's going to be needed.
I see bits of paper with 2 minutes and things on. Two very quick questions from the audience, as I don't have any from Slido. Ellie, I'm coming to you next. There's a hand there. Microphone on its way. Thank you very much. And then I'll come to you.
Thank you very much. I'm Sharon Parr from the Epic Restart Foundation. Thank you very much for your contributions. Really interesting. I just wondered about your views on gambling advertising in sport, in particular football, and whether you support the Let's Kick gambling advertising out of football.
Thank you very much for that. And of course, there's the BBC online article this morning, if you haven't read it, on the prediction of a perfect storm because of the World Cup Christmas and the cost of living crisis. Yeah. Either if you want to pick that up.
Yeah, I do support it. And the reason I support it is because I think that young people, children, obviously, they're not supposed to be able to gamble in a regulated sector, but they're growing up with a lot of conditioning in associating gambling with football. And by the time they turn 18, the first thing they do is download all the gambling apps. And we know that young people, particularly young men in age 18 to 24, are at the highest risk of developing gambling problems. And I think that is storing up problems for the future. One might argue that a lot of the shirt sponsors aren't licensed operators, or they don't have much of a UK presence in Britain. They're white labels, but they all have bet in their name. And I think that is really serving the purpose anyway. People just Google bet and they'll find some other licensed operator to gamble with here. So I think that there's a problem. And I think really what that stems from is that the current business model of the gambling industry is that whatever statistic you look at, it could be the David Forrest research I mentioned earlier, but 86% of the profit that found coming from 5% of the gamblers, or 60% coming from 5% who are addicted or at risk. If you look at Lord Foster's House of Lords Gambling Industry Select Committee report, that's a business model that's very difficult, I think, to justify the promotion of. Because essentially what you have is football being used as a customer acquisition method to then cross-sell the more addictive slots and casino content. And I think if you made the industry safer and less reliant on people that were losing more than they could afford, time up, then...
that was for your benefit.
That's
but
just
you're
for
okay
me.
now.
Sorry, I'm going on too long. Then I think it would be easier to justify promotion of the sector. Thanks, sorry.
Poor Matt had this big thing flash up saying "time up!" exclamation mark. It's a very, very.
It wasn't directed at you personally. Can I just say there may be other search engines available? We better just qualify that, Dawn.
I mean, I absolutely agree with Matt. I'm in favour of doing it. I'm worried that if we just focus on the football and gambling advertising issue, we will miss the really important things about direct marketing to individuals with free bet offers and all of those things, which I actually think are probably even more pernicious. There is the real problem with the football issue, and it's not just on football shirts, but it's actually in match day magazines, it's around the games and so on, about the normalisation of gambling and the enjoyment of sport. So, of course, I agree with all of those. I leave you with two thoughts, however. One is, of course, you shouldn't do anything that persuades children to be involved in gambling, despite the very large number of kids who apparently are signed up to various gambling companies' sites and so on. But just here's a thought. Match of the Day magazine, produced by the BBC, has photographs in it of their favourite sporting heroes, very often wearing a gambling company logo, often not UK, by the way, but often a gambling company logo on their thing. And you can see 20, 30, 40 photographs of that in a children's magazine designed, it particularly says, by the BBC, for footy-mad youngsters. Mm-hmm. So how is that possible under our current rules? Well, apparently it's not advertising. And so, you know, it's just one of the small issues that we really have got to address. And I'm in discussions with the BBC about it. And the second thing that I just leave you with this is that everybody will say, if you stop doing allowing that advertising to take place, there's a huge loss of income. Well, there is a whole issue around sports rights. Why is it that if a ballet dancer does a ballet dance, that is covered by its protected IP rights, whereas a football game doesn't have the same protection as a drama production or whatever, and yet it is, I think, very equivalent. So there is actually a solution to the problem of finding an alternative source of income, which is in terms of recognising the sports rights of horse racing right the way through to football. So there's solutions to these things as well that I think can address the problem.
Interesting. As a former BBC freelancer, I've often wondered why there are different rules for different departments. Ellie, a very quick last question to you.
I'm Dr. Ellie Cannon, I'm a GP. Very quick question. Is gambling part of the online safety bill or not?
No, it has just been effectively taken out because the government have dropped what they call the legal but harmful section within the legislation. I've got a meeting, in fact, straight after this, although not at the same time I thought it was now, where we're actually going to discuss how we can introduce amendments into the online safety bill in relation to gambling in the now cut down version of the bill that is before us. The crucially important area that is still in is harms to children, and we'll be looking at that in particular. But the wider harms, it may be a struggle, but we're looking to find a way of doing it. But it's currently not covered in the sense you might have hoped.
Okay, we're going to finish on time.
Wow. Well done.
Bang on time. Not the 5 minutes earlier for Don's benefit. 2 words in final reflection. 2 words.
2 words. Any 2
words.
Reform gambling.
Public health.
Brilliant. Thank you very much. This was In Conversation With. Oh, that's the one and only time I've ever asked anybody to sum up in 2 words, and they've managed to do it. Thank you very much for being a wonderful In Conversation With. Okay, we have a break now until 12:15, and we will be starting on the dot of 12:15. I will see you back in here then. And don't forget the poster presentations, please. Thank you all. Thank you for being back on time. We have one session now before lunch. So we're going to crack on. The panel is assembled, as you can see. We have one session before we break for lunch. We will break for lunch at 1 o'clock. In the meantime, on the stage, we have Georgia, we have John, David, and Steve. Kelsey isn't with us, but please welcome the chair of this session, who is the Chief Communications Officer for GambleAware, Alexia Clifford, and she was previously at Public Health England as Director of Marketing. So, Alexia, over to you.
Thank you, Liz, and thank you, everybody. I hope you can hear me. As Liz said, I'm Alexia Clifford. I'm the Chief Comms Officer at GambleAware, and I'm absolutely delighted to be chairing this panel on breaking down the barriers today. As we know, we need action on all fronts to secure the best outcomes for people at risk of gambling harms, and this isn't anything that any one of us can fix alone. So I'm absolutely delighted to be joined on the panel today by 4 leading experts in the field to share their perspectives on the barriers we face and, importantly, some of the ways in which we can overcome those barriers. So today we're going to hear from Georgia Mealings, who is Research Executive at the IFF Research Institute. Georgia is going to be talking about some of the issues that prevent gambling harms being considered a public health issue amongst practitioners and those with lived experience, particularly women. And Georgia is going to be sharing some brand new research that's been published this week on those areas. We're also joined by Professor John McElhaney, pronounced correctly, I hope, who is Chartered Psychologist and Chartered Scientist at Bournemouth University. John's a leading expert in risky behaviours, including gambling, alcohol use and digital addiction. And today, John's going to be sharing his thoughts on how technology can break down the barriers to addressing gambling harm. We're also joined by David Quinty. Welcome, David, who has lived experience of gambling harm and has been gambling free now for over 7 years. David works to tackle stigma and influence governance and policy. And today, David's going to be giving his thoughts on the need for meaningful public and patient involvement. And last but not least, we welcome Steve Watts to the panel, who also has lived experience of gambling harms as an affected other. Steve set up the GamFam charity to support others in a similar position. And in today's session, Steve's going to be talking in his capacity as chair of Alert, the lived experience charity. And Steve's going to be talking about how evidence-based feedback can remove some of the barriers to seeking support. So, fantastic panel, and we will hear from them in just a minute. Before we start, I just wanted to say one more word about stigma. So one of the key themes that has been discussed in the conference today, this morning, and will be discussed or come through as a theme in the presentations, is the critically harmful role that stigma plays in reducing gambling harms. We know that stigma is a barrier to self-identification, we know that stigma is a barrier to help seeking, and we know that stigma is in itself a harm which can exacerbate existing gambling harms. So for this reason, stigma will be a major focus of GambleAware's work over the next year and into the next 3 years. And what we're going to be trying to do is to do 2 things. First of all, to change societal perceptions of people who are experiencing gambling harms. We want to be really, really clear that gambling harms can affect anybody. It's not the fault of the individual, and it is possible to change and recover. And then the second key aim over the next year is going to be around normalising help-seeking behaviours. So there's been a lot of discussion today about how the shame, guilt, embarrassment associated with gambling harms is a key barrier to people being able to take that first step, to look for support, to have a conversation. And we want to really focus our work around that help-seeking and normalising that help-seeking over the coming months and years. And ultimately, we want to increase the number of people who are taking that first step for help and support. So it's a big ambition, and to achieve it, we'll be doing a number of things which you'll see being delivered over the next few months. We have already touched on a major new public health behaviour change campaign focused on stigma, which we'll be launching early in the new year. And alongside that major new push for our campaigning, you'll see addressing stigma being addressed as a key theme in our wider programmes of activity. So whether that's training programmes, education programmes, research programmes, digital partnerships activity, and I hope you'll start to see that coming through over the next few months and years. So I just wanted to say that before we start, but without further ado, I'm going to hand over to our panel of experts. Each of them will talk for about 5 minutes on their own perspectives. I'll ask a few questions at the end, and then we'll try hard to sort of keep enough time at the end for questions from the audience. So I'm going to hand over to you, Georgia.
Great. Right. So yes, as mentioned, my name is Georgia Mealings. I'm a researcher from IFF Research. We're an independent social research agency. I'm very quickly going to be taking you through some of the key themes that we've identified from research we've done this year on barriers to locating problem gambling within a public health context. So this will largely be based on the evaluation we did of the primary care gambling service, which was actually published yesterday, so you can now find that online. And this iterative program of research we've been doing with the University of Bristol and GambCare on women who gamble and women who are affected by people who gamble. And the first 2 phases of this research you can find online as well. So to start off, I want to talk about knowledge within the primary care setting. So as part of the PCGS evaluation, we did a survey with about 150 GPs, and we found that just over half of them believe it's their responsibility to discuss gambling harms with their patients. Now, obviously, there's a way to go here, but considering the enormous pressures on GPs and the fact that gambling has only very recently been kind of put on the public health agenda, I see this as a very promising baseline to start off with, especially as this survey was conducted kind of in the context of the pandemic as well. However, despite so many GPs wanting to be having these conversations, only 25% were aware of treatment and prevention services in their area, and only 10% felt that they had enough information about those services as well. We also found that GPs generally didn't have a lot of confidence in initiating those discussions with patients and being able to identify the signs of gambling harms either. However, we did ask them about kind of PCGS and how they would feel about a service like this in their area, and 82% agreed that there was a need for it. 92% said that they would refer patients into it. So awareness is currently low in this space, and the competing priorities on GPs are going to present a challenge, but the appetite is there to be doing more, and that's a really promising thing. And this is kind of connected to my second point. Awareness is not just an issue at the level of the practitioner, but of the prospective patient as well. So people experiencing gambling harms and affected others do not recognize the harms of gambling either, and lack awareness of the support that's available to them. And of course, as been mentioned a lot today, stigma and shame prevent individuals from reaching out to informal and formal sources of support. With the PCGS evaluation, we saw this in a few instances where patients said that they were worried about having a gambling disorder on their GP record. There was also a great hesitancy to take part in group therapy because of running into someone that they'd seen there on the street or in Tesco. But when it comes to awareness, when it comes to the practical barriers of support, and when it comes to stigma and shame as well, something that came out across the Women in Gambling Project and our research with PCGS is that these barriers need to be understood within an individual's cultural and social context. There needs to be a consideration of intersectional identities. The fact that barriers are very specific to an individual's environment, the politics around them. So, for example, people with caring responsibilities are going to face a practical barrier to just attending appointments, and that disproportionately affects women. One of the things that came up time and time again with PCGS was the benefit of being an NHS service, because so many people do not have the financial resources to access things like talking therapies, which are extremely expensive in the UK if you go private. So awareness needs to be tackled at both levels. People need the resources, and we need to consider kind of the specific individual reasons why people aren't able to access support. And again, I think this links to my third point, which is about comorbidities, which I understand will be gone into in greater depth later on. If we're focusing on the individual experience, we need to understand that people that are experiencing gambling harms are presenting with all sorts of comorbidities and other social issues. And this creates a complicated picture for health professionals. It makes it a much bigger challenge to confront. And there's no quick fix to gambling harms either. But it also you see the opportunities of a public health approach, which considers the social determinants of health, which considers a holistic kind of multi-agency approach. One of the great learnings of PCGS was the value of things like social prescribing, which is becoming a much bigger part of the public health agenda in the UK. The need to be referring to things like employment and debt support alongside traditional forms of interventions like talking therapies, like CBT. So my kind of summing up points was the need to address awareness among people affected by gambling, but also health practitioners, and to make sure the resources are there to support both groups. The need to consider intersectional identities of patients and how support should best be targeted. And the need to consider comorbidities and the value of a multi-agency approach in addressing both the social and the biomedical.
Thank you, Georgia. I'm going to pass over to John. Thank you.
Thank you. So hello, so I'm going to be presenting some research we've done at Bournemouth University, funded by GambleAware. I'm part of a research team, and I think one of our strengths is, without trying to sell ourselves, one of our strengths is we are an interdisciplinary team, so people from psychology, people from health, people from software engineering, people from marketing, my colleague Dr. Vera Bolat, who's in the room. And we think that's really important, actually, to have that breadth of experience, because gambling is such a complex phenomenon that you need to have different expertise. We also try very much to involve the wisdom and insight of people with lived experience. So we've recently been in discussion with Glenn, thanks to David. And we've also with Stuart Lee. People might know Stu. He's someone in recovery who's also an artist. Some of his artwork here. Because we just feel so important. I think academia sometimes doesn't really listen very well. It talks very well, doesn't always listen very well. The questions we kind of put to ourselves, which in hindsight are quite challenging questions, which keeps life interesting. Can we use technology to try to reduce harmful online gambling? How can you change the kind of what's the impact of gambling operator websites? Because public health doesn't exist in a vacuum. If you're doing a public health campaign, you have to understand the context in which that is existing. So understanding what might facilitate or hinder an operator website's public health campaign is very important. And how can research be implemented in a meaningful way? So again, academics, we tend to kind of produce these wonderful results which would work perfectly in an ideal world, but we don't live in an ideal world. We try to understand what's actually useful, what will actually be used by stakeholders. We had 2 work packages in our research. The first package is around looking at social norms and goal setting, which are fairly well-known and established techniques in public health and other behaviours. But we can't just assume what works elsewhere is going to work for gambling, so we've been trying to test the feasibility of these approaches. We've been supported by having player data from one of the operators, Tote. And from a psychological research point of view, having kind of objective data is really helpful. It's quite rare actually to have that. It's something which can be quite powerful. And our second work package, we're looking at, say, gambling operator websites, trying to understand the kind of player journey, how does that influence what people think is normal, and that kind of thing. We had planned to do work package 1, then work package 2, as you might guess, but the project began in early 2020, and something else began then, as Professor Whitty could attest to. So we had to kind of shuffle things around. We're very grateful to GambleAware for being very supportive on that point. So we've kind of done work package 2 first, and we're now finishing off work package 1. Throughout the kind of both work packages, the common theme is about kind of what people think is normal, which relates very much to stigma. So the kind of perception of social norms. And when we were preparing this, I was asked, can you show a single image that will communicate social norms? I thought, this is quite a good one. We are all much more influenced by what we think is normal than we like to admit, especially in Western cultures. We put a lot of value on being individuals, but we are so easily influenced. And what's interesting is we often misperceive, we often get things wrong. And so a social norms campaign, on a very basic level, just tries to challenge that idea. This is an example from the USA where lots of kids were convinced that all their friends were smoking because they all believed each other's lies. We really thought this was a common thing. So a really simple idea, just try and challenge that kind of perception. And what we're doing in our research is trying to take it to the next level, so using the online technology and trying to make things more personalised. So I said we've got initial results from our first work package, because that ended up being our second work package. We've 168 participants. We've got 98% retention rate we're really pleased with. I'm actually relieved it's not 100% because people wouldn't believe us if we said 100%, but we're pleased with what we've got. We've been doing interviews, getting feedback from people, so as soon as someone receives a message on their smartphone, they can give us a feedback. We can say this is useful, helpful, patronising, insulting. And again, that's something that in research we don't often do very well. We don't always listen very well. We tend to do research at people rather than with them. With the social norms element, we found some quite interesting things. So a lot of the standard kind of misperceptions you see and alcohol, smoking, sun cream use, almost any other health behaviour are not showing up in gambling. And I think it just really demonstrates gambling does have some unique characteristics, probably linked to the stigma and kind of social perceptions. We found misperceptions around attitudes, things like help seeking. We found that people seem to think of help seeking as being quite a negative thing that people wouldn't do, which is of course a bit concerning. We've had kind of mixed views on people's kind of reaction to social norms messages, although we know from our research, people will often say something isn't going to change their behaviour, but it actually does. With goal setting, we found people quite receptive in general, linked to the kind of social norms and the stigma. People do sometimes set quite unrealistic goals, which is a matter of concern. So at the moment we're assessing how much can we take this evidence and try to apply it to online gambling. From our second work package, we found lots of good practice on operator websites, but we found bad practice as well. We found things like on mobile sites, for example, the safer or responsible gambling message is often very hard to find, it's difficult to get to. We've been using eye tracking research to try to kind of quantify that. In terms of our recommendations, it's really about clarity and transparency and informed decision making. It feels that things which should feel quite self-evident, but we've found from our research doesn't always happen, doesn't always come across in the operator websites. And we really kind of feel there's a need for much more research. I mean, there's some excellent research takes place from people in this room, but given the size of gambling, it's always surprised me how few gambling researchers there actually are. There's not many of them. So we really do need to have much more research. On that point, we are very open to research. Yes, I've deliberately put a picture of a beach in there to try and influence you. Come to Bournemouth, come and speak to us. There's so much potential out there, and that's, as academics, we really do want to be having a meaningful impact. So we're very, very happy to any collaboration people might want to put forward. Thank you.
Great, thank you, John.
Hi everyone, you okay? Firstly, thank you for calling me an expert, Alexia. Not by choice, but here we go. So I'm David Quinty, so I'm from the Gambling Lived Experience Network. So I'm here today to represent Glenn. The first thing I want to talk about, because this is a really strong thing for me. So when you're talking about tackling gambling harms as a public issue, I think the first thing we need to look at is that we need to be collaborative with the organisations that have been set to actually tackle gambling harm. So we need to work with the operators, with health and treatment providers. We need to work with doctors, anybody, other charities, anybody with lived experience who can actually help get this message across, because it's so huge and we need full collaboration from everybody. As someone who's had lived experience, I've been gamble-free now for over 7 years, I wanted to touch on some of the impacts that happen when someone's going through gambling harm. So initially you might think, well, their finances are affected, that they're going to lose money, and we do. You're always chasing your losses. But there's other things that are massively impacted that you don't feel are going to happen at that point. So your mental health starts to decline. You start to get into other things like more drinking. I was doing more of that when I was gambling. Your relationships suffer because you're not really there. You're there, but you're not, and you're doing things that you can't tell the loved ones about. Things like housing. So if you're gambling all the time and taking out money you don't have, potentially you've got the risk of losing your house as well. So everything just becomes huge and every area is affected massively. So, these impacts need to be looked at individually. It's not just about losing money, it's about the damage it does to you and damages to other people as well. Okay, so I mentioned about collaboration being the key. So as Glenn, what we want to do is we want to knock on people's doors, go in there and talk about what lived experience can offer. the skills that we can do, because we feel that at the moment there's a lack of that in organisations, and there needs to be more of how we can help people understand what people are going through. But also it needs to be a two-way thing, so we want people coming to us. It shouldn't just be about us saying, here we are, use us, utilise us. We want people to come to us as well and say, actually, we want your support to help us do things. I want to talk about some of the barriers to success. So the first thing I want to talk about was the actual operators themselves. So recently I was involved in the World Cup campaign, which is obviously the World Cup's on now, which was really, really interesting to do. One thing I've noticed is, and one thing that's been brought up, is that the amount of advertising while the World Cup is on, or just games are on. So every other advert you're seeing a provider do an advert, and it's not just a case of, here's the advert, but they're putting odds on there, they're giving you a live bet straight away. So people who are going through that and maybe have lost money will be doing that, they'll be on that. And it looks glamorous, you've got all these stars doing it. So, but the actual amount of it is huge, and they've got the taglines at the bottom, which is great, but are you really seeing that? You're just seeing the bet, and if you're in that moment, that's all you see. So that definitely needs to be tackled. The other thing I want to talk about was the online capacity, which is huge. So most of my debt came from online gambling, because roulette wheels, which was basically when I was at the end of my when I was getting hit rock bottom. At the moment, you can access 24/7 anything you want to do. So if you don't want to wait for a football game, you can go on there and you can bet on something else. The damage that causes and the red flags aren't picked up. So, like we talked about data previously, I think someone mentioned about data. Why aren't we using data? Why aren't we seeing how many sites that people are linked onto? Why aren't we asking people to identify that? Probably because operators don't want to lose that revenue, as was mentioned before, by making it not exciting. So there's definitely online work that needs to be done. And the massive thing that everyone's talked about today, which is brilliant, and I think we've all covered it, is stigma. I mean, stigma is massive. So again, what people don't understand is that people don't really understand gambling. I did a Sky News interview the other day, and I saw some comments on the back of it, and people were saying things like, well, how can you get addicted to gambling? And sod that, I'm going to go and put a £20 bet on. So there's a real lack of understanding, and people aren't coming forward because they're ashamed and they feel like they can't talk about it. I think it's seen as like an invisible addiction sometimes. You get alcoholism and drug addiction is very much more there, and prevalent, but you don't really see it sometimes. I think mentioned you see it more on phones now, but you don't really see it a lot. Now, when you're gambling, what you don't understand is it's not just a middle-aged man like me going into a bookies all the time to put a bet on. Gamblers are anybody, so it's women, it's children, as we've talked about, and the damage we're doing that. So every time I put a bet on, I'm damaging a loved one, and if my children are seeing that behaviour, that's damaging them as well. So there's a wide range of people from different ethnic backgrounds, from different, so they're being affected. So the stigma is huge, and we have to tackle it right away. The more people that come forward, then the more early intervention that we can do. And that's what Glenn wants to promote. Not finished yet. Well, thanks for your applause. I appreciate it. Don't be shy afterwards as well. So lived experience. So I've kind of touched on this, but we want to be the voice of the community. So we do want to go in there. We want to talk about strategy. We want to talk about how we can impact things. We're not there to judge, and I'm not someone personally who wants gambling to be banned outright, but we need to talk about the people who are suffering and what things we can put in place. So having us in there, I think just adds an element that is a new skill in a way, gambling by, expert by gambling, unfortunately, but I think there's things that we can do to support that. So the great thing is that Glenn, we've been around about 2 years, but recently we've just acquired our charitable status. And we've also been able to get funding from GambleAware for the next 3 years, so that is massive and that's huge. And now we can start really making some progress with what we're doing. We've got a board of trustees in place now. We've gone through governance, so everyone's in a really good place. We're going to recruit in January, so if anyone wants to look at the adverts, if they want jobs, that's cool. But we're going to look at an operations lead and different roles that we can do to take this message forward. We want to grow our already grown community that we have. And again, we just want to collaborate with everybody who we can do. Just conclusion, really, there's a slide there of our details in case you want to get in touch or leave any queries. But we invite you to collaborate with us and to ensure the voices of lived experience are embedded in your services. So thank you for your time. Appreciate it.
Okay, look, thanks for inviting us today. My name is Steve Watts. As introduced, I'm the founder of a charity called GamFam. I'm an affected other. I worked in education for 20 years previously to this. And when I moved into this space, there seemed to be very, very little support and help for affected others. So, and also treatment. And our access as a family to treatment was quite narrow, and quite negative. So the reason I joined Alerts was to try and improve my understanding of what treatment and support's out there. I'm going to need to put my glasses on because I can't see. So I'm here today in my capacity as the chair of the Alerts. So the Alerts is an independent, lived experience group that we hope to work with service users and with treatment providers to get evidence-based feedback. And we really firmly believe that lived experience has got a crucial part to play. Just because we've had lived experience doesn't make us experts, but we have a unique experience, and we feel that our journeys are worth listening to. And if we can work in collaboration with treatment providers, we really feel that the input that lived experience brings is different. It can help treatment providers make a real difference. We're not Ofsted inspectors, we're not auditors, we're a group of well-meaning people who deliver feedback from a good place. And we want our unique experiences, the experiences of others, we want to communicate that to treatment providers, let them know what works well, and if something is working well, we can share that good practice. But also if it's not working so well, we want to call it out. We want to tell people what's not working so well so that the treatment providers can make a difference. And it says there at the bottom of the slide there, we want the best possible outcomes for anybody going through treatment. And what we don't want is our experiences to have been in vain. So everybody on the group, I'm just here representing 16 to 20 people today. I'm just the voice of the group today, but we're a diverse group in terms of experiences, backgrounds. We've got lived experience in terms of direct gambling harms, affected others from different communities as well. So, I'm here representing that collection. We've shared our vision, mission and aims with all of the treatment providers. You can check all of this out on our website, but I just want to talk about what our vision and our mission is. So our vision is that there's no barriers to anyone accessing effective treatment and support. And when I hear that statistic that only 3% of people who suffer gambling harms access treatment compared to 15 to 20% for drugs and alcohol, that's just not good enough. And I know from our own personal experience, we can only ever be an expert of our own personal experience, that we found it really difficult to engage when we spoke to doctors, hospital, citizens' advice, the police. The response that we got was very, very limited. But hopefully, with events like this and the way that organisations are working to move things forward, things are beginning to change. And our mission is to ensure that lived experience has a stronger influence. And as I said right at the start, I do think that the voices of lived experience, if listened to and not just taken as a token gesture and a bit of window dressing, as we say, if they are listened to and they're firmly embedded in organisations, then I think we can really, really help and support people going through treatment and support the treatment providers to improve what they're doing. Just wanted to give a bit of an update really on what we've done so far in 2022 and then what we're going to be doing in 2023. Again, on our website, there's lots of information about who we are, what we're aiming to achieve. But we've rebranded in 2022. We've got a new model of working. We've increased our membership. We've set up a steering group. We've got a brand new website, brand new branding as well. We've got a social media strategy. And we've just recently introduced 2 service user engagement leads. So if you go onto our website, you'll see a survey. And anybody in this room, if you've been affected by gambling harms or if you've been through treatment, please visit our website. Give us that independent feedback, and one of our service user engagement leads will book a one-to-one call in with you. And we want to find out how your journey was, good or bad. If it's good, let us know. If it's not so good, let us know. We're interested in that. Excuse me. We've conducted stage 1 interviews with the majority of the 14 NGTS providers. We've got more going on in the month of December and January. We've hosted 9 service user forums, so that's where we invite anybody from the lived experience community to come onto a call and share their experiences. We've got a team of dedicated core members that work alongside our coordinator, which is Wayne Foster. You out there somewhere, Wayne? Where is he? Perhaps he's gone and done a runner. Oh, is he?
He's hiding at the back.
He's hiding at the back. But look, talk to Wayne today, find out more about it, about the group and what we can offer as well. And I will say that we've been really delighted with the response of the treatment providers and saying that they want to work with us. And we're not afraid to have difficult conversations. If things are not good, we're going to tell you. We're just a middleman here, if you like, and we'll let you know if things are good, and we'll let you know if things are not so good as well. We just want those honest, evidence-based conversations, and we'll do it in a professional manner as well. So looking forward to 2023, much of the same. We want to carry on having those welcome meetings. Wayne and the team will be going out doing site visits where appropriate. We hope to get by the end of March 2023 at least 2 site visits done by per treatment provider. Some of those are already started. We want to gather two-way feedback. We want to hear from the treatment providers how we're doing. How we're doing as an organisation, what went well for the visit from the Alerts Corps member, and what could we do better. So we're willing to learn as well. We want to continue to give that honest and evidence-based feedback. We want to continue to promote how important we feel that lived experience is and what a difference we can make. We're really interested in this new regional commissioning approach and to see how that can feed into the work that the alerts do. And at the end of it, we want to produce an evaluation report, just to show the impact that we've had and the difference, hopefully, that we're making with the treatment providers. Just a few contact details there. We've got our website, alertsgroup.co.uk. You can find us on all the usual platforms on social media. If you want to contact us direct, there's Wayne's email address. That's wayne@alertsgroup.co.uk. Or we've got a general admin at as well. But the website's there. All the contact details on the website. Please do, if you're a treatment provider outside the NGTS, do get in touch. We'd love to talk to you. If you're someone who's been through treatment, fill in our survey. We'd love to talk to you. We just want to get that feedback back, get it back to the treatment providers and make a difference. And just finally, final slide, you'll be glad to hear. If we get it right, this is a two-way approach that we're trying to do here, evidence-based, open and honest feedback. If we get it right, I think we can make a real difference. And it needs to be a team effort here. And again, just to repeat how important lived experience is, and hopefully, moving forward with the new approach, that lived experience is going to be firmly embedded in everything that we do. So thanks for listening. Cheers.
That was fantastic. Thank you, everybody, for sharing your thoughts. I mean, I've listed out at least 6 kind of barriers that we need to focus on there. So we've talked about GP awareness, we've talked about advertising, the importance of feedback and involvement, and technological and behavioural barriers. So thank you for your continued input in terms of the way that we develop and deliver our programmes, and your expertise is absolutely invaluable. So I am going to start by asking a few questions, and then we'll go to the floor. We still don't have any questions online, I don't think, so I'd encourage those people joining online to use the Slido tool and to ask us some questions. But I'm going to start with quite a big question, really, which is there's been lots of conversation today about how there's a sort of lack of evidence, and we're increasingly looking internationally for lessons to learn and to learn lessons and inspiration from what's happening globally. And there's been lots of activity. It feels like there's lots of activity happening globally at the moment. So we've referenced the Australian sort of tagline legislation. We've talked earlier about things like what's happening in Belgium and Ireland's legislative framework. So I suppose the sort of big question is, what do you think we can learn from international activity, and where are the lessons for us in the UK? And I'm going to start with Georgia on that one.
Yeah, thank you so much. So a lot of the work we do at IFF is mainly UK policy based, but we always want to be thinking internationally and learnings that can come from other countries. And I'd point people towards the evidence review that our partners at the University of Bristol conducted for the programme of research we've done with women in gambling, because there are a lot of great international insights in there. And actually, one of the gaps they identified in that is a lot of the qualitative research they drew on was the Australian context and New Zealand, but there's a kind of a lack of comparative work with the UK context, and that's really somewhere that we want to be doing more. But I think linking back to some of the things I talked about in my slides, when it comes to things like stigma, that's universal, it's something we've all talked about today, but that's really rooted in someone's individual context. It's driven by various cultural issues and barriers. And so we need to be thinking about kind of the differences between societies and what we can learn from that, but also within societies and within different groups.
Great, thank you. And Steve, was there anything you wanted to say about the international picture?
Yeah, maybe a little bit left field here, but I was reading an article the other day, the Bloomberg study, that the UK, £9 billion, is it? The leading country, and maybe we shouldn't be looking to other countries. Maybe we need to be setting the standard rather than looking what everybody else is doing. And I'm going to, again, waiting for the research to come through. The lived experience is in the room. Talk to the people that it's harming, hear their stories, and let's have some action now rather than waiting for long, drawn-out studies. You know, let's hope that the Gambling Act that comes through delivers what we need it to deliver. But let's set the standard. You know, we're taking the most money from online gambling. I think we should be world leaders in protecting people, not just playing catch-up.
Thank you. And John, is there anything you wanted to add on that? I know you've...
Yes, I mean, as a researcher, the complexity of international gambling legislation and culture and history is quite daunting. But we can use that to our advantage. We can almost use it as a natural experiment, which sounds a little bit cold, but it means trying to look at what's happening in different places and trying to work out, well, what was the impact of that? And it takes a lot of work, but perhaps what we can then do is try to figure out, yeah, what's the most effective way of addressing these issues.
Great, thank you. We do have a question in that's come through on Slido, so I'm going to come to that in a minute. Before we do, though, could you, I mean, we've talked a lot about stigma. Could you sort of talk us through any practical changes that you think need to happen to start to address some of those issues that we've talked about, and think as broadly as you possibly can, whether that's the public health sector, industry, media. I mean, I don't know who wants to take this, but what do you think needs to happen practically?
Well, I think we need to get it to the wider audience. You know, people who have been affected by gambling harms, we know how serious it is, but because it's normalised, because it's just promoted as a bit of fun that everybody does, and everybody enjoys gambling. If you've not been affected by it, you don't know about it. But we need to get it to the parents, we need to get it to the frontline professionals, we need to get it to the children in school so that they can make these informed decisions about gambling rather than about making them in the dark. As a parent, I knew nothing about gambling harms. I was fully aware about drugs and alcohol, but I had no idea how harmful gambling could be. And I think, again, when we're talking about public health approach, it's about bringing it to that wider audience. And if we can do that, promoting about, and the industry needs to take responsibility in this as well. We talk about safer gambling. Forgive me, I think it's putting all the responsibility back on the individual. Let's look about the way that the operators are operating. And if they get it wrong, what we don't want is just a slap across the wrist fine. If they're breaching their LCCP conditions, then let's hopefully they lose their licence. Or if we talk about statutory duty of care, maybe some of the senior staff in these organisations might start taking gambling harms a bit more seriously. Someone said to me this morning about the Manslaughter Act. So if somebody's committing suicide because of gambling harms, somebody needs to be held to account for that. And if the operator has failed their LCCP, £2 or £3 million fine. That's a slap on the wrist. We need action and we need those harms to stop.
David, anything?
Yeah, I just think what happens is we need to hear more people coming forward. When I first reached out, I didn't find there was a lot of support. I found it quite difficult, and it was quite raw for me to then try and pursue that and get help. So, but now there's a vast amount out there that people can do, and I think it needs to become a norm. Like we said, people still think it is a fun thing, but going through it, it's not a fun thing. Everything changes your mental health, everything. So it is a really serious thing, but people need to be aware of that. So the more people that speak about it, and are not ashamed to do that, the more realistic it will feel to people. And I think we just need to encourage that more. So I think by being lived experience and getting into places and doing that and showing that actually there is another side to this, and you can have a life after this. You just need to speak straight away. So I think that's what needs to be done.
Yeah, and I would agree with that. And thank you for your advocacy and role in doing that as part of our recent World Cup campaign, which is absolutely critical. Okay, so I am going to read a question out from the online audience, and this I think is probably a question for you, Steve, which is around the alerts group. So the question is: are the alerts group looking at the engagement of treatment providers with diverse communities? So looking specifically at the relation to the percentage of those who access services and how they look to meet their cultural needs. Is that something that's
we look at everybody that's been affected by gambling. We would encourage anybody from a diverse background, from an ethnic background, please contact us. Please, be part of what we do, because it's no good 12 white people sitting on a group trying to decide how important working with diverse communities is. We need you to be part of our group. And if we can have more people from different backgrounds, whether it's for gender, whether it's age, whether it's ethnic background, be part of what we do and help us make that change. We want to work with as many people as we can.
Great, thank you. Okay, so we've got 5 minutes left before lunch. Is there anybody in the audience who'd like to ask a question? Sorry, I think you were first. Do you want to? And if you could say, give us your name, your organisation, and who on the panel you'd like to direct the question to.
Yeah, of course. Steve and Andu. Well, 2 questions. One aimed at Steve and the other at John. I'm from Bet No More UK, but I'm also part of the alerts group, so it's not only 12 white people.
That's the point exactly.
So I just wanted to first of all, thank Steve for all of the work that he's been doing, over the past 6-7 months, as long as I've known him. But I wanted to ask him. The first question was, what's the general feedback you usually get from operators, after working with them, going through interviews with them, and how do they actually feel about, alerts, working with them, and just going through basic, questionnaires with them, and assessing basically how they're operating. And the second question to John was, how do you feel about being a researcher and being an academic, potentially trying to work with social media companies and actually using the technology, the advancements in technologies that we have now to actually protect individuals who might be vulnerable and more susceptible to falling prey to gambling products? I mean, almost everybody has a smart TV, and I think those functionalities on the smart TVs can actually prevent people from seeing certain adverts and stuff like that. And I think it takes a collaborative approach, through politicians, researchers, and campaigners to kind of ensure or try to basically address this issue, where it actually starts, since we're talking about the new digital age and the fact that people are actually, falling prey or becoming more vulnerable for the content that they see through their TVs and other kind of digital devices. Sorry, long-winded there.
We'll try and be brief with
Well, that's good. It gives me a bit of thinking time. So, listen, just right back at you. You've been a breath of fresh air since you joined Alert, Stephen, and we really appreciate your contribution. I say that on behalf of the group. You asked how treatment providers respond to our feedback. I think what we try to do is we try to make sure that it's always evidence-based. And we remain professional, and we get that sometimes we just get a snapshot of what service users have said. But if we deliver it in the right way, I'd like to think any treatment provider worth their salt would take any constructive feedback and work on it and try and improve their service. And as I said right at the start, we're not delivering anything from a bad position. What we want is our experiences, the experience of anybody else that's been through treatment, to try and help others going forward. And if we deliver it in the right way, then so far, so good. We've delivered okay feedback. We've delivered positive feedback. We've also delivered some that's maybe not so good and highlighted some areas that need to be improved. But I will say that every treatment provider that the steering group has met with on the welcome meetings has said that they want to work with us. And I think it's important that it's recognised that it is a two-way process, and our part to play in that is to remain evidence-based, remain professional, and try and change the landscape.
Thanks, Stephen. John, did you want to take the second question?
Yes, I remember when we began the research, we had discussions within university, and one of the questions was, won't gambling companies take your research and use it to learn how to market? And we kind of feel we do that already. We don't feel we can teach them anything about marketing. We're very good at it. So our kind of position has always been, we were trying to show how the algorithms and marketing techniques and strategies we use to sell products could be equally applied to selling responsible gambling. That doesn't really happen at the moment. But that's really difficult. As an academic researcher, you have to rely upon research funding, and if you do collaborate with a company, there are addiction conferences you will not be invited to as an academic if you have worked with industry. So it's a really big challenge. As we've been saying all day, we need more research, but it's very difficult sometimes trying to know how to navigate that in a way which kind of keeps your objectivity.
Brilliant, thank you. I'm afraid we don't have time for any more questions, but there will be an opportunity over lunch for you to come and find us and ask any more questions that are sort of, you'd like to ask. So all that remains now is for me to thank the panel for sharing your expertise today and to wish you an enjoyable lunch. I think it's being served now. I'm looking at Liz.
Thank you so much to the panel, and I think you really have emphasised the importance of lived experience, and there's a lot of really practical steps and organisations that are coming out of this that are really getting this to the forefront, and I think it is ultimately one of the most important and vital things we can do. So thank you very much, and thank you to Alexia for terrific chairing of the panel. And it is lunchtime. Now, we are starting back dead on the dot of 13:45, so please, you're going to have to eat quite quickly because it's, I know that it takes quite a while to get served. So we'll see you back here at 13:45 on the dot. Thank you very much. I know you are. What's the matter?
You're going to think I'm mad. I'm so nervous because I thought I was going to be talking. I thought I was going to be asked these certain questions about uniforms, and apparently it was going to be I'm going to be asked different questions, and I'm really nervous because I don't.
What do you think? What do you think of the time? We can sort this one out.
Right, so it's just like why.
Good afternoon. Thank you very much. Can I just encourage you to take your seats as quickly as possible? That's the first time I've ever had that answer from an MP. Thank you, everyone. Can I please encourage you to take your seats as quickly as possible? Thank you. Come on in and bring your lunch. I've got to get them in somehow. Can I encourage you to take your seats, please, so that we can start the next session? Thank you, everyone. Okay, welcome back, and I hope you enjoyed your lunch. I certainly enjoyed mine, and for the first time in 10 years, I got pudding. And I have to say it was very good. Thank you. Really enjoyed it. And thank you for coming back for the afternoon session. So, the first speaker this afternoon, and please welcome our first keynote speaker, is Alex Davies-Jones MP. Now, Alex is the MP for Pontypridd since December 2019. She is also Shadow Minister at the Department for Culture, Media and Sport, with responsibility for gambling. So please, round of applause for Alex.
Good afternoon, everybody, and thank you, Liz, for that kind introduction. It is a genuine honour to be with you all here this afternoon. I think it was last year, I'd been in the role for 48 hours and I'd had the kind invitation from GambleAware to come and address last year's conference. But thankfully, I'm very pleased to say a year on, I'm still in post. I know that's a bit of a political miracle these days, but don't want to jinx it. But and I'm really, really, really pleased to be with you here today. Huge thank you, first of all, to GambleAware for putting together this conference today. It's incredible testament to the amount of work that you do, and you can't be commended enough for all the support that you give me me in my role as a Shadow Minister, but also all the incredible people who need your support. So thank you so much. The focus of today's conference has been very much on a public health approach and how we look at that in the heart of gambling. I'm really looking forward to hearing from some of the other speakers this afternoon, particularly Frank Atherton. Being Welsh, I can be a little parochial about how we look at this, but it's really, really important. And I think it's a key focus going forward, specifically for me, in my role of how we take that public health approach to gambling forward in a political policy-making position. I'd like to address three main points today in my speech going forward. Firstly, I'd like to begin around my concerns with the general delay and lax attitude of the government in bringing forward the white paper into gambling-related harm and the gambling review. I am slightly encouraged by the comments by the Minister earlier today and some of his commitments that he's made, but sadly, these commitments have been made before, and the government have been far too long on rhetoric and very short on action. And it's my job to hold Minister Scully and the government to account in bringing forward the very, very long and overdue white paper. Some of us today, all of us here today, I think, want to see the government prioritise gambling harm. And this needs action, it needs solutions, commitments now, but also for the future. We all know that gambling products and the business models that the gambling companies use cause significant harm which impact physical and mental health. And further regulation of the sector is, as I've said, long overdue, but there are also opportunities there too that need to be taken on board, especially given the huge growth in online and mobile gambling. Smartphones give us the opportunity to gamble online almost anywhere at any time. And an unregulated, dangerous online space has failed to protect users. We only have to look at GambleAware's own research in this department to really understand how access to gambling has rapidly expanded. 1 in 10 adults in the UK who gamble are at risk of experiencing harm due to their behaviour. And this is happening at a time when gambling is also more accessible than ever, with online gambling, excluding the National Lottery, increasing from 6% in 2012 to 9% in 2018. And that's why I am so grateful to the various groups that I have met with since I took over this role a year ago, many of whom are here today, and it's great to see so many friendly faces in the room today. I've also had the opportunity to meet with those with lived experience and those affected others who are impacted directly by gambling. I've also met with researchers, treatment providers, health practitioners, industry employees, and it's this knowledge and collaborative approach that I've been taking forward and I know is most effective in preventing gambling harm in the first place from taking place, because we know that prevention is always better than cure. When I was appointed last year as the Shadow Minister for Tech, Gambling and the Online Safety, it was one of the main issues that I was tasked with was looking at exactly how we can approach gambling harm, gambling policy going forward. And I'm very much here to reiterate that 12 months on, that still remains a key priority, not just for me, but for the leader of my party and for my whole department that I serve in. We really know that the costs to delay are colossal. Labour has long called for the government to bring forward the gambling legislation that is needed, and yet another delay to these measures were first promised back in 2020. So we really are just seeing a colossal delay, unnecessarily so for political reasons. We have repeatedly called on the government to make good on their 2019 manifesto commitment and urgently publish their plans for legislation to ensure that gambling firms are held responsible for the way in which their services are sold and marketed to the public. In kicking the can down the road, the government are missing a number of opportunities and are failing a huge number of people. Gambling policy is being held back by analogue regulation in a digital age. That brings me to my second point of focus today. I'm keen to explore the work that needs to be done to tackle problems for those living particularly in deprived communities. Now, I represent a seat in South Wales, Pontypridd. It's a brilliant place to live. I'm not biased, honestly. But GambleAware's own interactive map show that the rates of gambling harms across the UK, based on their research, is really eye-opening and really, really worrying and a cause for concern. The data in my own constituency shows that clear discrepancy between gambling prevalence, based on problem gambling survey indexes, and the demand and use for treatment and support. Now, coupled with the fact that my local authority has one of the lowest life expectancies in Wales, and more widely, these they paint a really bleak picture looking forward into how we tackle this as a public health issue. We know that our public services are already overstretched as it is, and this, on top of that, is only adding to the demand and pressure on a much short but needed service. So this is why the government cannot delay in publishing their long-awaited gambling reform. It's clear that the inaction is impacting certain communities more than most, and the inequality when it comes to experiencing gambling harm cannot be allowed to perpetuate or to continue. The white paper must also address the discrepancies for adults from ethnic minorities too. We know that adults from ethnic minorities are much more likely to experience gambling harm for a myriad of reasons. These groups can be left more vulnerable to harm due to experiences of racism, discrimination, trauma, and cultural and linguistic barriers. And that brings me on to my third and final point of focus today, which is important need to dismantle the legacy of stigma around gambling. Having spoken to individuals and families and affected others, I know that this is one of the biggest barriers that people seek in order to get help is the issue of stigma and what a massive role that can play. The government has to focus the white paper when it finally comes forward on the importance of challenging and changing the language that is used around gambling harm, especially given how prevalent the stigma can be in acting as a barrier to people accessing treatment, speaking out, being open and honest about the issues and the problems that they face. We thankfully have made progress. It's not all bleak, it's not all doom and gloom, and thanks to the hard work of companies and organisations like GambleAware, then I feel as though gambling and its associated harms have been given the necessary focus, and it's more and more widely discussed in public discourse than it ever has been before. However, we are at a critical juncture. Time is up, sadly, and I've got concerns that the situation mounting with the cost of living crisis, the current state of our politics is only adding to that harm. We need changes in behaviour in relation to increased gambling. We know that the changes in behaviour are already on the rise in certain populations, as I've already discussed. 1 in 4, 25% of women aged 18 to 49 in the UK who gamble expect to be gambling more in the coming months due to the rising costs of living. That is truly shocking and indeed a sharp rise in statistic that needs to be taken into consideration. Alongside this, thanks to GambleAware's Women's Gambling Prevention Campaign, we know that 1 in 10 women who gamble are already using gambling to supplement their household income. That is a sad reality for the government, and they have failed to prioritise gambling legislation. Everyone in the audience knows that the landscape has changed significantly since the 2005 Gambling Act was introduced, and legislation is far just not fit for purpose. It's no longer fit for purpose. And that's why it's more important than ever that they finally publish and bring forward the long-awaited review. Now, I am speaking here today in a political capacity, so you may expect me to want to have a pop at the government, however much, I'm tempted to do so. But it is their delay, and it's their duty to prevent people from being led down a path that ends in behaviour which is damaging to their mental and physical health. This lies at their door. This is a mantra at the very heart of good governance, and I sincerely hope that when the white paper is finally published, prevention is at the heart of the approach that they take to tackling harm. Ultimately, the UK has one of the biggest gambling markets in the world, which, according to research by the Gambling Commission, generated a profit of £14.2 billion in 2020. So there's an incredibly important balance to strike here. We all want to see operators doing the right thing, and indeed some of them are, but without legislation in place, then I fear we will see very little change. As well as responsible for gambling, I also have the responsibility of looking at online safety, and we've currently been leading the online safety bill through Parliament. Time and time again, this is a piece of legislation that we don't need to pass if the platforms do the right thing, but suddenly they're not incentivised to do so, and it's the same here. There is a possibility that we don't need to do this, but sadly we don't live in a perfect world. So we need to have this legislation in place in order to incentivise the operators from doing the right thing. However beneficial the gambling industry may be, we also know the harms associated with gambling are wide-ranging and incredibly costly, both to life impacted and also to the public purse. Ultimately, it's a frustrating reality that the review of the Gambling Act was first announced 2 years ago, and here we are still nowhere near where we need to be. I recognise the legislative challenges facing the government and the industry as well, and all those who are being faced with challenges, but we are at risk here of encouraging more people into gambling, of increasing the level of gambling harm in this country, and we have waited long enough. So over the few months, I will be pushing the Minister, who hasn't been in post very long. Who knows if he'll still be in post in January, but I'll be pushing whoever his successor is, if he has one, and his team to prioritise gambling and prioritise a prevention-led approach, because I think we all can appreciate that once the white paper is published, that will only be the beginning. Let's not forget that that will be a consultation. So there'll be even more of a delay before we actually get to anything substantial and anything near the change that we need. So I'm looking forward to continuing to meet with all of you, to meet with the industry more widely, to meet with everyone who's involved in this, because it really does need that collaborative approach. And again, I can only thank you all enough for being so generous with your time and your ideas of how we can best make this policy a reality going forward. So I really, really am grateful. Huge thanks again to GambleAware for putting on this conference today and bringing us all together. I think it's only a matter of the situation that we all need to pull together in order to bring this a reality and to make a public health approach to gambling a reality. So thank you very much. I hope we all enjoy the day. I'm really looking forward to listening to some of the speakers going forward. And as always, my door is open. So please don't hesitate to come on to me and have a chat, because it's really, really, really important. Thank you.
Thank you, Alex, so much. I think you could have done a speech 48 hours in myself. Thank you for giving us your time this year. And Alex is here a little longer, so perhaps there will be a chance to have a quick word and find out where your door is, Alex, because I think there are a lot of people who would like to make that connection. So thank you. Now, please can we welcome the panel, the next panel, to the stage. And this is my panel. This is Joe Wheeler, Lisa Walker, and Richie Paxton. Would you like to take your seats? That would be great. Thank you. And we're going to explore the need for a targeted approach to prevention and treatment. So I'm going to very briefly, this is a brief session. We've got about 30 minutes. And I'm going to just very briefly, therefore, introduce you. Joe Wheeler is from the research specialist Ipsos. And Ipsos, GambleAware will publish a report in the new year on research it commissioned from Ipsos to build knowledge of minority communities and their lived experience of gambling harms throughout the UK. Now, the findings from that research, I think it's fair to say, is vital to ensure that the services and the interventions that are commissioned prevent and reduce the disproportionately high burdens of gambling harms in those communities, for those communities. And only by understanding the experiences, and we've heard this already a lot today, really understanding the experiences of certain people with lived experience, of certain communities, can those services be delivered in a targeted way? So Joe's going to give us a few thoughts from his research so far, and then we're going to hear from Lisa, who is a peer support worker with Bet No More UK, and she runs the New Beginnings programme for women. And Richie Paxton is a programme development manager and a mentor for Epic Restart Foundation. So we're going to hear from Joe first. What have you found out so far? And anything that surprised you, perhaps?
Yeah, so it's probably just worth me just explaining a little bit about the project and why we were commissioned to do this in the first place. So back in late 2021, colleagues at GambleAware commissioned a scoping review looking at the disproportionate burdens of gambling harm amongst minority communities in Great Britain. And they found a bit of a juxtaposition whereby people from minority communities were less likely to gamble in the first place, but more likely to be experiencing gambling-related harm. So this project was sort of commissioned to look into some of the driving reasons behind that. I'll just talk a little bit about what we've actually done, and then I'll go into some findings in a moment. So the project itself it's a kind of a three-branched project. It's a really ambitious project, and I'll talk through the approach. So we did an exploratory phase. So this was looking at the existing evidence in the literature, looking at, to be honest, there is very limited existing evidence. So we looked at some of the parallel public health issues that have done work on minority communities. And then following that, we did a large survey. So we did an online random probability survey through Ipsos's knowledge panel, which is the largest panel of its kind in the UK. And we did a survey with people from minority communities and also from people with the white British majority, so we can compare the results of those two groups. And then finally, the stage that we're in at the moment, that's why we've not published any findings yet, because we're still doing the research, is the qualitative phase. So we're doing case study research, we're doing longitudinal interviews, so we talk to people at one stage, and then we talk to them a few months later on. which I think will be really interesting given the cost of living crisis at the minute, and we're able to actually follow people's gambling journey. I'll go into findings in a second. One thing I also just wanted to touch on, which I think is a really important part of this particular project, was the co-design team that we engaged. So we spoke with 4 individuals from minority communities who have also been harmed directly by gambling. And we basically engaged them all the way through this project. So they helped us design the survey, they helped us design qualitative materials, we've run findings past them, and they've acted as a bit of a sounding board all the way through. So it's been a really important part of the project. It's something I feel personally should be built into a lot of these sort of research projects, particularly when we're looking at particular groups. So just 3 kind of reflections on the findings then, and things that Katie's already actually touched on in her speech. So the first is the role of racism and discrimination. There's evidence from kind of other parallel sectors that racism and discrimination does have an impact on health outcomes of minority communities. And in our survey, there's early evidence on the link with risk of gambling harm, that those who've experienced racism and discrimination are more likely to be at risk of harm. The other thing is socioeconomic factors. So again, what we found in the survey is people from minority communities specifically that are in lower income households were again more likely to be at risk of experiencing gambling related harm. The second kind of theme is stigma, and you probably heard a lot about stigma already today, but something that's really come out of this research is what we kind of termed compounding stigma. So minority communities, they feel stigmatized as being part of a minority community in itself, but also stigmatized as being harmed by gambling. So those 2 things together kind of compound, and they lead to more internalized stigma. And what that all kind of leads to is people saying that they feel unable and feel uncomfortable to actually talk about their gambling and the harms that they're suffering, which is linked to the final theme really, which is about barriers to help and support. So that's another big thing that's come out, and that's kind of split into 2 themes really. So one is a lack of awareness. It always strikes me when we talk to people that have been harmed by gambling, how often that they're not aware of the sort of formal support that's available to them, either in their community or in kind of the health practitioners. And the other thing is engagement with help and support. So, and this kind of links back to stigma, I think. So we talked to people who'd said, I'm uncomfortable in talking to health practitioners. I'm also uncomfortable talking to friends and family or people that I know. So I think, yeah, that's a big factor in why people are unable to access help and support. That's all I've got time to talk about, I think, but just to say there is an interim report coming in the new year, which is basically going to be all of the findings so far. So if you're interested, yeah, that's on its way.
Thank you. You can take another minute if you want to. If there's anything pressing you feel you're missing?
I don't think so. I think just to reiterate, I think the fact that people are suffering this kind of compounding stigma amongst minority communities, that seems to be the clear distinction, and also, yeah, the need to build awareness of the support available.
Thank you for that. Richie, anything that Joe has said that has surprised you, or is there anything you want to pick up on so far?
Not surprised, I don't think. I think for me, that compounding stigma, something that we've worked on this year is trying to introduce a women's programme as well, and I know Lisa's going to talk a little bit about that, but in our first year, we've been going for 20 months, in our first year we only had 1 woman engage in our service, and we realised that wasn't good enough, you know, and by actually employing another woman to come and work with us, give other women an opportunity to relate to somebody that was similar to them. And I think this year around about 27% of our delegates have been women. So, you know, just by having that relatable sort of figure involved in the organisation has meant that more people have reached out, you know, so that's definitely something that's helped us this year.
And is that the case with other groups?
Yeah, I mean, like I say, we're only 20 months old, so we're still a brand new organisation. So as we're actually growing, we are developing, you know, and moving into next year, there's a few sort of targeted areas that we want to try and work with, including the CGS system, veterans, and then obviously trying to reach out into sort of more diverse communities as well.
Interesting, I suppose, that we hadn't, well, I mean, this may sound critical, but if we seek to serve a community, then perhaps we need to have that community represented on board when we set up an organisation. Not thought about that at the time.
I think it definitely helps, but I think you've got to start somewhere, haven't you? You know, I think you've got to get really good at doing something first, and then once you're good at it, you can then transfer that into other models, can't you?
Good, thank you. Lisa, you know about running a service targeted at women, because that's your role, is actually running the New Beginnings programme. How does it work, and what kind of reception are you getting from women?
So yeah, I'll just briefly tell you a little bit about myself. I was affected from gambling harm for a long time, and when I went to my GP many years ago and asked for help, they didn't know where to signpost me, first of all. Then I walked into a GA meeting 4.5 years ago. There was 35 men and one other woman. And I looked around the room and I thought, like, where's all the other women? You know, why is there only one other woman sitting here? But I know that I was in the right place, but I knew that I needed to do something. And so during lockdown, I got a lucky break. I met the lovely Jane from Bet No More, who listened to me on a podcast. And we spoke after, and she said about becoming a peer support worker. And I did. I'd done all my training. And then through that, I went to Frankie Graham. I don't know if Frankie's here this afternoon, but I went to Frankie, who's the chief executive of Bet No More. And I said to him, I've got a dream. And I said, my dream is to set up a women's group called New Beginnings. And I said, I really want to set it up. I said, because as a woman, I felt so much shame, so much guilt, so much stigma. I'm a full-time carer for my severely disabled daughter. I said, you know, I just felt that there were certain topics I couldn't talk about in a room full of men, and that I wanted to set up New Beginnings. So I set up New Beginnings in April this year. I went to Frankie and begged him to give me a bit of money to set it up. Listen, I am not a professional. I am somebody that went through hell with my gambling addiction. I ended up homeless on the streets with my 2 children, and I wanted to set up New Beginnings. So New Beginnings is a 10-week structured programme where we do onboarding paperwork session for the women. We do risk assessments, we do safeguarding, we do PGSI scores, we do core 10s. Once they come on to New Beginnings, every week there's facilitators that is facilitated by people with lived experience or affected others, only women. We build up confidence, we give people hope. Since I started in April, I've had the first cohorts that went through, there was a 68% reduction on their PGSI scores. We also do a personalised health and wellbeing plan. So for me, and I'm gonna talk from the heart, and I'm gonna be honest with you all sitting here today, because I'm never gonna have a chance to say it again. When you are faced with an addiction, whether it's gambling, drink, drugs, whatever you're addicted to, it is not just a 10-week programme, it is for life. And I know that I've got to be in Gamblers Anonymous for the rest of my life. So I went back to Frankie and I said, Frankie, I need some more money. And he was like, what for? And I said, because, I said, this can't be just 10 weeks. I said, we need to start running health and wellbeing groups for these women. So what we do now is, which has started in October, we run alongside, so the women that come through New Beginnings, they have the 10 weeks. Then we run 2 health and wellbeing groups a week, one of an evening, one during the day, to allow women, if they want to come during the day or vice versa, to have that connection with other women, that they can talk about their own gambling harms, that then they can also build up confidence. So I've referred people into Epic, I've referred people into Gordon Moody, I've had women that have now gone on to become peer support workers themselves for Bet No More. We've also got one person that's employed now by Bet No More who come to me with her addiction 18 months ago and has changed her life completely. It's just having, it's the women that are coming in, they're all saying the same thing to me. We never knew that there was other women with an addiction to gambling. We didn't know it. We didn't know other women. So now that these women are coming in and meeting other women, they're on a WhatsApp group together. They're building up relationships. It's growing in confidence where now women are saying, do you know what, Lisa? We are going to think about going to GA. We are going to think about sitting in a room now with other men because you've taught us and you've been there and you've done it and you're living hope that you can beat a gambling addiction. And so anyone that's struggling out there today, I just want you all, anyone that, with the right help, the support, the right approach, that you can beat an addiction. It's having the right tools around you, the right people to support you. And listen, I'm not a government minister, and but I know that this Gambling Act review since 2005 is so long overdue. I could talk to you lot all day about the advertising. It is absolutely disgusting that what we see on our tellies every day, you're seeing it, it's in your face. When the fun stops, stop. Well, it ain't fun when you're gambling. And there should be someone after, like me, on an advert saying to people, but actually, this is what could happen in real life. You could end up homeless, you could end up on the streets, or even worse than that, you could end up committing suicide, because I know people that have took their own lives through gambling. So let's not, let's cut all the crap and let's get to the nitty gritty that gambling is a serious public health, and we need to do something about it now. And I will go on any TV programme, I will go anywhere in the world and tell people, what this is people's lives we're talking about. This is children. We need to educate doctors. We need to educate schools. We need to go in and tell people this is the dangers. I'm working with I'm working with one of the organisations, a gambling operator, who wants me on board to train their staff into what to look out for. In gambling, they're taking it seriously, and this is what people need to do, take it seriously. I'm sorry that I've taken so long, but I had to talk.
No, absolutely. I hope that was recorded. And you should be a government minister. Richie, you started off with one woman. Now there's 27% of the people coming through the door are women. Does what Lisa is saying ring true with you as to how those women react to the actual programme that they to the help they get?
I think one of the biggest things that a lot of the women that have joined our programme said the shame and stigma associated with it, but also isolation and not knowing where to actually go. And something that's worked really well with our programme is when the women have engaged, initially they've been involved in a women's only project, but have then been integrated into our bigger programme. And that's given them more opportunity to hear different sort of viewpoints and share different stories with other people, and also engage in some of the activities and stuff that we run. We specialise in aftercare, so we work with people after they've had treatment. And for me, that's always been a missing link. So there's lots of treatment services out there trying to get people to stop gambling. But once people stop gambling, then what? That's when the public health problems start. People are isolated, people are lonely, people have debt problems, mental health and well-being suffers. When we've done a consultation with over 200 people who've been on our programme, the common themes that come up were people were struggling with physical and mental health. People were struggling, feeling isolated, lonely. Relationships had broken down. They didn't have the skills to deal with debt. They didn't have the skills to deal with sorting out their finances. And the other thing is gambling had completely stripped them of self-confidence and self-worth, you know. So we've kind of created a program off the back of that consultation to try and address those things. And we work in four different themes of health and well-being, connection and relationship, confidence and self-worth, and then upskilling people so that they can hopefully go on to find employment and deal with the debt.
One phrase that stuck in my mind from this morning was people need to be embedded back into society. How far can you go to do that? How, you know, do we have the resources? Do we have the funding? Do we have the skills to do that?
Yeah, do we have the funding? Do we ever have the funding to do what we want to do? We don't, do we? That's the truth of the matter, but we can only start with what we've got. And I believe we're in a position now where GambleAware have committed to an aftercare fund, you know, and that's being distributed. So there's going to be 10 organisations next year working in aftercare. For me, though, there has to be that transition, you know, people have to be aware of the aftercare. Otherwise, what happens when they finish treatment is they just fall off the cliff again, you know, and then that increases risk of relapse and that increases the risk of people going back to the beginning of the system again. So that sort of awareness at the end of whatever treatment that it is that they're getting is really important to try and get them to the next stage of their life, you know. One delegate who went through our programme, you know, her quote always sticks in my head, and she says, Gordon Moody helped us to stop gambling, but Epic Restart helped us to build my life again. And I think that's the thing that's sometimes missing, you know, is that opportunity for people to build the confidence, to increase the self-worth, to, you know, build them relationships, learn new communication skills, handle the debt, sort out housing problems. And sometimes it's not, sometimes people find themselves homeless, but then they haven't got the confidence to pick up the phone and ask for the help. You know, they don't know where to go, they don't know what the support is. So there's, yeah, if that's not public health, what is, you know, and that's why it needs to be, you know, public health sort of approach.
Joe, is your research throwing up some of this?
Yeah, definitely. It's interesting hearing you both speak, actually, because one of the interviews that we conducted, it really strikes, it remains in my memory because I spoke to a gentleman who said he was actually in recovery, and he was from a Muslim community in the Northwest, and he'd spoken about how he'd sort of, while he was in recovery, had started a community group, and he basically, the way he'd started it was just going and talking to people about his experiences as a Muslim person who had experienced gambling-related harms and some of the challenges, some of the stigmatization that he'd faced, and he said at first, you know, he didn't get a lot of engagement from people, but after a couple of weeks, he'd started to get people that were contacting him, people saying, oh, you know, I know someone, you know, whether it's a partner or a family or themselves, and some of the things you were talking about really resonate with me. And then he started to build up this kind of community program. So I think, yeah, just really interesting to hear both what you're saying. It seems that sometimes it can take those kind of individual experiences and individuals who are in a position, I guess, and where they're able to actually help others. So I think, yeah, really eye-opening from that sense.
Which raises the question in my head is, how granular do you have to get in order to be optimally effective?
Yeah, so part of something we're going to do next year, we're going to move into like a coaching model, and people relate to people that they relate to, you know, so they relate to people who've been on a similar journey. But as long as you understand where they are and where you are and what the differences are, then you can still facilitate somebody through a stages of change process. So although it would be perfect for somebody to see Lisa because she's a woman, it doesn't always necessarily have to be the case, as long as you've got the right skill set and the right sort of qualifications and experience that you actually can put your foot into their world a little bit, you know, and show empathy and show that support. And I think for me, that as long as people are doing it from an empathetic point of view, then, you know, they can build relationships and rapport. And it's once you build them relationships and rapport that you can actually move people forward in life.
Time for a couple of questions. Anyone? I don't see. I wondered when you were going to ask a question, Katie. Sorry?
Gentleman here that
Okay, sorry. So I'm going to go there, and then Katie over here, and then in the middle, there.
Oh yeah, I just wanted to, just to Lisa, really, it was great to see the way that you've, set this up from the start and how far you've come. I think you've been the most authentic person I've heard today. You'd get my vote if you was a government minister. So.
Way.
well done, the journey you've been on, and just keep talking from the heart and don't change.
Yeah.
Keep it up.
Yeah, absolutely.
Thank you. Can I just really quickly, because I know we've only got 5 minutes, but just real quickly, I just wanted to say that since New Beginnings started in April, so we've had 2 cohorts in April, then they finished in July, then the next cohort started in September. So we've already got a waiting list for January for the next cohorts for women, which is sad that we've got a waiting list, but it's good that they're going to come in and get the right treatment. But just really quickly, so we've probably helped about 22, 25 women that have come through, but it's the ripple effect that I just wanted to say, that it's the 10, 12 other people. Someone spoke to me yesterday and said, please mention today, when you're talking, a lady that I've took through New Beginnings who's changed her life around. She said, not only have you changed my life, but you've changed my child's life. My relationship with my family has improved. My relationship at work's improved. She said, I've opened up to my work. They've now got gambling policies in place. So this is what's changing. So out of them 22, 25 women, you're talking with New Beginnings and Bet No More have helped about 250 people. And that's only since April. And I can just see it growing and growing. And if we can all work together, all of us work together. So I tell people about Epic, I tell people about GamFam, about Gordon Moody, about Aquarius, all these fantastic organisations that are out there. And then people can say, well, look, there's New Beginnings. You can refer into Lisa. And to get that ongoing help as well, we all need to work together. Just wanted to say that.
Quite right. Katie.
Hi, I'm Katie from Citizens Advice. Really enjoyed the panel information. And my question is around the public health approach. And we know that people from sort of deprived communities are adversely impacted by a whole manner of health inequalities, gambling being one of them. And we talked about minority ethnic groups, we've talked about women. I'd really like to know how the panel think we could reach out to those people that are living in adverse poverty that may not access some of the services that are out there now, and how we can hear those voices to make sure that those that we want to protect the most from a public health perspective are having their voices heard.
Yeah, and I think there might be something in your research that will come out, Joe, that will be useful from that point of view. I don't know if you have anything you want to just add at this point or not.
No, I think other than the challenge that's faced is, I mean, I've been doing kind of qualitative research with people suffering gambling-related harms for probably about 5 years now, and you notice patterns, and when you're talking about asking people to kind of engage with help and support, quite often we see that people have kind of hit rock bottom before they've actually started to engage with that support. So I think the challenge is, it's not maybe necessarily an answer to your question, but it's a challenge is how to kind of communicate with people at an earlier stage, at the sort of prevention stage.
Yeah, and I think we've talked about earlier intervention. Richie, anything you want to add? I know you're a very new organisation.
Yeah, we're a new organisation, but we're hopefully embedding ourselves in the NGTS, which is now going to a regional approach. So with it being regional approach, you would hope that actually they could get to the heart of the communities and where they're actually working and find out what the need is, and also just raise awareness of what actually services are there to help and support people. And that goes all the way back to where we were this morning, around education and awareness, and raising awareness in schools of what support's there for people is a ripple effect as well, So gambling itself has a ripple effect in how many people it affects, but it can also work the other way if you get the awareness and education stuff at the heart of where the communities.
Thank you. I am going to allow one more because I said yes. Can we do it in 30 seconds?
Yeah, very quickly. Stephen Indu, Bet No More, Lisa's colleague. I knew her first, Steve, so I'll get the autograph. Yeah, just quickly, because, yeah, some of my questions been answered already. So you've had a lot of media attention ever since, you know, you've come forward about your gambling and, you know, discuss what you do now. One thing is, how's that been like for you? Another thing is, you've helped a lot of people, and as it says on my Christmas card, you've saved a lot of Christmases this year, and that's fantastic. Thanks to you, Lisa. What would you say about disclosure, especially when women, you know, feel reluctant to disclose because it highlights, you know, a vulnerability, and people are kind of fearful of actually expressing their vulnerabilities? What would you say in terms of encouraging women to come forward and, you know, express themselves and disclose, you know, what they're going through so that they can get the help they need? What would you advise?
So from me telling my story and being on this morning and BBC News for those of you that don't know, the women that all I want to say to women out there that are struggling is that there's so much help now out there that when I was gambling, there wasn't hardly any treatment for women. And now there is so much treatment. I don't want women to get to, this is the other thing, I don't want women to get to where I was, where I ended up homeless and on the streets. I want to get women that may have a gambling problem that come in, and we reduce that stigma and the shame and the guilt, because we've got to remember that most women are probably mums, you know, it's, you know, with their children. We seem to be like, the women are supposed to be like the backbones of the family and hold it all together. And when you're in that depth of gambling and you're a woman, you know, I felt so ashamed, you know, especially as a full-time carer as well. I thought my children might be taken off me, even though I'm a bloody good mum, but I thought that at the time, you know. So the women that are coming in now, we've just got to give them that hope. We've just got to keep educating women that, you know, come into support, get the right treatment, keep going, never give up, and just, yeah, that's, you know, and that's, I just love it. I love what I do. I'm very lucky. Thank you. And we run over.
Well, I think that tells it how it is. Thank you. Thank you, and thank you, Richie, and thank you, Joe. And hopefully we will we'll get that report. I think you said in the new year, Joe, and I hope that's a GambleAware new year and an Ipsos new year as opposed to a government new year. Thank you very much indeed. Now, Sir Frank Atherton, can you follow that? Well, that's your task for this afternoon. And Sir Frank is the Chief Medical Officer for Wales and responsible for working with the Welsh Government policy departments and external partners on public health, as well as leading the clinical contribution in Wales to improving the quality of health and patient outcomes. Thank you.
Thank you very much. Good afternoon, everybody. It's a very hard act to follow. I take that challenge. I just wanted to start really by thanking GambleAware for the invitation today to come and talk. It's been a delight actually over the last 10 years or so to look at how the organisation has grown and how it's developed and how it's gone from strength to strength. And you know, one of the public health tools that we have at our disposal is the building of coalition. And what GambleAware has done and is doing, continues to do, as evidenced by the people in this room and the people online watching today's proceedings, is it's built a coalition, and it's continuing to build that coalition that we need to deliver the change that we all want to see. So thank you very much for that. Now, my next slide, in a way, is almost redundant, because we've heard a huge amount today about why is gambling a public health harm. I don't think I need to stress any of this. We've heard all about the direct losses, the income losses. We heard from Leanne and Sam this morning about many of those, the links with crime, the links with homelessness. We just heard from Lisa. Thank you for raising that. I felt a shudder go around the room when you talked about the fact that you and your kids nearly ended up on the streets, you know. So all of these things, remind us that there's a huge public health issue to be dealt with here. And as I was listening to the various presentations this morning, I kind of started to feel, well, there was something missing, and I wondered what that thing was. And then I realised that, because I often think, we can't be seen as the fun police. We're in public health, we're often seen as the fun police, and we can't be seen as that. We're not looking to ban things, but we need to get angry about things. And I was wondering, where was the sense of anger this morning? And it started to appear a little bit. Steve, I don't know where Steve is, but Steve, I sensed a kind of feeling of anger when you were talking about the fact that 80% of income and revenue, from the industry comes from 5% of people who are most at harm. Lisa, I felt a sense of anger. And I think sometimes we need, in public health, to mobilise that anger and use it. And we need to use it for 3 reasons. One is that there's this myth that the industry peddles, really, which is that the myth of personal responsibility, that it's all down to individual choice. And of course, there's a degree of that. But, when I see, messages like gamble responsibly or drink responsibly, when the fun stops, stop, you mentioned it. Those are just examples of putting the impetus, the emphasis back onto the individual, when actually we know that there's a major problem here in terms of the environment that people are living in. And the second reason is that there's a reality that since the 2005 Gambling Act, really we've normalised gambling to a high degree in our society here in the UK, and we have normalised the use of potentially harmful products. But the third one really is about the way that the industry treats people. And it looking at people as an income stream as opposed to looking at people as people. It's a kind of dehumanising process. And we should be angry and we should mobilise. And I think anger is a very effective public health tool if we use it and use it effectively. So I got interested in gambling when I was working actually before I became a CMO in Wales over in Canada, where there was a lot of impetus on gambling, not least because of what they used to call VLTs. They're called FOBTs, or fixed odds betting terminals here. Pokies in Australia, isn't it? And there was a lot of concern and anger about those. So I got really quite interested in that. And when I came back to the UK, I found I was startled by the amount of advertising on television. I was away only for a short period between 2012 and 2016, and in that 4-year period, it struck me that there was a huge growth in this industry. When I looked at the GGY, the gross gambling yield, it was going up 10% at that time every year, and there weren't many other industries or many other bets that you could put on where you would get a 10% guaranteed income stream. So I realised that there was something going on, and I produced this report in 2016 on gambling with our health, because I wanted to shine a spotlight on it then as a public health issue. And it resonated to some degree, but many of the recommendations in that report are still relevant and still valid, and we're still trying to push those on, and we need to continue to do that. I'll come back to some of them in a minute, really. But what really struck me in that change was that in the liberalisation process of the 2005 Gambling Act led us through, many of the chickens were starting to come home to roost, and that, I think, is what we've heard about a great deal today. I should mention another report, and Kate, it's nice to see you there from the Citizens Advice Bureau. Thank you for that. But, when I'm talking about the industry, the report you've done very recently on what's it called? Is it Tricks of the Trade? Is a fantastic piece of work which just talks not just about gambling, but about a number of other issues where, the techniques and the tactics of the industry. We can learn a lot from that report. So thanks for that, Kate, as well. Katie. So that report is still highly relevant. And on the back of that, what we've done in Wales, because I've asked to speak about that, is that we've undertaken a more formal health needs assessment. And I'm very grateful to Annie Ashman, who's one of our very talented public health trainees in Wales, who undertook this work. And she produced a very good report, which isn't yet published. It'll be out probably in the early new year. But it looked at the epidemiology, it looked at the services we're providing and the lack of services we're providing and the need to boost those. It also engaged a great deal in Wales with people with lived experience, as we have done today, thankfully. And it looked very seriously at the issues of prevention. And I just wanted to focus on this slide because she did look at the epidemiology of gambling. And as Chris Whitty alluded this morning, there are huge gaps still in our understanding of how gambling impacts on people. And the point I wanted to kind of raise was the second one. Oh, sorry. Oh, it is there. It is there. The second one down, which is 0.7% of adults in Wales are problem gamblers. And, that is a statistic which is pretty consistent across all international territories that I've worked in. Certainly it was about the same in Canada. It's about the same in Australia, I think. But it's used often as a way of saying, well, it's not really a huge problem. The industry will say, well, it's only 0.7%. It's a tiny minority of people. But there are three problems with that interpretation. The first one, of course, is that there's a degree of churn in the population here. And, if you're a gambler and you're losing, making heavy losses, you can't keep on that forever. I don't think even Elon Musk could do that. Eventually, you will be emptied out. And so people are coming out of gambling. And as we heard from Sam, I think, this morning, people are relapsing back in. So there's this churn effect, which we don't fully understand and we need to understand. And to the researchers in the room, I would encourage you to start thinking about how we could construct a proper longitudinal study. I think there's one in Denmark, but we've never had one, I don't think, in the UK, a proper longitudinal study to really understand some of that churn effect. And the second problem, of course, is that the numbers are big. Even though the percentage is small, the numbers are big. That 0.7% in Wales represents 21,000 people in Wales suffering from severe gambling addiction. And then when we multiply that with the multiplier effect that we've been hearing a lot about today, whether it's 7 or 10 people, you very rapidly get to large numbers of people being affected. So there's all sorts of reasons why that figure we need to be very cautious about. And we've talked a lot about the inequality, and this is just one slide which Annie put together, showing that the impact is it's not equally spread across society. It's the people living in the most difficult, the most straitened circumstances who suffer the most. We know that from the mapping we heard about earlier, that gambling facilities, gambling outlets are more concentrated in the more remote, in the more rural areas in Wales. We know that for a fact. But this is really quite stark, that the impacts are disproportionately felt. So what are we doing in Wales? Well, we have a task and finish group trying to keep an oversight of those recommendations I made back in 2016, trying to make sure that we push on with those. And we are looking at the outputs of the needs assessment work as to building further on that, of course. We are anxiously awaiting, and our ministers have corresponded with UK ministers on the delay in the white paper. We are very keen to see that published, as we heard this morning. So what do we want? What do we want to see? Well, first of all, the fundamental review of the Gambling Act. As I say, it's over-liberalised things. It was really good to hear from this morning that we perhaps don't need to wait for the Gambling Act to be refreshed. There are things we can still do, but it would be symbolic if we can get a national act replaced. Advertising, as I say, I'm very worried about, and I think that we do need further restrictions on advertising. We should be talking about marketing as well, because the online marketing is really quite problematic. We need far better player protections, and building those into the online gambling world is really, really important. I started to see those in Canada being dismantled, actually. The industry is quite keen for those to be dismantled, but not having limits on play, not having the ability to self-exclude or arrangements that get around that. The barriers to taking the winnings when you have them. All of these things really conspire to add to the problem of gambling-related harm. A statutory levy is absolutely needed. I called for that in 2016. We had one in Canada, and it makes a huge difference. And it makes a difference because there is a steady revenue stream which can fund treatment services, which can fund the research that we need, longitudinal studies that I'm calling for. They're not cheap, so we need an income stream for those. And, of course, the education that we've been hearing about. So those three things need to be properly funded, and I think only a statutory levy on the industry can do that. It should be the principle of the polluter paying. We do need more research. We need better quality data. Chris Whitty mentioned that this morning. I absolutely agree with that. And again, we need funding to be able to allow that to happen. And fundamentally, we need to be applying a precautionary principle when we think about children and young people and the plasticity in their brains, which potentially can be exploited by the industry as we through things like loot boxes and gambling. So protecting the next generation from the adverse effects of gambling is really, really important. So I hope that sums up some of the issues. I mean, there's nothing new in that. I think it pulls together some of the strands that we've heard about so powerfully today. But this is an issue which we really need to continue to push on to build a coalition. I'm grateful to GambleAware for the work you're doing. I think we need to continue it. So thank you very much. Diolch yn fawr.
Thank you very much. There may be nothing new in it, but it certainly pulls together and concentrates our minds as to what options might be open. So thank you, Sir Frank Atherton, for that. And we're now going to think about what we might learn from other sectors to apply to the public health approach to address gambling harm. So could you please welcome the next panel. We have Rosa, Mike and Paul, who are going to be in conversation with the CEO of GambleAware, Zoe Osmond. So I hand over to you, Zoe.
Thank you, Liz. This is for me a real highlight because we spend an enormous amount of time, as you can imagine, focusing specifically on gambling because it is the heart and soul and it's the reason why we're all here. But equally, there is a danger that we don't often look enough outside the proverbial box, and I think there's a real opportunity here for us to learn from other experts across the field. So for me, there are two reasons. One is that, and the other one is the fact that, as we heard this morning, is there's a huge link between gambling and mental health, other comorbidities, and in fact, I was really struck by somebody's comment, somebody with lived experience this morning, who was saying that, you know, gambling affects my mental health is affected by gambling. And then the IFF stat of 90% of people who are suffering from gambling harm also have their mental health affected. So unsurprising, but quite stark in terms of the numbers and the totality. So I'm thrilled to have on our panel, we've got Dr. Rosa Lee, who's the Research Director in Health and Social Care Policy at NatSen. She's a research director with over 10 years of experience in academic and health policy research. In her previous roles, she's led a variety of mixed method research, needs assessment and service evaluations across North Central London to help improve local population health, well-being and tackle inequalities. So welcome, Rosa. And then we've also got Professor Paul Johnston, who is an independent public health consultant, but a former national and regional director of public health for DHSC, NHS England, Public Health England, now known as OHID. He is one of UK's most senior public health and medical leaders with a track record of leading, managing and delivering outcomes at scale in challenging environment. And his current portfolio involves consultancy with the WHO, UK government, NHS, but he's also faculty of the Public Health board member, where it leads on climate and health committee. Love to discuss climate change, but that's another conversation. And then also Mike Trace, Chief Executive of the Forward Trust, who has a wide range of experience in terms of the field of drug treatment and policy, working directly with drug users to senior positions in national government and international agencies. And just picking up on a couple of those, he was the Deputy UK Anti-Drug Coordinator, the National Drug Czar, love that title, creating the National Drug Strategy on Building a Better Britain. Chairman of the European Drugs Agency, also the Director of Performance at the UK National Treatment Agency, and also at the UN, where he was Demand Reduction Section, etc. Since leaving his post, he's taken up the role as Chief Executive at the Forward Trust in 2004. And for those that don't know, and I'm sure we're going to hear about it, is a national charity that offers care and rehabilitation services for prisoners and those struggling with drug and alcohol issues. So it's a real pleasure, and I thought I would start by asking each of them to say a few words on the subject, and then we'll open it up to some questions. Rosa, should we start with you?
Yeah, sure. So before this session, I've been sort of reflecting on, you know, my experience working in local public health, and you know what could I add to this conference. I mean, obviously my current role is in a research role, So hopefully I'll be drawing on my sort of research experience, but also my experience working in local government and local public health. So just thinking about, what we can learn from other sectors or other sort of equally complex public health issues. I mean, I think the most recent sort of challenge would be, I think, COVID response, like, how public health sort of handles, COVID, and, how public health sort of help increased COVID vaccine uptake. So I think that there are quite a few key lessons learned, like we can learn from that. So one being, it's already been mentioned before in earlier sessions about collaborative working, partnership working, and I just can't agree more. So I think it requires the whole system to work together and really sort of taking a coordinated approach involving all the partners across the system. So, I mean, not to duplicate efforts, so we're all working together, and we are all working together to solve a common problem. So, and then another sort of key learnings from that is sort of taking a evidence-based approach. So when I was working at local public health, I sort of led a piece of research engaging with like various local communities. So people like homeless residents, people from different ethnic minority backgrounds, to really understand, how they've been, like various local communities, how were they affected by COVID, what are the local needs, and really try to gather that intelligence, not just the hard intelligence, but also the softer evidence, which is equally important, like really listening to, the local needs, listening to, what they need from us, what support they need from us, from a local government or local public health, and how we can help them sort of overcome this, really sort of big sort of, pandemic, because it really has a lot of like disproportionate impact on people. So, and obviously, and then in terms of like increasing COVID vaccine uptake, obviously we gathered evidence in terms of, the overall vaccine uptake in the local area, but we also take a really targeted approach. I think we were talking about targeted approach earlier on, really targeting specific groups, really to identify, for example, which groups has a lower sort of vaccine uptake, and then how we can engage with them and really listening to them in terms of what the barriers are. So, like either it's a practical barrier or cultural barrier or religious barriers. So through that, we can sort of come up with a list of evidence-based actions to hopefully help people to overcome those barriers. So an example would be like working with faith leaders, because those people are, people that they trust, in the community, working with, producing, information leaflets in different formats, using videos, and try to reach as many people as possible. So I think, just reflecting back on how we can tackle gambling harm, I feel like, we could perhaps, think about taking a similar approach, especially, gambling harms are so complex, it's got impact on health and well-being, people's finances, employment, relationships, etc. So, I think it would really take a whole system to work together in order to address gambling harm.
Yeah, I agree. I mean, collaboration's been hopefully one of the big themes of today, and the need to work in a more integrated environment and way.
Definitely.
Mike.
Thank you, and thank you for the introduction earlier. It reminded me of a few things.
Long list of titles.
I'm Chief Executive of Forward Trust now, but as I always said, 20 years ago now I was in the government and I was a Tsar, which is a bit of a silly name, but I must admit I quite like being called it. It made you seem more powerful than you actually were. But I was in the government at a good time, at late 90s, around the millennium, and around this issue that was quite important because we had a government that cared about social inclusion in those years. I thought I'd get a nod there. And so for me, as somebody who came from a field that was about social inclusion, to work in the government at that time was not swimming against the tide. That was good. It was also good because we had a government that could spend money, which seems a distant reminder now, but back in the late 90s, we could invest to save. We could invest to make social problems, try to make social problems go away. So I was a very lucky boy. I got taken into government in 97 and had a very important job, which was to design and implement a national treatment system for drug and alcohol addiction. Yeah, and that's not a bad job to be given. We had money to spend. And it's going to make you all feel bad now if you work in the gambling sector, but we moved the drug and alcohol treatment sector from a 200 million dispersed, patchy set of services across the country to over $1 billion a year nationally planned system, all paid for by the taxpayer. Then we've had austerity, so those figures don't matter anymore, but generally that's what we did over that 5-year period. And thought what I could most usefully do here is just give you a few very broad lessons and pieces of advice from trying to build a national prevention and treatment system for a behaviour that causes harm. And I'm going to say there's 3 things that I would say it's really important to be on top of, to understand and to know as you make decisions about developing a system. The first one is, why do people engage in the behaviour in the first place? And I think the behaviour being, in this case, gambling. In our case, it was drug use or alcohol use. And I would say there's a lot of similarities between the fields here. This is utterly unscientific. These are reflections of somebody who's been around a bit. There's a lot of similarities of why people do it in the first place. And that the reasons why people engage in the behaviour originally are not harmful ones. They're not miserable ones. There is fun in this. There is socializing in this. There is connection. There is meaning. And when people start to decide to use a drug or decide to drink alcohol or decide to gamble for the first time, they're not planning to be addicted. They're not planning to be socially excluded. They're not planning to be broke and miserable. They do it in the first place because there's fun in it and there's connection. Don't know what that tells us about the response, but I think it's something that does seem true to me. More importantly, I would say, is why do people, some of those people, struggle with the behaviour, lose control, become compulsive, become addicted, if you want to phrase it that way. In the drug and alcohol sector, there's generally a statistic that weirdly holds true around most cultures and countries around the world, that somewhere around 10% of people who drink or use drugs use them in problematic ways. And that sounds like too simplistic, and I've always questioned it in my career, but just about every reasonable peer-reviewed study who looks at it in all sorts of cultures and situations comes up somewhere around this 10% figure. Of all the users, there's around 10% seem to have problems that arise from that use. Now, very interested to hear Sir Frank's talk about 1% in gambling terms, and that's an emerging knowledge. 1% is a lot less than it is in my sector, and there might be good reasons for that, but I think that merits a bit of a bigger look. And why people struggle with drug and alcohol use, there's a great phrase we used at the United Nations called biopsychosocial. A substance use disorder is a biopsychosocial phenomenon. Now, it's a horrible word, nobody understands what it means, but it's actually quite useful to break it down. There is something biological, neurochemical in this, to do with serotonin receptors, all that sort of thing. Definitely with some of the drugs and certainly alcohol. Don't know how much that applies with gambling in terms of, endorphin rushes and all that sort of thing. But there is a neuroscientific element to it, important to understand that. But much more important, in my view, over the years working with drug and alcohol problem users, is the psychosocial side of it. Because the roots of people's struggling with behaviour aren't just neurochemical, they aren't even chemical or medical. They're about that person's mental health and well-being, and where that person's life is. In the drug and alcohol area, very strong statistics, very high proportions of the people who struggle, develop addiction, go down the slippery slope, lose control, have things they are trying to self-medicate away pain. There's trauma, there's abuse, there's neglect. There are less spectacular mental health problems like social anxiety, depression, loneliness. Yeah? If you look at the cohort that we try and deal with in drug and alcohol treatment, very high prevalences of those figures. So it's not what's going on in the brain, it's what's going on psychology, harsh lives, trauma. And I think that may have a lot of similarities with the gambling sector. It's not research I know about, but I think it's something you would need to understand. Seems to me, and this is really flying by the seat of my pants here, but there is one important difference, is the finances. When people start to use compulsively drugs or alcohol, they know damn well they're going to be poor, yeah? Except you're already a millionaire and you can afford it. But it seems to me that when people start compulsively gambling, they're still hoping that they will be the winner, they will get richer, they will get financially saved. So that's something I think might be different in the thought processes of people as they get onto what I call this slippery slope. Maybe right, maybe wrong, but it's worth looking at and worth understanding. The third thing is really important to know when you're designing a treatment system is what actually turns those behaviours around. What should we intervene and try and achieve when we're trying to change behaviour? And the mistake we've made in the drug and alcohol field over decades, maybe a century, is we've overemphasised the action of taking the drug or the action of drinking the alcohol. So what we've spent an awful lot of time and money doing is trying to say, well, if we could just stop people taking that drink, or if we could just stop people taking that drug, everything will be fine for that person. Problem solved, cured, on we go. Yeah. And the way we've mainly done that, particularly in the drug sector, is with the law. We've tried to criminalise, stigmatise, and deter people from using, largely through criminal punishment. I think most of the world has now found out that didn't work too well. But generally, that was the thought process. Just stop them getting drugs, stop them using drugs, and everything will turn around. Hasn't really worked that way. But the other way in which we've made a mistake is over-medicalising the problem. I know I'm talking in the King's Fund here, but medicalising, absolutely. Having good public health and medical approaches, absolutely. Some of the best interventions in the drug and alcohol field are clinical medical approaches. But by over-medicalising, thinking you can control somebody's use by saying they use this substance rather than that substance, and thinking that alone will solve all the other problems is a mistake. And we've learned that over many years. Once again, not saying that's what's happening in the gambling sector, but important to understand. It's about the person. It's about that person's well-being, that person's approach to life, that person's attitude to life, that person's happiness, and that person's connection. If the interventions can make a change to that, then you are making long-term differences to those individuals and long-term differences to their families, communities, and society. Now, that's a basic truth that I think we've learned in the drug and alcohol sector over the last 20 years particularly, and I think it's a basic truth that as you go through as a sector, designing your system, wherever the money comes from, however much there is to spend, however you design your services, always base it on the fact is what you're basically trying to do is meet people where they're at, be sympathetic and compassionate towards them, and help them turn their lives around. And the addiction issue will follow that. And it couldn't have been said clearer by Lisa and Richie earlier on in the previous session. But that's my policymaker's version of what we heard earlier.
Oh, that's brilliant. You're absolutely right. And also, I think when we first spoke, you talked about how drugs and alcohol, in terms of the stage that we're at, are probably about 20 to 25 years behind. Well, all I'm hoping is that we can accelerate and catch up much quicker, rather than be another 2 decades of facing these ongoing challenges. Paul.
Thank you. So one of the three quick things to say. First of all, I've just finished as an independent consultant, just been supporting GambleAware, looking at what are the opportunities for further developing the public health approach, what are the enablers, and what are the barriers to progress. And it's been a fascinating piece of work working with Anna in the background and her fabulous team that I know are here. The piece of work included some interviews, which some of you or your organisations might have been involved in, plus also speaking to some of my colleagues in local government and also in the regional tier in England. And it strikes me, one of the most striking things about this is it does feel like where the drugs agenda was 25 years ago. And we keep coming back to this, but this is, I think, what we can learn. I was a director of public health in Teesside 25 years ago, and I remember the drugs agenda in those days. Mike, I'm sure there are people that you and I probably jointly know from those days. The NTA, it was brilliant. It provided a national strategy, but most importantly, it's what we did locally in Teesside. How do we really play this out? And so we had drugs action teams, some of you might remember those. And key to that, and what I learned in those days, is how important community engagement is. So this isn't about the statutory sector doing things to the population. It's about the population engaged in this through various leadership, through your local knowledge. So I think there is a massive learning point there as GambleAware, and we all move forward on this agenda. It's also at the point of, I have to say that I'm really struck by how well GambleAware is doing in the absence of any clear national leadership. It's really great to hear Frank just now and also Chris Whitty this morning. But what we had in those days was very clear leadership around tackling drugs. We don't have that now, and I think the more pressure we put on that, the better. And that national leadership needs to play out locally. I'd be interested to know, I've got a quick question, are there any directors of public health in the audience? And anybody from a public health team in local government? So that to me speaks volumes, actually, because it strikes me the engine room for local public health is in another room. It's not here. And we need to somehow connect that up as well. So I appreciate it's not straightforward, but without engaging local government and their leaders in public health, we're really going to kind of struggle to move this whole agenda forward.
Very true, very true. And we are very keen to engage, and we continue to do so on a sort of local basis where and as we can. So no, you're absolutely right. I've had one question come through online, because we sort of forget that they are hopefully all sitting out there listening with as great interest as the audience here. And it says, how far do you think gambling harms has to go to gain parity with other mental health conditions and the way they are considered a public health approach? Paul, I'll start with you on that one.
I think it's generally come some way, quite a long way, but there's still a lot more to do. And I think mental health in the last 7 or 8 years, I think has come a long way. I think lots of people are now openly talking about mental health. The stigma agenda, I think, has been tackled. My children speak to me about mental health in a way that I wouldn't have done with my parents, for example. So I kind of anecdotally know this is changing. But I think there's still a long way to go, particularly on the stigma. And it's so good to hear this morning that this came up, and during the day this has come up as a very important agenda. There's a lot of commonality between mental health and gambling.
Breaking down those barriers is key, and it's one of the key projects. And I think, Rosie, you've just done some research in this area, haven't you?
Yeah. So we are working with GambleAware, Dan in the audience, and Imogen as well in the research team, doing like a scoping review, looking at best practice in terms of how we might best deliver anti-stigma campaigns and programs, not just looking at literature in gambling, but also looking at adjacent sectors. So that includes things like HIV, mental health, dementia, addiction. So I think what we found is there's so many, there are a lot of commonalities across these campaigns and programs, even though they are sort of related to different topic areas. So I just want to echo what you said about, there's so much literature in mental health already, and I think gambling, the literature in gambling is evolving really rapidly, because all the research, all the fantastic research like GambleAware or gambling commissions are doing. So it's still got quite a long way to go. But and I just also want to touch upon a point around awareness as well. So you talk about local government. And when I worked in local governments, gambling just wasn't a focus. Like it's not. We don't talk about gambling. We have a lot of conversations about obesity, mental health, sexual health, but not so much about gambling. But I do realise, over the recent years, there's a lot more sort of awareness slowly building up, especially in sort of regional level, like for example, like Greater Manchester. Regional authority, Gloucestershire, they start paying attention to gambling. They do like needs assessment, looking at how they can tackle gambling locally, coming up with actions and recommendations. So I think it's slowly, it's definitely making progress in this space. But yeah, definitely.
On the way.
Yeah.
And I've just been reminded that actually we do have, here's talking about people online, we do have Public Health Blackburn and Darwin online.
Excellent.
So we've got some representation, just
I
not
know him.
enough.
Yeah.
There you go. Probably because you were here, but rather than the
me.
agenda itself. So one other question that's come in online, and then just one question I wanted to ask, and then we'll go to the audience one, which was, what do you feel are the main challenges from a policy perspective that need to be considered? And I'm going to look at Mike for this one, with all your experience around drugs.
At the risk of repeating what we've just heard, is that the government and policy needs to give a very clear lead and a framework. And we heard earlier that that's exactly what the government's not doing at the moment. Once again, what worked very well for the drug and alcohol sector is there was a national government strategy that said, this is what our assessment of the problem is, this is what we're trying to achieve, and this is how much money we're going to spend to try and achieve it, and who we're going to give it to. And we created the National Treatment Agency to, once the ministers had done their bit, has decided what the policy was and what the money was, then we had a quango that could make sense of all of that. Now, I think, in answer to the earlier question about how far is there to go, what we're seeing is forward trust. We've been in this sector 2 or 3 years, and what we're seeing is GambleAware playing the sort of role that we had for the National Treatment Agency. I know you're not government, same entity, but that is really important. But it is a very hard job, and I assume you would agree with this. It's a very hard job if you don't get clarity of policy. And that clarity of policy needs to come from the white paper, but actually the white paper is just the legislation. What you also need is money flows, clear objectives. What does the government want out of this system, and what does the taxpayer want, and clear structures by which to disseminate that money. Now, I think those are coming into place, but I think what you said earlier is to move a lot quicker than 20 years.
Indeed. We'll all be having a very long lie down. Just one question here, which is the main driver of human advancement in societal and technological terms is innovation based on risk-taking. All inventions come from risk-taking, but we remember the winners, not the losers. Do the panel think that society makes us more predisposed to gambling due to this positive association? Might go back to what you were touching on earlier, but that's. The question's just disappeared, actually. It's quite a challenging...
Can we get the name of the press?
But basically, winners and losers and risk-taking, etc. And I think here it's got to be focused on trying to also highlight the positive case studies that we've got, the positive stories, tackling things on a regional, local basis, and building up from there, because I think otherwise, to your point, in the lack of a national strategy and a national framework, it is quite difficult to achieve everything that we want to do.
But there's a lot in the question about the nature of risk-taking and the nature of people's lives and the pressures on people to take risks. Another one of the slides from Sir Frank was basically richer people gamble less. And that's a really interesting thing to dig deeper into. And I would suggest, as a hypothesis somebody may wish to look at, is that's because when you're poorer, you need to find a way out.
And that's why we're so
concerned. That is such a strong compulsion on people. And it makes it a bigger attraction to do the lottery, to say, yeah, if I just get the numbers come up, if I just get on the right horse and all that sort of thing, everything gets better. And I would suggest that risk-taking, that element of risk-taking, is something that's a very big factor in your sector.
Indeed, no, absolutely, particularly at the moment with the cost of living crisis and creating a storm. Are there any questions in the room? Because I'm conscious of time. There's one over here, just thank you.
Hi, thank you so much for the talk. Yes, I understood that the collaboration was quite key in all of these things. But I was just wondering, is there any scope for collaboration perhaps in the future with the industry itself? Because industry are the one that is causing the problem, but at the same time, what the gambling is unique compared to other public health problem is that there is actually patterns of play data that industry holds, where they can use to track who is going to be and predict these problem gamblings happening and stop beforehand. And increasingly, I feel like there has been new, safer gambling team that was put in place in some of the gambling companies. So I was wondering, from comparing with the past or other public health perspectives, do you think that the industry can be good, and is there any opportunities for the collaboration in the future?
Should we start by other sectors, then I'll answer on behalf of gambling. Did you to work. I presumed you had to work with the alcohol industry in some respect, or
and the drug dealers.
I didn't go with drug dealers.
Partnership approach. Well, you laugh, but we have done a couple of things that have gone in that direction. But yeah, looking at the alcohol and tobacco industry is the other experiences. I start very much from the premise that they exist. They are the people who provide the substance or the behaviour in this case, and so they are there. They have a very big impact on the problem we're trying to deal with. To a large extent, they cause the problems we're dealing with, so you've got to deal with them. Yeah. And I have no problem at all with sitting with the industry, sitting with trying to find partnerships and trying to find resolutions. But particularly when you're in government, but I would also say working in the treatment sector, you go in there with your eyes wide open. You know, do not be naive. Do not think that your objectives are the same as the industry. And you are in an arm wrestle and you're in a negotiation with very powerful people. So yeah, definitely engage, definitely partner, definitely do good things together. But yeah, don't be naive.
Paul?
Much the same answer, actually. I mean, I spent most of my career in government, and whenever we've had conversations with any industry related to any lifestyle, you go in with your eyes wide open. You make sure that you don't overcommit, that you're looking at this in a very independent frame, not a dependent frame. But I think occasionally it can work out really well, but you do have to be really careful. And I think one of the things that came up for me during the piece of work that I did was some reluctance by some of my colleagues to engage with GambleAware because GambleAware is seen as being funded by industry. Or what I think is that actually the way it operates is independent, but at the end of the day, funding is still a voluntary donation from the industry to GambleAware. And I think you can go a long way down this route, but I think that there is like a glass ceiling where you can't go any further simply because that's where the funding comes from. The sort of opportunities for changing that would be our politicians come up with a white paper and a statutory levy, and you have all sorts of open, transparent arrangements around that. So yeah, we all go in with our, I know you do as well. So it's a really important point.
Absolutely. I mean, you know, our governance is totally independent and our actions and our choices are totally independent. But it's the voluntary nature that means that we are always going to be limited in terms of what building actually long-term investment in this sector, making sure that the providers have sight of funding for a long-term basis. And I think the only other thing I'd add to your point is that it speaks to something that somebody else was talking about earlier about, you know, actually access to data. You know, the customer journey should be a seamless one, and we find it frustrating that we don't engage with the industry deliberately because we don't want to be seen to be having too much dialogue beyond questions of funding, and that is of itself quite unhelpful. Now I can see I'm being flashed a sign that says "stop" in large letters, so I'm going to stop. Thanks, Lawrence. But I'm conscious of time. But thank you to the panel. I really appreciate your time and contribution. Thank you.
Thank you. Absolutely terrific panel. Thank you very, very much, and a lot of food for thought there. When we are thinking about other sectors that we can learn something from, I don't know if, Katie, you would agree with me, but I do think that the debt advice sector has been not in exactly the same place, but we have spent a long time thinking about the stigma of being in debt. We've spent a long time thinking about the targeted approach to people in debt, and we've been thinking about the person. And so I think there might be some element of crossover and useful collaboration there too. And we come on to our final session, the last panel session. And can I invite Bryony, Agnes, Claire and Joy to the stage. And please welcome the chair of this session, Anna Hargreave, who is Chief Commissioning Officer for GambleAware. And we're just miking up your panel as we speak, I think. So, yes, and you can do all the introductions to them when they arrive here. But just to say, we have got Bryony Gunston from YouGov. We have got Professor Agnes Nairn from the University of Bristol. And I think we heard from Agnes previously when you asked a question at one of the previous sessions. Please do just make your way onto the stage when you've got mic'd up. Thank you. We have Dame Claire Gerada, the Royal College of General Practitioners, and Claire is here, and Joy Allen from the Police and Crime Commissioner for Durham. And the conversation is over to you to chair, Anna.
Thank you. I think Joy's still getting mic'd up, but if I kick her off, conscious of time. So welcome to the final panel session of the day. So thank you for sticking with us. I think I've been really struck today about the importance of collaboration, and I think collaboration is so important in terms of delivering a holistic approach to service users, recognising that people come with a whole range of issues and that we need to be able to treat the person as a whole. So in this session, we will be exploring the link between gambling and mental health and the challenges faced by service users and professionals who are trying to deliver that holistic approach. So perfect timing. We have got 4 expert speakers who are going to share their experience with us this afternoon. So Bryony Gunstone, Agnes Nairn, Professor Dame Claire Gerada and Joy Allen. So why this is a really important session for us as well is that over the last 9 months at GambleAware, we've embarked on an ambitious programme to deliver a transformed national gambling treatment service. And it's been really great to hear so many of you reference the regional first approach today. At the heart of that transformation is greater integration between the NGTS providers themselves, but most importantly, the ability for those providers to deliver support in a holistic way in their local communities. So really working with other third sector and statutory organisations at that local level. From next April, we will have the foundations of that approach, and whilst we fully accept that a regional approach won't fully give us the answers that we need in terms of delivering that integrated approach, we really hope that that will give us the foundations for that more place-based approach, treating people as a whole person in their local communities. We've already got some great examples across our treatment providers at the moment, but we all know that there's much more to do. So I'm really looking forward to the conversation this afternoon to understand where we can learn from other areas and the perspectives of our speakers today. So Bryony, if I start with you.
Thanks, Anna. Can I just ask, where is the clicker? Somebody must have the clicker. Thank you. Thanks. So I'm going to hopefully set the scene for this session by going through some overview findings from the treatment and support study which YouGov conducts for GambleAware, before we go into some further detail that the rest of the panel will provide. So I think this survey probably has been already mentioned and discussed today in earlier sessions, so apologies if there is kind of repetition for those who do know about it already, but treatment and support is an annual survey which we've been conducting for GambleAware since 2019. And it explores usage of and demand for treatment and support amongst both gamblers and affected others. The survey was conducted online, and we surveyed 18,000 adults in Britain, so it's a nice large sample which gives us the opportunity to drill down into different groups such as demographics and people gambling at different harm levels as well. And we also conducted 30 qualitative interviews with gamblers and affected others to just give us the chance to explore the issues in some more depth. So firstly, and as we might expect, the survey does show a very strong link between harmful gambling as measured by PGSI score and psychological distress as measured by K10 score. So amongst all gamblers with a PGSI score of 1+, we see a majority, 60%, having a K10 score of 20+, indicating psychological distress. And this rises from 48% of those with a PGSI score of 1 to 2, up to 90% of those with a PGSI score of 8+. So almost everybody in that 8+ category experiencing psychological distress. Now, we can't say for certain exactly kind of where the cause and effect is here. So is sort of poor mental health driving gambling behaviour? Is gambling at harmful levels driving poor mental health? but it seems fairly reasonable to speculate that both of those dynamics are probably going on, and so there could be a sort of a dynamic of harmful gambling and mental health feeding off each other in a circular relationship. So we see that amongst problem gamblers, so those with a PGSI score of 8+, mental health services are the most common source of support used for help with cutting down gambling. So a third of 8+ gamblers have consulted mental health services, which makes it well ahead of any other form of advice or support. We also see that mental health problems are a key motivator for problem gamblers to seek support. So amongst those with a score of 8+ who did seek some form of support, almost a third, 31%, were prompted to do so by experiencing mental health problems. Moving on to affected others, we see that over half of this group have experienced some form of mental or emotional impact from somebody's gambling. And this tends to be feelings of sadness, followed by feelings of anxiety. And we also see that 1 in 8 affected others currently want some form of support for their mental health, so some form of support from mental health services, and this proportion is actually higher than the proportion we see amongst PGSI 1+ gamblers, so 12% of affected others compared with 8% of 1+ gamblers. So in terms of what we can briefly conclude from this, obviously there are very strong links between gambling and poor mental health. And this does seem to suggest a need for a holistic approach to support for gambling, so an approach that takes into account the wider context of people's lives and their situations. For example, perhaps partnership working between organisations in the gambling space and those operating in the mental health sphere. Perhaps a proactive approach to early interventions, so maybe campaigns highlighting mental health services and resources even to those who currently gamble at lower levels to try to address any problems early. Maybe put further outreach or support for affected others who are a group that historically have perhaps received less attention than gamblers. But regardless of what the specific activities or initiatives might be, there's an underlying theme that any attempts to tackle gambling harms should take into account the wider context of people's mental health. Thank you.
Thank you.
Thanks very much, Bryony. I think that echoes a lot of what's been said today, that gambling harms are complex. They rarely happen in isolation, and they're constantly evolving. I want to talk about research. There's been quite a lot of talk today about the need for more research. I'm a professor of marketing at the University of Bristol and have done quite a lot of work with GambleAware on young people and gambling advertising. But today my hat is as the co-director of the new Bristol Hub for Gambling Harms Research, which is funded by GambleAware. We're very excited by it. It was set up in July. We have funding for 3 and then hopefully another 2 years. And then hopefully by that time we will have a statutory levy and there will be lots of money for gambling harms research, and we will be completely standing on our own 2 feet and we'll be taking the work forward. So what makes our gambling hub holistic? Well, the first thing to say about our hub is when we bid for the work, we put out a call across the university to say, is anyone interested in gambling research? And we were absolutely gobsmacked that somebody from every single one of our faculties, and we have 6 university faculties, said, yes, we would like to work in gambling research. We've never done it before. We're mathematicians, we're sports historians, we're computer scientists, but we would really like to work in this field. And that was extraordinary. We also had support from our research institute. So we have, Bristol is a comprehensive university. We kind of do pretty much everything, and we're research intensive. And we have 5 research institutes that are kind of embedded into our research. So the Bristol Population Health Science Institute, the Elizabeth Blackwell Institute for Health, the Jean Golding Institute. I don't know if you heard her on Desert Island Discs last week. She's a data scientist from Bristol. the Digital Futures Institute that looks at digitisation and people's daily lives, and the Bristol Poverty Institute, which is incredibly important at the moment. So that again gives us a holistic view. And the two health science institutes are the ones that are leading our steering group, which means that we've got a population health lens on everything that we do, that we think's really, really important. So we're trying to do something holistic by bringing in lots and lots of new different areas. We've arranged our research in the way that Mike, I don't know if Mike's still here, was talking about alcohol and drugs research having been done. So we're looking at challenges in terms of a journey. Why do people start gambling? So we want to look at a multidisciplinary lens across why is it that people start gambling. The second one wasn't in Mike's framework, but the second one is about the representations, the everyday life. You know, what does it feel like to gamble? What is advertising saying about gamble, peer influencers, etc. Then the third one is why do some people struggle and why do others not? Again, it's a multifaceted situation. And then finally, again, back to Mike, what turns things round? And we're hoping at the hub to look at these 4 different areas with a multidisciplinary lens. You'll see down the outsides, there are lots of logos. These are all the other organisations that are helping us in the hub. You'll see we've got quite a lot of international representation from Singapore, Germany, France, Canada, and a lot of organisations, many of whom are here in the room today, who bring lived experience into what we're doing. I say we've just set up. The first year we have Jamie and Ben, who are our new research associates, sitting in the audience here. They're doing a piece of work on what does a public health approach to gambling harm look like. So I'm sure that will be a really useful document that will hopefully gather together a lot of what we've got into one place. And they're also doing an evidence review across the 4 challenges. We'll do a colloquium this time next year, obviously not clashing with the GambleAware conference. We would love it if people could come to that. And then for the remainder of our grant period, we have a pot of money to give out to anybody for new research. So if there's anyone here who has burning ideas for research that they would like funded, please look out for funding calls. And that can come from anyone, anywhere, with any idea. And we will then try and build up new research from the ground upwards. So thanks very much for listening.
Claire? Thank you very much, and I think mine leads on from 2 fabulous talks. So first I'd like to just say thank you, GambleAware. Thank you for having trust in us to fund my service, the primary care gambling service, to create what I consider to be a paradigm shift in care for those with gambling-related disorders. You've allowed us to create a new service with new players, new teams, to find new solutions, as well as ensuring that we build on existing ones and actually deliver what service users want, which is continuity of care, good access, and holistic care. We've created a service that moves away from top-down, specialist-led, to one that is led through and by general practice. Because GPs in their DNA take a biopsychosocial approach to healthcare. We don't, that's how we work. It's not something we do as an extraordinary, it's what we do as the ordinary. And the primary care gambling service is a model of care which makes it easier to access, for patients to access. We put very, very few barriers in place. It's directly accessed. If somebody presents today, they'll be seen within 5 working days and receive treatment within 10, psychological treatment, talking therapies, because treatment starts at presentation. We have very, very few exclusion criteria. Probably the only exclusion criteria is acute psychosis. And very much like a GP doesn't really know who's going to come through the door, we start with what the patient presents to us rather than starting with who can't present. And probably we can't do assertive outreach. And we put the needs of patients, not their diagnosis or comorbidities, at centre stage. You've heard throughout the day how those with gambling disorders do not just have gambling as their issue. And of the patients that we've had, probably only, and I say this in reality, in real numbers, probably only about 4 have had gambling as a single issue. Everybody else has got multiplicity of problems ranging from homelessness, autism, ADHD, mental health problems, physical health problems. And we treat our patients in a holistic way, whether they, alongside with their gambling problem, present with problems with their general health, because general health, I'm sure if you ask, they have very, very poor general health. Their housing, their finances, their relationships, their mental health, or their co-addictions. We care in the context of their illness, their family, and their environment. Now, last year I presented the new service. We'd only, just because of the pandemic, got off the ground. And now I'm glad to say that our referrals are massively increasing to nearly 40 new patients per month and rising. And our partnerships with many of you in this room here are flourishing. We face you. You help us deliver jointly care to our patients. We cannot, as general practice, cannot deliver care in isolation. We have to work in partnership with you. And we've already made massive inroads into developing the tools and trying to equip my colleagues, my GP colleagues, because I understand that a lot of service users go to see their GP and the GP doesn't know what to do. Not surprising. I trained in psychiatry and I had 0 training in gambling, so please forgive my profession in general practice. If a consultant addiction psychiatrist has 0 training, you can see what the rest have. Now, we are forging links. I'm the Royal College of GPs lead in gambling addiction. Emma, who sits at the back, is working with the college to develop, as we speak, a curricula in order to set up a training program. We've already developed the competency framework. And Emma is also on the NICE guidelines. Sharon has developed many, many policies and practices so that we can work safely with you, and in particular to share information. And you have the wonderful Annabelle at the back, who when she first started, I said to her, you need to love the patients. And I think she thought I was a little bit mad when I said, and then had to explain the different forms of love. And Annabelle now leads our ever-expanding nursing team. So I'd just like to say, in terms of the holistic care, of course we have to practice holistic care. You cannot ever, ever practice care in any other way. And what I firmly believe the way and the challenge is to do it from bottom up, primary care led, because actually that's where patients present and that's what we have to equip. So thank you very, very much.
Joy. Thank you, and it's so wonderful to be here, and thank you for GambCare for inviting me. As Durham Police and Crime Commissioner, but also as the joint lead for the Association of Police and Crime Commissioners, Addictions and Substance Misuse. As a politician, it's quite dangerous. I've got a captive audience, but I've got a script to keep to the 5 minutes because there's so much I want to say. But I'm really going to want to hear from the wonderful panel here as well. So when we first took over the portfolio back in May 2021, one of the first things myself and David agreed on was we wanted to raise awareness of problem gambling across the other 42 PCC who have the other force areas in England and Wales. And we quickly agreed to change the name of our portfolio from alcohol and drugs to addictions and substance misuse, which I think is really important. So because when we were standing for elections, both of us managed to speak to people with lived experience, and I think it was talked about today, we listened and we took it away with us and we were able to do something about it. So it was really a positive experience that we got to meet these wonderful people sharing the gambling stories about problem addiction and how it had impacted upon their families and also themselves personally. David got to meet a former police officer who shared his experience of his gambling addiction and how his force had actually helped him with the welfare issues. In my case, my passion came from when I met Steve, and I know that Epic restarts here, but it was at the wonderful NHS gambling clinic where Steve spoke about his lived experience, and he told us the night before he handed himself in to the police that he contemplated taking his own life. And when he talked, imagine the police when Steve presented himself, really thinking, what are you doing here? There must be more to it than this. So he was met with suspicion. So he left the police station without any signposting at all. He'd admitted to his crime, and the police eventually processed it. But if he didn't have the signposting. If it was drugs and alcohol, it would have been signposted. If it was gambling addiction, it wasn't. So really, it was from the opportunity to learn from that lived experience. So Steve and Alex, we became aware of another Alex, who was a senior manager at a clothing company in Norwich, who had stolen and gambled almost £1.3 million from his employer. And he was targeted by free bets, and even though he's regularly betting £50,000, there was no checks and balances introduced. So we also learned at the same time about a Portsmouth GP who'd stolen £1 million in a 6-week period. NHS money, we needed to get that money back from the gambling companies to the victim of crime. So as PCCs, we're determined to ensure that gambling companies are socially responsible, to do the relevant checks to make sure that the stakes are not being funded by proceeds of crime. If they have, we want to make sure that the money is returned to victims. In Alex's case, the clothing company, £900,000 has been returned back to his employer, and he's still working in prison to try and get the remaining money that he was bet back to that employer. A lot of people don't know that that can happen, and something that we really want to do. So really, particularly highlight the vital work of the Howard League, the Commission of Crime and Gambling Related Harms, and the report was then Public Health England that estimated the costs to society from harms as £1.2 billion a year, including 162 million from gambling related harm, and it's certainly an underestimate as well. We know that most people gambling do not experience significant harms, but 300,000 people do, and we know that 55,000 problem gamblers are aged 11 to 16, and what we do know that the gambling companies are turning their attention to younger people by the loot boxes, and parents and grandparents are possibly buying these credits completely unaware that it's gambling-related product. So the challenging opportunities, we know that there's obviously a link between domestic abuse and violence and gambling, and the evidence base, as we've talked about, is sadly lacking. But we also know, very importantly, that one person takes a life every day. So as Police and Crime Commissioners, we've got a real opportunity. We chair the Local Criminal Justice Partnership, which brings together the police, probation, courts, CPS. We want to get better at understanding what we do and how we can help that to have a holistic approach to addressing gambling harms. We need to do more on pre-sentencing reports so they can be considered as part of the sentencing as they do with drug or alcohol addictions, and make sure that, through our commission services are there. So I'd like to thank the two Alexes and Steve for the lived experience that's helping to inform not just my local work, but nationally. And hopefully the people who spoke today as well will take that away with us and make sure that we respond to the lived experience, because it is a degree in life, and I think it's very, very important and very powerful when you hear it. Thank you.
Thank you. Some really thought-provoking opening comments. Claire, just reflecting on the work that you've been describing with the RCGP to develop the training, and we've heard a lot about that today around the need for GPs to have a greater understanding, but it can't just end at GPs. What do you think the other opportunities are across a number of fields, but particularly within
the GPs? I mean, I get very upset when it's always targeted at GPs, as if we're the only people in the health service that at the moment we're experiencing more demand than we have in the history of general practice, and that includes in the peak of the pandemic. So it's all of our responsibility, and it's always this, GPs need to do more. Well, actually, we need the skills, the opportunities, the resources, and the support. It's not enough just to keep saying we need more. How many accident and emergency doctors? How many psychiatrists? How many midwives who see every single woman? So I think it's about us all. But what we're doing at the college is, as we've already said, we've created a competency frame, which I think I presented last year. We've now turned that into a curricula, and we're now doing a training program that's actually relevant to generalist GPs, so to every single GP, social prescriber, pharmacist, primary care nurse, but then also to a cadre of practitioners with special clinical interest who want to lead these services. But I'd also say, with respect to gambling, and forgive me for this, and I'm really interested when the research comes, because actually I don't think there's much difference. I mean, take the gambling aside. Gambling is a behavioural addiction that will be managed in a behavioural manner. Take that away. The rest of the patient is what we should all be doing, managing their psychosocial problems, managing their prescribing problems. And I think having come into this new, and I'd be interested in your science of this next year, is that I think we're creating a mystery around gambling, and we're creating this mystery around it. There's some special thing about gambling. Well, there's the gambling and the fact we're sucking people in, like giving them cigarettes at the age of 5 and creating an addiction, but the rest of it is what we should all be doing wherever we are placed in the health and social care service. And I really want us to stop saying it's about GPs, because I'm afraid it's about us all, not just about GPs. But thank you very much for helping us.
Agnes, have you got anything further to comment on that? Obviously, Claire referenced the research that you're doing.
Yeah, no, I think it would be, I mean, where do people go? We've heard quite a lot today from people with lived experience that the first place people have gone is to the GP.
Yes.
And usually that's not been of much use because the GPs haven't had enough signposting. So, but we've also heard, like from Kev, for example, you know, if you're training teachers and young people more, then that's another place that you can go. And it would be interesting to do a piece of research that really does look at the evidence of where does everybody go, and is there a map of where people go, and could we find hotspots and then direct the interventions to the right places for the right people at the right time. I'm not aware that that's been done as a holistic piece of work, but it might be a nice piece of work to do, and then to evaluate the interventions that might take place in a school or might take place in a community centre or in the GP office, but not necessarily, because that does seem to be a bit of a kind of a, you know, a bottleneck at the moment.
Great, thank you. So you all come from very different perspectives, and so what opportunities do you think exist which you would like to seize upon over the next 12 months to better integrate or collaborate to address gambling harm? So Joy, if I start with you.
Yeah, I think one of the things that I think Alex mentioned is about prevention's better than cure, and as PCCs, Police Scotland have done a piece of work around gambling, and it's something that we can learn. So from a police perspective, when we attend a domestic violence incident, when we encounter somebody who is suicidal, when we encounter somebody in the household, there's opportunities there to understand the gambling. As I mentioned, there's no signposting in quite a lot of the custody suites. So we signpost for drug and alcohol, but we don't ask the question about gambling, which I think's a miss and harm. I'd love to do a lot more with employers, because we all work, you know, a lot of people work. And we, you know, unlike what was mentioned earlier, alcohol and drug addiction, you can see. I can play on my phone doing emails, but I could equally be spinning and gambling, and it's very hard for anybody to open up. And the other thing I would say, through our experience, for some reason there is a shame, and people would admit to drug and alcohol, but they don't. It's a really hidden, and it takes probably a longer time for it to come out. So I think talking about it, making sure that it isn't, you know, it shouldn't be embarrassed. It shouldn't be something that you can talk about. We need to see it's a disorder, and to get the help out there, and to signpost. We've talked to so many wonderful places here and agencies, but it's hidden. And as PCCs, we need to do more about that. Thank you.
Great. Claire?
Well, suicide, really. I mean, till my other life is a mental health worker looking after health professionals with mental health issues, so I was well aware of suicide. But still, I got into the gambling field. I had no idea about the excess mortality of gambling for suicide, in particular in men. And I occupy a lot of spaces where suicide is talked about, and I constantly have to say, so they will say, for example, they'll be very upset because it will be young women at university, young girls at university. I say they're the least at risk. The most at risk are older male gamblers. And you see them jar because it doesn't fit with the narrative that's going on. And somehow it builds into this stigma that even the stigma of suicide cannot admit that gambling is somewhere lurking in the background. So stigmatising is gambling. And I think that's something hopefully your research and one of those will start to address. Why is it so stigmatising compared to Mike Tracer's at the back? We started our life with intravenous drug use. Now that was stigmatising, but this is working with intravenous drug users. Sorry, Mike. But this is even more. Sorry.
Agnes, whilst Claire composes herself.
Yeah. Stigma, yeah. No, I mean, we've heard a lot about stigma today, and also about multiple stigma. So the ethnic minorities work that's being done, the women's work that's being done, is not just one stigma, but it's multiplied, and that's two groups. There will be other groups. I think there's a lot more work to be done on what does stigma mean? Does it mean different things to different groups of people? And are there different interventions to be able to overcome stigma for different groups of people? I think we've got a long way to go with that, because as you say, drugs and alcohol, it's kind of okay to talk. Mental health is becoming easier to talk about, as someone said, but gambling is still, we still don't, and it's different in different communities.
Yes. Yeah. Bryony?
I guess opportunities in my space would be sort of research opportunities, and I guess what kind of comes to mind at the moment is, so we might understand at a kind of fairly headline level, okay, this is how many people have used different services, for example, but we probably don't really understand the full pathway of how people actually interact with those services. We know that it's can be a very cyclical situation where it's not just people have a gambling problem, they go along once and then they sort of come out of that problem. They can seek help multiple times and go through different kind of stages of their journey, and I think there's probably a lot more we could understand there, as well as probably a lot more about the interaction of different risk behaviours and addictions, the role of alcohol as well. Maybe some of that is what might come out of Agnes's research.
We're going to be so busy.
You're going to give us all the answers.
Right. I'm just going to come to questions on the floor. There's none come through on Slido, so if you're online, then you've got a few moments to send any questions through. But I'm just going to ask one final question myself, which is, Bryony, to you first. What more do we need to understand about gambling harms, and in order to fully adopt it into a public health approach?
I mean, obviously, I'm not working in the sort of public health sphere myself, but I mean, I think probably the things that stand out to me are the things I just said, really. So the kind of complexity of, so do people, do they start with a mental health problem? Do they start with a gambling problem? How do these things intersect? How do other risk behaviours intersect? How do they actually get to that point where they're experiencing harmful gambling and poor mental health and whatever other problems they might have? I think there's a lot of complexity there that probably needs unpicking. So that would probably be my number one thing.
Great.
I think there was some hands up, actually.
Was there? We've got,
gosh,
we've got lots of questions. I wasn't expecting that many.
Maybe they're going to ask Bryony to do all the rest.
Right, I've got no idea whose hand went up first, so I will leave it to Lauren and Dimitri to find the person.
Hi,
there.
you're right.
Hi.
So I'm Ben Howard, and I think mine's probably aimed at Joy. So speaking from personal experience, I handed myself into the police and still waiting in excess of 3 years to be charged. So I've tried to rebuild my life, rehabilitate. I've been stopped volunteer working. I can't get employment. And is there anything that can be done to prevent? Because I know I'm not the only one. That time from handing yourself into being charged and being stuck in limbo, and almost, when I now go through the court system, going to be re-stigmatised, and then family having secondary stigma of having someone in the criminal justice system. So just anything that can be done about that, really.
I've got loads I could say, but obviously let's meet outside this meeting, because that's really important, because we'll link in with your PCC area. That's what we're trying to do. So Alex, who's in prison, we'll link in with the Norfolk PCC to see if anything can be done. I know that Matt Gaskell, the NHS gambling clinics, he's actually writing reports now for sentencing, because there's they're not aware They do have some leniency for drug and alcohol disorders, but they're quite harsh on the gambling issue. So we do need to get that out, but the lived experience and the voices are really important, and they can inform it. So partly, we can pick things up if we're aware of it. So all these people who are working with people with lived experience, and those identify the examples, let us have them, because then we can use them, and it's very, very powerful that we can as PCCs. That's a positive thing. We are in power, and we can affect change, and we can commission services, and we can work with all those agencies that we're saying about, the courts, the CPS, the police, the prisons, probation. All of those people, from start to finish, you need the support. But that story is just horrendous, and we'll definitely pick it up and see what we can do. But obviously, learn your experience during that time can inform how we can present to the PCC. So thank you very much for asking the question.
Thank you.
Next on me.
Hi there.
Hi. Afternoon, everybody. Mizan, delegate from GambleAware. I have two questions. It's not questions, actually, demands or needs. So recently, my appeal is refused from upper tribunal. So all judges agreed there is no bespoke gambling treatment services in Bangladesh, but there is mental health support, though it's very few compared to UK, but you have to go back there. My barrister, he said this is his first gambling related case in his 22 years service life. So we are lived experience, we know how the gambling harm us, but honorable judge, even the GP, I went to the Royal London Hospital Emergency Department. Money in my pocket, I can't stop myself. I'm gambling. So why you are here? You're supposed to go to your GP. You should not come here. So it's emergency issue. I am facing this problem. Like, he's hating as a gambler. So my demand, is there any say about this misjudgment? And another questions. So during pandemic, I start volunteering work each and every day last 3 years with GP Care Group, Food Bank, others in East London. So I can realize how gambling addiction can be recovered by volunteering work. So is there any research work about this ground? Thank you.
Agnes, well, just in terms of your international point, I mean, I think we feel that gambling is not very high up the consciousness in the UK, but I mean, I do a lot of travelling with my job, and I talk about the research I do, and people just look at me blankly because it's really not talked about much in a lot of other countries. For example, Bangladesh. I just come back from India. People just look at you kind of blankly. So
I come from a tiny island in the middle of the Mediterranean that's a sort of gambling centre of the world, Malta. And you can't escape gambling, but there are no gambling treatment services, and it's still seen as normal as going and buying sweeties, and the denial around the problem and is quite amazing. So I do sympathise. And with respect to the volunteering, I don't know the research in gambling, but I certainly know that in the drugs world and the rehabilitation of offenders, volunteering is a really, really good way of getting self-esteem back, of getting back into the habit, sorry to use that word, of working a routine. So, but you're going to find the research, aren't you?
Yeah, absolutely. It's all going to be done this time next year.
No pressure, Agnes. Super, thank you. So I don't know if there's a mic over here. Martin.
Thanks, Martin Jones. A couple of observations and then a possible area of opportunity. First to Joy, I'm working with Steve Watts, who's now left us to go home, on the Police Scotland work, and it's you're right to flag that upstream of the custody suite, sudden death, missing persons, domestic violence are all key areas, and then downstream of the custody suite, when people get to court, they're often there on their own. They ought to be there with the operator who has failed to take due care on protecting them, the regulator for allowing the operator to do that, and the banks who stood by the sidelines and watched the train crash. In terms of suicide, we don't record it very well.
And we also don't put it on the certificate. If somebody died of of a heroin or alcohol addiction, it's put down as part 2 or part 3.
Yeah,
BSc.
the questions that can get to the answer, because the test is balance of probabilities. Was there a suicide note? What do friends and family say? What do treatment records say? What do the banks say? What do the operator's DSAR records show? That could lead on the balance of probabilities to identifying them, but the coroner's guidance note 17 says you can do it, but you don't really need to. Probably in Scotland, Procurator Fiscals may be a bit more curious and answer those questions. You know, if Arun's in the room, he's got my Hail Mary project, which would take the ONS data set of roughly 5,500 suicides in England and screen those against treatment records, bank records, and DSAR to learn the lessons, which could really give some insight to that. The opportunity really comes from the finance sector, which I'm surprised we haven't heard about, except very briefly in passing a couple of comments. They've recently got a new consumer duty of care, and they are the other group of people, along with the operators, who can see gambling harm happening in real time. And that transaction at 3 a.m. in the morning isn't just an accounting line item, it's somebody there sweating on the bed, shaking, trying not to hit the button. So the opportunity is they can see that. They're in a bit of a quandary because they don't know what to do with that information. And so there's potential for the gambling harm arena and banks to get together and get a grip of some of this.
Thank you, Martin. Katie?
Yeah, it was just, I was really interested to listen about what you were, sorry. I was really interested to listen about what you were saying about the holistic approach to the sort of the patient, the client. And if you took away gambling, I'm sorry I'm looking at you, Claire, it was because you sort of made that sort of comment. And I wanted to sort of ask the panel around the opportunity for social prescribing and how actually it's also about what else we can do for the sort of client. So actually if you take away the sort of gambling, the role of social prescribing to maximise people's income, to help them with their sort of debts. And I think that hasn't been perhaps picked up quite as much as it could have in today's sort of conference. It's been quite a lot around teachers, education and things, but I just wanted to really sort of shout out that there's a massive opportunity for social prescribing, albeit it will need to be funded.
I'll answer briefly. I do have a concern because every single meeting I go to, whatever it is, whether it's management of diabetes, obesity, addiction, the social prescribers are going to sort it. And the social prescribers, and I'm not Helen Stokes Lampard's into are a group that vary from those with lived experience to those that university degrees who've been doctors for the whole life and now have retired. So, and we're also we're also asking them to do so much, from taking people to walks in the park to sorting out their financing. And I think what we're actually saying is there a network of people who can have additional skills and roles in order to be able to support the work that needs to be done in terms of follow-up? Absolutely. And then let's work what goes on. But I think we've got to be really mindful, watch this space, because just everywhere you go, the word social prescriber comes up as if they are this new enormous workforce that's going to sort all of our problems out. I'm not sure they are.
Yeah, when people say send them to citizens' advice, there's like, we can't cope with the capacity. We need
No.
You can't send more people to our home. We can't take referrals from anybody.
No.
Can I I want to just come back on the Police Scotland and also yours. On the suicide one, it's really distressing. But when I used to be local government association national licensing champion, we were lobbying for the fixed odd betting terminals, from 100 to 2. And when I went back to my local authority and I knew there'd just been some research around suicides, and I asked, oh great, have you got the information? And it's down to money worries. I think it's that next level of questioning that you need to do. What are your money worries and where they're coming from that might indicate gambling? So I know there's people who are going for payday loans, people who are going for help. If you understand what it is, then you can signpost people potentially to the GPs, to the clinics, to the services. So I think intelligence is really, really important, but it's asking the questions. And if we don't have that relevant depth of information, it's very hard to do the research as well. So.
Great, thank you. Unfortunately, we've now got the timer sign, but obviously after Zoe's concluding remarks, there'll be an opportunity for networking and for you to ask any questions afterwards. So just leaves me to say that a huge thank you to all of our panel, a really interesting conversation to almost end the day, so thank you very much.
Thank you. I'll start talking as they leave the stage because I'm conscious we've run out of time, and I'm conscious that there's a room of drinks and networking to be done next door. So I obviously wanted to start by thanking everybody for joining us today, whether they be in the room or remotely, and particularly to the speakers and the panellists for sharing their fantastic insights and ideas as to how we can truly tackle gambling harm. I've really noted that this year we've heard much more, quite rightly, from the voices of lived experience. I thought it was particularly interesting to hear from Joy, from the Police Crime Commissioner's perspective, because that is a very fresh voice for us in this particular room. There's clearly so much more we can do, but I think the fact that we've had the honour of hearing from 2 chief medical officers is testimony to the fact that this is now recognised formally as a public health issue. And that for us is a critical step in making a long-lasting impact. I was particularly struck by Professor Sir Chris Whitty when he spoke about the hit after hit after hit on deprived communities, with gambling after lung cancer, alcohol, and now the cost of living crisis. The way that he focused on 3 areas: the need for more evidence, which I think has been spoken to loudly during the course of the day, the focus on help where it is needed most, and the need to protect children, and to use his words, the fact that it was totally unacceptable that children were impacted by gambling harm and the need to be better protected. It was also great to hear from the CMO, Frank Atherton, talking about particularly not just the normalising of gambling, but the people as an income stream rather than as a whole person. And I thought that's why the power of Lisa's words and many others really struck a chord today. It was also refreshing to hear from Guy from the Youth Advisory Board, my goodness, there, as we said, as a politician in the making, talking about the importance of integrating youth voices in the agenda. We're clearly at a pivotal time. I know I say that every year, but this last year has been challenging. There's no doubt. The delay to the publication of the white paper has created polarisation, with different interest groups focused on political advocacy at a time when collaboration is key to deliver a shared vision of a society where everyone is safe from gambling harm. The delays have limited progress in some areas and provide an unhelpful distraction from the most important focus, protecting those at risk or those experiencing gambling harm. Every day that paper is delayed is another day where we lack the certainty, the stability, and the oversight to deliver a coherent public health strategy and a whole system approach to tackling gambling harms. However, despite the delays, there has been huge progress in other areas. The extensive programme around the recommissioning of the National Gambling Treatment Service, led by Anna here, is a programme that's been welcomed by providers across the system, leading to a new approach which will ensure service integration at a local and national level so that people can move seamlessly through services and receive the right help for the right needs for their time. I want to thank all of those organisations and those with lived experience who have played an invaluable part in the review process, which, whilst ongoing, is a marked step change in the way that the third sector will work alongside and in partnership with the statutory sector. 10 years ago, as Liz said, in fact, I think you're probably the only person who was there at the time, perhaps not, but we held our very first conference at this site with, I think, just over 100 participants. And since then, the charity has grown and evolved to becoming an even more independent, robust, strategic commissioner focused on securing holistic support for people experiencing gambling harm and ensuring that there is a prevention framework to protect those that may be at risk. A public health model sits at the core of our work as we increase investment behind education and behaviour change campaigns. There has never been a more important time for us to work together. The big change between last year and this year as we've moved from the pandemic to a cost of living crisis, growing inequalities and the growth in online gambling are creating that storm that we are concerned will put many more people at serious risk of gambling harm. It is clear we have to act now. We must forge and deepen the collaborative partnerships, an issue that David Quinty referenced, and we must work together to ensure that those harms are clearly understood and a whole system approach is taken. We must ensure that everybody across every part of society can access the advice, support and treatment they need when they need it. Last week, and in fact Steve touched on it earlier, Bloomberg ran a story called "Britain Opened Its Door to Online Gambling. Now it's living with the consequences." An article that went on to document the UK's relaxed approach to the dangers of gambling, helping to transform it into one of the world's biggest regulated, sort of, betting markets. This piece concluded that it was an object lessons in the dangers now confronting the US as it emerges as the industry's new frontier. I just hope that by the time we convene at our next conference in a year's time, there will be a new chapter in the history of gambling regulation in this country that will set out an example that the US can glean from, a different example on how to prevent gambling harm becoming a public health issue, and recognizing that gambling harm can affect anyone. So for now, I thank you for your time and your contributions today. I'd particularly like to thank Liz for her excellent chairing of the day, as ever. I'd also particularly like to thank the team at GambleAware, many who have joined us during the course of this last year, for their individual, their personal, and their collective contribution to implementing our programmes of work, and with it, bringing further rigour, scrutiny, professionalism, and insight to the delivery of our strategy. I'd also like to thank the team responsible for delivering today's event, which I can tell you behind the scenes is no mean feat. But particularly, I'd like to thank Lawrence, who he did half organise the Queen's funeral, so I knew that we were in good hands. And also to Sarah, who, beyond running the day job around comms and our public affairs and many other aspects to GambleAware, also managed to make sure that this conference was seamless in its agenda and content. So for the rest of you in the room, I'd like to invite you to join from some networking drinks, and thank you for your time and attendance.